गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः। गुरुर्ब्रह्मा गुरुर्विष्णु गुरुर्देवो महेश्वरा गुरु साक्षात् परब्रह्मा तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः तस्मै श्री गुरवे नमः।
Good evening, everyone. It is with great pleasure that I extend a warm welcome to each one of you to Sampuraka National Seminar with paper and poster presentation presented by Team Ayurapta. Respected faculty members and distinguished participants, a warm and gracious welcome to each one of you. So, we are completing this journey here today, and thank you for being here. Let's engage this moment with a spirit of collaboration. And before we get started, let me remind you something. Dear participants, please follow our rules. The presentation will be live on our YouTube channel and the copy will be saved. So please don't unmute yourself unnecessarily. You have a maximum of 8 minutes to present your topic. So kindly follow the same. So once again, thank you all for joining here. Let's start with the first presentation. For that, I invite Dr. Vidya Ramchandra for the paper presentation. I invite Dr. Vidya Ramchandra.
Hello, Dr. Vidya.
Hello.
Hello. You are audible, doctor.
Yes, sir. Yes, sir, I'm present.
Yeah, please share, doctor. Please share the screen, doctor.
Yes, sir. Am I visible?
Your screen is not visible, doctor.
Is screen visible?
Not visible, doctor. Not visible.
1 minute, okay? Hello?
Hello. Doctor, your screen is visible. Can you please open your PPT, doctor? Okay, now your screen is visible, doctor.
Yes, sir.
Please start the session, doctor. Your screen is
Okay,
visible.
okay,
Please
sir.
start the session, doctor.
Good evening, all. The topic of my presentation is a review on concept of Trividha Pareeksha and its importance in diagnosis of diseases. Okay, in topic, I'm going to tell you how how our Trividha Pareeksha will help us diagnose the diseases. So introduction is in Ayurveda, the extensive realm of diagnostic tools unfolds within Roga Pariksha and Rogi Pariksha. The significance of this examination is encapsulated by the words of Acharya, who stated Rogam Ado Pariksheta Tatanantaram Aushadhi, emphasizing the imperative connection between thorough examination and subsequent treatment. So, before comments on any therapeutic intervention, a profound understanding of both Rog and Rogi is deemed essential. So, among the diagnostic methods under Rogi Pariksha, Trividha Pariksha, that is Darshan, Sparshan, and Prashna, holds prominence. This paper seeks to delve into the ancient clinical examination, specifically Rogi Pariksha, unraveling its relevance in the contemporary era. The exploration aims to bring the wisdom of traditional Ayurvedic diagnostics with the demands and opportunities of this healthcare system. So, the objective of this paper is Trividha Pariksha as a diagnostic tool aiming to enhance the comprehension of clinical examination from an Ayurvedic perspective. Methodology used for this paper presentation is detail the methodology applied to investigate Trividha Pariksha as a diagnostic tool. This encompasses a thorough literature review. So basically, it is a literature review. So Trividha Pariksha, what is Trividha Pariksha? Acharya Sharak explains Trividha Pariksha as Aptobdesh, Pratyakshna and Anumana. Whereas Acharya Vagbhat explains Trividha Pariksha as Darshan, Sparshan and Prashna. Roga Pariksha should be done with the help of Charakokta Trividha Pariksha. And Rogi Pariksha should be examined with the help of Vagbhatokta Trividha Pariksha. So for the Roga Pariksha, we're going to use Charakokta Trividha Pariksha. That is Aptobdesh, Anuman and Perception. And for the Rogi Pariksha, we are going to take help of Vagbhatokta Trividha Pariksha, which is Darshan Sparshana Prashna. So Rogi Pariksha, Darshana Sparshana Prashna Pariksha Rogina. So Darshan in the modern concept, darshan is explained as inspection or observation. In sparshana, palpation, percussion, and prashna is interrogation. While doing an examination, the physician should view the body of the patient, that is darshan. Touch it with hands that is like sparshan, and inquire about his complaints, that is prashna. So the darshana pariksha. Those factors that are elicited by chakshurendriya falls in this category, like general features, normal and abnormal colors, etc. So the factors to be examined by Darshan Pariksha are Vay, that is age, Varna, that is color, Sharir, that is nature of the physique, Indriya, that is sense organ. Are they um, doing good or not? So if we see current clinical methods regarding Darshan Pariksha is inspection, in which clinical examination is shape of the abdomen or chest and the movement of the abdominal or chest wall with respiration. In abnormalities like scars, stretch marks, lesions, dilated veins, or rashes, wounds due to trauma or burn injuries can be seen by inspection. Color changes of tongue, eyes, sclera, nails, gums, teeth, etc. If we see the example of inspection, then blue or black discoloration of skin, which can be stated as cyanosis, thrombosis, blue baby syndrome, red discoloration, then skin inflammation, sclera, subconjunctival hemorrhage, fingertips, Raynaud's disease. So, if we see the discoloration of skin, then it can be inflammation, discoloration of sclera, then subconjunctival hemorrhage, discoloration of fingertips, it can be considered as Raynaud's disease. Yellow discoloration of sclera means injury, expanding, browning. Also in inspection, radiological examination included, which means the X-ray, CT scan, sonography, 2D echo, ECG. Since these are observed visually and by the examiner radiologist directly, they can come under Darshan Pariksha also. Means Darshan Pariksha. It refers to the features that are elicited by touching the affected part of the patient which physicians have. Darshan Pariksha helps in finding the added information which are not accessible by Darshan Pariksha. Factors to be examined to touch are the qualities like cold, heat, smoothness, roughness, softness, hardness, etc. and joy. So for the Aiyesha Gulfam, etc. So current clinical examination. In current clinical examination, we are going to see palpation and percussion, which are related to inspection, pariksha, palpation, light palpation and deep palpation. In light palpation, examiner tests for any palpable mass, rigidity or pain on the surface. In deep palpation, examiner is testing for any organomegaly. So the reaction that may indicate pathology during palpation include like muscle contraction as pressure is applied, rigidity indicating peritoneal inflammation, rebound pain or release, refer pain that is pain produced away from the area being palpated. Then percussion. Percussion is done by tapping middle finger of one hand on the middle phalange of the middle finger of the palpating man over chest or abdomen. The different sound types produced due to difference in density indicated disease condition. That is, dull sound indicate consolidation. Alteration in density is seen in pneumothorax. In Prashna Pariksha, the Nidana of the disease can be known only after proper Prashna Pariksha of the patient. To know about the complete details of the diagnosis to its symptoms, it is necessary to have a good interrogation with the patient to make an appropriate diagnosis. Prashna Pariksha can be done in following format. प्रमुख वेदना, वर्तमान व्याधि वृत्तांत, पूर्व व्याधि वृत्तांत, फूलज वृत्तांत, व्यक्तिगत, व्यावसायिक, सामाजिक वृत्तांत. In current clinical methods, interrogation is related with Prashna Pariksha. In interrogation, we're going to test the identifying data and source of history, reliability, chief complaints, history of present illness, history of past illness, family history of patient, personal history, and social and occupational history of patient. Also, treatment history. So the discussion part of this paper is proper recording of Vyadhi Dikshant, Vyadhi Avastha, Chikitsa Vrittam from the patient is necessary and helpful in treating the patient in a better way and also to analyze. Without knowledge of previous pariksha, examination of a patient can't be done and hence a proper treatment can't be advised. So, knowledge of previous pariksha is mandatory for a good clinical practice. Physician should be expert in darshan, sparshan and prashna pariksha because it also has application in modern diagnosis. X-ray, MRI, CT scan, endoscopy, USG are nothing but indirect darshan pariksha with the help of modern technology. Sparshan pariksha like palpation, percussion is also practiced to diagnose abnormalities which can't be known through direct observation. Lastly, Prashna Pariksha is the most important examination tool which helps Vaidya to attain more detailed information about the rog and rogyavastha. History taking is the pearl of Ayurveda and Vaidya should be expert in this. A disease can be known only through proper combination of all these examinations that is darshan, sparshan, so, and Prashna methods only. Trividha Pareeksha sets serve as their forums for the investigator and also serve as the best way for assessing the patient within short time with less effort. Now, conclusion. Hence, from all the studies, it can be stated that Trividha Pareeksha is a boon to us for a successful clinical practice. It gives a direction for current diagnosis. Though modernization has been done for various diagnostic methods, but Trividha Pareeksha will always have topmost priority for the examination purpose. So, to become a successful Vaidya, one must have a sound knowledge of Trividha Pareeksha, that is, Darshan, Sparshan, Prashna Pareeksha. Thank you.
Thank you, Dr. Vidya.
Thank you, Dr. Vidya. So next I invite Dr. Sneha Ramrao Raut. I invite Dr. Sneha Ramrao.
Hello, Dr.
Good
Sneha.
evening, ma'am. Good evening, ma'am.
Good evening, doctor.
Good evening, doctor.
Okay. I'm sharing my PPT.
So, doctor, please share, doctor.
Yes.
Your screen is visible, doctor. Please start the session.
Okay, sir. Good evening, all of you. Today's my topic is Ayurvedic management of Vichachika eczema, a case report. And myself, Vidya Ramchandra Pandikode, PG Scholar, Department of Kaya Chikitsa, Vidarbha Ayurveda Mahavidyalaya, Amravati, Maharashtra, and my guide is Vidya Vaishali H. Wankhede, HOD Guide, Associate Professor, Department of Kaya Chikitsa, Vidarbha Ayurveda Mahavidyalaya, Amravati, Maharashtra. Abstract. In Ayurveda, all skin diseases are included in Kushta-roga. Kushta-rogas are classified mainly into two types, Mahakushta, Kshudra Kushta. Mahakushta then further classified into 7 types and Kshudra Kushta classified into 11 types. Vichachika is one of the types of Kshudra Kushta. Vichachika is often correlated with eczema based on clinical types presentation. In modern science, there are no sure cure treatment other than steroids for eczema, whereas Ayurveda treats eczema from the root. A 55-year-old male patient approached in the OPD of Kaya Chikitsa JNT Hospital Vidarbha Ayurveda Mahavidyalaya Amravati with chief complaints of blackish discoloration on the anterior part of bilateral ankle joint, itching, cracking, watery discharge from cracked skin. The patient was given complete Ayurvedic treatment for 3 months and the result was remarkably seen. There was significant improvement in the symptoms, hence the study was taken to prove that the Ayurvedic management has a great result in Vichachika. Keywords: Vichachika, eczema, Mahakushta, Kshudrakushta. Introduction. Ayurveda is a search house of time-tested and effective recipes for treatment of several obstinate and incurable diseases. The skin is one of the largest organs of and mirror of image of the body. Skin constitutes 16% of body weight as per symptomatology. Body weight. As per symptomatology, Vichachika has been directly correlated with dermatitis in modern science, which is defined as non-contagious inflammation due to low-grade infection of skin characterized by erythema, scaling, edema, vesiculation, and oozing. In today's medical practice, there is no suitable therapy for chronic skin infection. Only local use of steroid produce symptomatic relief in Ayurveda. Symptomatic relief in Ayurveda, Shodhan and shaman are the main therapy option for Vichachika. In maximum cases, patients of Vichachika who have tried kinds of allopathy medicine and do not get much relief come to Ayurvedic medicine with great hope for curing. And our Acharya has described great remedies for various skin diseases. Vichachika is Kapaj Vyadhi, hence the drugs which are given are Kapagna and Kledagna. Case report as follows. Here 27 is by mistake. The age of patient was 55 years. A 55 years old male patient approached to OPD with chief complaints of blackish discoloration on the anterior part of bilateral ankle joint, itching, cracking, watery discharge from cracked skin. He had constipation and all above complaints were since 2 years. He was known case of hypertension since 13 years and there was no history of any other systemic disorder. History of personal illness. The patient was normal before 2 years. He developed itching and blackish discoloration on the anterior side of bilateral ankle joint. After 3 months, he developed cracking or discolored area. Patient was veterinary doctor, so he knew about allopathy medicine and he took medicine for 4 months. But disease was not cured. Hence he consulted to dermatologist and took treatment for 6 months, allopathy treatment. With the treatment, symptoms were decreased but not cured completely. After a lot of treatment, the patient stopped allopathic treatment and came for Ayurvedic treatment in our OPD. Personal history, occupation, veterinary doctor, bad habit, tobacco chewing. अष्टविध परीक्षा नाडी 74 per minute, जीवा साम, मल असम्यक, मूत्र सम्यक, शब्द स्पष्ट, स्पर्श समशीतोष्ण, दृक प्राकृत, आकृति मध्य, बल मध्य, रक्तभार 130/90 mm of Hg. Objective to study the effect of Ayurvedic treatment on Vichachika with special reference to eczema. Discussion. As mentioned in text, Vichachika is caused due to apathy in ahar, vihar, that is consuming new grain called fish, excessive salty and sour food items, sleeping after meal, insulting peers like Brahmin, Guru or other respected person, etc. Kapha and Kapha is the predominant dosha involved in Vichachika. Gandhak Rasayan acts as Kaphagni and Kledagni action Arogyavardhini. Sorry, sir, this slide. Oh, the main part of my PPT is missing here. I had given him in discussion there is details. Arogyavardhini, Gandhak Rasayan, Trifalakwat for Dhavanartha. Okay, and he had constipation, so I had given him Gandharva Haritakivati. Jiva was Sam, so I had given him Ampachakvati. And ointment, itchy ointment for curing wound. And the result was in this case the oral reduction in Kandus, Dava, Shavata, Rukshata as noticed. The above Shaman Aushadhi helped in achieving better result in treating Vichachika. Conclusion. Vichachika can be compared with eczema of modern science. In modern science, there are limited scope of treatment, but Ayurveda has many treatment modalities which help for the successful treatment without any complication. My references are here. Thank you.
Thank you, Dr. Sneha. Thank you for the presentation.
Thank you, doctor. So next I invite Dr. Ashwini Supekar. I invite Dr. Ashwini.
Hello.
Hello, Dr.
Yes,
Ashwini.
doctor, you're audible.
Can you share my slide?
Your screen is visible, doctor. Please start the session.
Myself, Dr. Ashwini Supekar. I'm currently studying. I'm currently at second year Sandhigata department at w.s.r.to Ayurveda College. And today my topic for course study is an Ayurvedic approach to lymphedema paradox, which reference to purishdharakala. So basically, what we will see what is lymphedema paradox. So lymphedema paradox is a type of primary lymphedema, a condition where there is swelling due to accumulation of lymph fluid. Paradox means onset of symptoms before the age of 35 years. So here we have seen that the patient is developing this swelling since the age of 12 years. So this is the condition. This is often caused by underdeveloped or impaired lymphatic vessels, leading to poor drainage. So these symptoms are that is buffalo hump on the dorsum of the foot and loss of ankle contour. We have seen that the stemmer sign is also positive in this condition. We do the stemmer sign by pinching the skin at the base of the second toe or middle toe. If the skin can be lifted and pinched, then the test is negative.
In modern science, in modern science, compression bandaging, manual lymphatic drainage massage, liposuction, and swimming. This treatment can be given. In Ayurveda, we can correlate this with purishdhara that causes because of irritation of vata and due to obstruction of and Vidya. So Samprapti or Purushamba is that the Vata dosha aggravates and the aggravated Vata dosha disrupts the normal Pachan process and leads to arm formation. And then this Vata dose along with arm circulates to the lower body, causes disruption of the normal functioning of the muscles and joints, causing stiffness. This continues to happen and causes further stiffness, rigidity, swelling, and heaviness in the lower limb. Uh, in Ayurveda, we can give the treatment like Valuka plate, Prachan Karma we can do. We have done Prachan Karma in this patient. You can see the picture. And we have given Gul and Gomitra Yog. We have done Udvartan with Sarsa and Saranja Churna. And we have given orally Tripura Putty with honey, and we have advised patients to do sleep. Uh, in Prachan Karma, we have taken small linear incisions over the foot from knee to ankle joint. Small incisions were taken with blade number 15, not too deep and not too shallow, up to the subfoot level. And then after that, tight bandaging was done over it to ensure that bleeding don't occur. Hello.
Thank you, doctor.
Hello, doctor.
Thank you for the presentation, Dr.
Thank you,
Ashini.
doctor. So next I invite Dr. Kirti Hanumant Jadhav. I invite Dr.
Yes, ma'am.
Kirti Hanuman.
Good evening, Dr. Kirti.
Good evening, sir. Just a minute, sir. I am going to share my screen.
Okay, doctor. I think, Dr. Kirti, I think you have some network problem. Hello, Dr. Kirti. Hello, Dr. Kirti, can you hear me? Hello, Dr. Kirti, can you hear me? Hello, Dr. Kirti, can you hear me, doctor?
Dr. Kirti. So next I invite Dr. Manasi Gaikwad. I invite
Hello.
Dr. Manasi.
Yes, ma'am. Present.
Dr. Mansi, please share the screen, doctor.
Yes. Yes. Is it
Now your
visible,
screen is
sir?
visible, doctor.
Okay. So I'll start my poster presentation.
Please, doctor, please start.
Good evening, everyone. I'm Dr. Mansi Gaikwad, PG Scholar, second year from Stree Rog and Prasuti Tantra Department from Dr. D.Y. Patel College of Ayurveda and Research Center, Pimpri, Pune. So topic of my poster presentation is Sutika Paricharya according to Charak Samhita. So Sutika is a woman who has just given birth to a child followed by the expulsion of the placenta. And the care given during this period is called Sutika Paricharya. So different acharyas suggested a different period of Sutika Kala, like Charak Acharya not specified the Sutika Kala, Shushrut Acharya 45 days, Ashtang Sangraha 45 days or till next Rajodarshan, Kashyap Samhita for 6 months. So motherhood is all about loving, sharing, sacrificing and struggling. Ayurveda emphasizes much importance of care of women, especially in prenatal and postnatal period. So the proper postnatal care should be taken. If it is not properly taken, it can be life-threatening to mother and baby. So the postnatal period begins immediately after the separation of placenta and extending up to the 6 weeks. So it is also called puerperium or puerperal period. So during the time of labor, mother undergoes the tremendous changes and physical exertion becomes extremely deliberated physically and mentally. So it's lead to the rearrangement of doshas, especially Vata dosha. So these changes cause general weakness, pain in abdomen, lower backache, loss of appetite, dysfunction of bladder. Mother also suffers from the dhatu kshayas. So the two major demands of viparium are care of proper involution of genital organs and ensuring proper lactation. So the principle of Sutika Paricharya are, as I have mentioned in poster. So principle are Agni Dipan, Pachan, Raktavardhan, Stanyavardhan, Yoni Sanrakshan, Garbhashay Shodhan, Dhatu Pushti, Koshta Shodhan, and Balya. So drugs used in Sutika Paricharya of Charkacharya are Pipilyadi Churna. It contains the Pipili Mool, Chavya, Chitrak, Shunti, which are Ushna, Tikshna, Dipan, Pachan, Shulagna, Kapha, Shaman. It triggers normal Yonigat Strav and Garbhashay Shuddhi. So other drugs used are Vidarikanda and Tel, which are used for Bruhan. So Pipiladi Churna given with the Sahapana of Grita, it acts as a Rasana and it helps to correct the Dhatu and Upadhatu development. So now Sutika Paricharya, according to the Charkacharya, are Charakacharya advised Ahar, which is Snehapana, and Yavagupana, which is medicated with Pipili Mola, Chavya, Chitrak, Shunti. So Yavagu is easy to digest and helped in Agnimanda. It is also easy to cook. So the Anupana is Ushna Jal. Charkacharya also advised the Bruhan drugs from 6th day after delivery. So now we will see the Vihar Paricharya. So that is Abhyanga, Udarveshtan, Parishek and Bruhan. So Abhyanga on Udar, Kati, Prishta with Tel is advised, which helps in Bruhan, Tvak Prasadan, Stairya, Balavarna Prasadan, Shula Prashaman, and Garbhasha Shodhan. So Abhyanga with Tel increases the blood flow of local area through vasodilation and tones the pelvic organs, enhances wound healing. So now Udar Patta Bandhan, that is wrapping the abdomen with a long and clean cotton cloth, helps the abdomen to rectum to return its natural position, prevents vata dosha vitiation by compressing hollow space left after the fetus delivery. So third is parishek. So parishek means the pouring hot water in a stream. It helps as vata kapahar, vednahar, does agni dipan, vak prasadan and strota nirmalta, so that abnormal blood clots accumulated in blood cavity are excreted and vata dosha subsides. So next paricharya is bruhan. So Vidarikanda Churna with cow milk is advised. It helps to increase breast milk with its Madhur Rasa, Guru Snigdha Guna, Madhur Vipaka and Shita Virya. So it is Dhatu Poshak, Dhatu Shodhan, hence increases the Upadhatu of Rasa, that is Stanya. So thank you. I'm done with my poster presentation.
Thank you, Dr. Manasi. Thank you for the presentation.
Thank you.
Thank you, Doctor. So next I invite Dr. Kirti Hanuman Jadhav.
Good evening, ma'am.
I invite Dr. Kirti. Good evening, Doctor.
Sir, please share the screen for me.
Sure, Dr. Kirti. Please start the session, doctor.
Myself, Dr. Kirti Jadhav. I am final year PG scholar from PDA's Ayurveda College, Nigri, from Department of Swasthya Vrutta. So my topic for today's presentation is Dinacharya and its cosmetic effects. What are the activities that come under Dinacharya which can be utilized as which has the cosmetic effects? These are the Dinacharya schedules from all the three Samhitas, Brihatrayas. So we are going to start which are the beauty enhancing Dinacharya regimens. First one is Brahma Muhurta Uttishta. It is waking time for a healthy individual, which is 2 muhurtas, approximately 1 hour and 36 minutes before sunrise. Swasthya Rakshana Ayushyam, and it also synchronizes our body with natural biological clock. Hence, it helps to enhance beauty. Oral hygiene in this category, we have first Jivva Nirlekan, that is tongue cleaning. Jivva Nirlekan should be done with the help of instrument which is smooth, soft, 10 to 12 angula in length, which should be made of silver, gold, or iron. Benefits: it removes the bad taste, odor, cures edema, stiffness of the tongue, and enhances the taste sensations. Danta Dhavana, that is brushing of teeth. One should brush in morning and night, that is twice a day, uh, after intake of the food, with Arka, Khadira, Karanj, Kakub, that is Arjun. It brings about freshness, takes away the bad odor. Coating of the teeth is reduced with Danta Dhavana. It also reduces kapha, clears the mouth and desire, increases the desire for food. Next, in oral hygiene, we have Gandusha, that is gargling. Mouth is completely filled with Gandusha Dravya and kept without movement. Is called Gandush, and in the thing in which products are moved inside the mouth is called Kavala. So every day, daily Taila Gandush is should be done, and benefits are Sukha, Ushna, Udak Gandush, removes Aruchi, also Kapha Praseka. Along with that, if we do Taila Gandusha per day, we have Danta Darde Karma, Hanubalatva, Swarabalatva, Vadana Upachay, and Asya Kantashosh. Oshtasputan also gets reduced. That's it. Next, we for eye care, we can do Anjana, that is Collyrium daily. It is more eye is the most important most important sense organ. So to protect that, we should apply Anjana every day. Gold ornaments clean by means of oil, cloth, and hairbrush. Similarly, application of Anjan clears the human eyes. We can use Rasanjan or Srotanjan daily. Along with that, we can also use normal Gogruta for Anjan also, daily Anjan. Nasya, we can do it in the morning and also at the bedtime, or otherwise, 8 times for ideal Nasya are mentioned in Samhitas. In this, we put medicated ghee or oil through nostrils. Head is the Uttamanga, therefore, nasal cavity is directly connected with head and sensory neural structures of the brain. And thus, when we put medicated oil or ghee through the nasal cavity, it reaches Shringatak Marma, which is the seat of all the centers of vision and other sensory organs. The most important oil preparation, as told by Charaka, that is Anutai, which should be used as a Pratimarshan also. Daily installation of the nasal drop should be done. Abhyanga, hair oil application is used on the skin. As skin nourishes the skin, through skin we can reach to dhatus depending on the duration of Abhyanga. Daily practice of Abhyanga delays aging, cures tiredness, vata disorders, improves vision. That is Padabhyanga, especially for that. Then nourishment, life, sleep, good luster, skin, and strength. This should be done specially to head, ears, and feet. In this modern era, different types of massage are useful as a cosmetic point of view. Therefore, Abhyanga is the most important dinacharya procedure for healthy skin and good complexion and thus beauty enhancement. Padabhyanga, as I said, it is mentioned in Samhita. It removes dryness, stiffness, roughness, tiredness, and numbness instantly. Also, it makes the skin smooth, provides strength and stability to feet, and also improves vision and pacifies vata dosha. Shirobhyanga, daily practice for head massage, for reducing the baldness, graying, hair fall, to strengthening the hair roots. And it also softens the skin, nourishes the sense organs, and provides luster to the face. Udvartana, this should be done after oil application, that is Abhyanga. If we are supposing to do Snigdha Udvartana, and in Ruksha Udvartana, only dry powdered, that is churna of different herbs are used to massage the skin. Snan, taking bath is auspicious, enhances virility, longevity, strength, compactness, and ojas. And in this, we must tell the patients and other people also to do snana only when they are empty stomach, not when they are having food. So these are some references that I have used for this PPT. Thank you so much, everyone.
Thank you, Doctor.
Thank you, Doctor.
So next, I would like to invite Dr. Arjun K.
Good evening, ma'am.
I invite Dr. Arjun. Good evening,
Good evening,
Doctor.
Dr.
Yes, this is
Arjun.
me, Arjun K. So let's share my screen.
Yeah, sure, Doctor.
Your screen is visible, Dr. Arjun. Please start the session.
Yes. Good evening. My name is Dr. Arjun K. Third year Shalya Tantra Department from Sri Shiva Vishwaruru Medical College, Inchal. So my topic is a randomized comparative clinical study to evaluate the efficacy of Aragvadadi Kashaya Prakshalana followed by Swarjikadi Taila Pichu and Jatyadi Taila Pichu application in the management of Dushtarana with special reference to non-healing ulcers. This is done under the guidance of Dr. R.C. Ekundi, my guide, and Akshay B. Ganachari, sir, my co-guide. So Rana, as everyone knows, is a distressing condition. It can be compared to non-healing ulcer. Rana, it can be classified into Nijarana and Agantuja Rana based on the conditions of Shuddha and Dushtatva. Again, it can be classified into Shuddharana and Dushtarana. I have taken the Dushtarana over here, which says Dushtarana can be compared to non-healing ulcer. Well, this is my thesis study. Coming to my thesis aims and objective is to evaluate the efficacy of Aragadadi Kashaya Prakshalana followed by Swarjikadi Taila Pichu in one group and Aragadadi Kashaya Prakshalana followed by Jatyadi Taila in second group with special in the management of Dushtarana and to compare between the two groups. So my hypothesis is either first group, that is Aragadadi Kashaya followed by Prakshalana followed by Swarjikadi Taila will work. Or the second group work. So my null hypothesis will be both the group won't work, and alternate hypothesis will be group 1 will work, or H2 will be group 2 will be working, and H3 will be group A is more efficient than group B, and H4 will be group B more efficient than group A, and H5 will be both the groups will be equally efficient. So this is the source of data which I have taken. For the literary source, I have taken all the textbooks, journals, and all the previous records, everything I have taken from them. Then regarding the patient samples, I have taken 60 patients having the Lakshanas of Dushtara who came to our OPD and visited our IPD in Shalya Tantra of our college. And this was, my study was initiated after I took institutional ethical committee clearance. Next, the drug source. I have taken drugs for Sojika Ditala and Aragada Kashaya ingredients from KLE Ayurveda pharmacy. Then I have prepared my both the drugs Aragada Kashaya and Sojika in our lab. Then Jata Ditala was taken from SDM Udupi pharmacy. Gandhaka Rasanavati and Intripala Google were taken for internal medicine. These were also taken from SDM Udupi. So coming to my study design will be randomized comparative clinical study. Study type will be interventional study, randomized allocation, and this is an efficacy study with having double group assessment. Main purpose will be the treatment purpose, and masking is open label, no masking is done, and the total duration is 30 days. So the sampling technique is anyone who is okay to get informed with the informed consent and ready for the undergo test, who comes under inclusion criteria is selected under randomly. Then sample size 60, group A with 30 patients and group B with 30 patients. Then diagnostic criteria is the Lakshanas of Dushtarana as told by Acharya Shruta, that is Ati Samvrutta, Ati Vivrutta Rana, ಅತಿ ಕಠಿಣ ಅತಿ ಮೃದು ರಣ ಉತ್ಸನ್ನ ಅವಸನ್ನ ರಣ ಅತಿ ಶೀತ ಅತಿ ಉಷ್ಣ ರಣ ವಿತ್ ಕೃಷ್ಣ ರಕ್ತಪೀತ ಶುಕ್ಲ ಅತ್ಯಾತ್ಮತ ರಣ ದೆನ್ ರಣ ವಿತ್ ಪೂತಿ ಪೂಯ ಮಾಂಸ ಶಿರ ಸ್ನಾಯು ದುರ್ಗಂಧ ರಣ ಕಂಪೇರ್ಡ್ ವಿತ್ ಅತ್ಯರ್ಥ ವೇದನ ದಾಹ ಪಾಕ ಕಂಡು ಸ್ರಾವ ಅಂಡ್ ದೀರ್ಘಕಾಲಿಕ ಬಂದಿರಣ. So my inclusion criteria will be any patient from 30 to 70 years of age group, irrespective of sex, religion, and occupation status, patient presenting with lakshanas of Dushtarana only, and who are fit for Kasha Prakshana and Taila application, and any systemic diseases, but which should be under control, and all types and non-specific ulcers are included. So exclusion criteria will be any age of below 30 years and above 70 years, and any systemic disorders, uncontrolled diabetic or uncontrolled hypertension is excluded. Then patient with malignancy, gangrene, tuberculosis, wounds are excluded. Then HIV, HbSAg patients are also excluded. Then the intervention is group A will be like Aragadadi Kashaya Prakshalana. After that, I will be doing Swarjikadi Taila Pichu for 30 days, and group B same Aragadadi Kashaya Prakshalana, but here Jatadi Taila application for 30 days. And I will be taking assessment on 1st, 8th, 15th, 22nd, 30th day. Investigations are basic like CBC, RBS, and ESR, and basic procedures. Like procedure is Purva Karma, all the required equipments are taken, required drugs are taken for the procedure. Then preparation of the patient is prepared, informed consent is taken. Then Pradhana Karma, wound toileting was done, wound debridement was done with instruments, Rana Pakshalana with sterile gauze dipped in Arakadadi Kashaya. Then Rana was dried with sterile gauze. Then for group A, Swarjikadi Taila Pichu was kept. For group B, Chatedi Taila Pichu was kept. Then a sterile pad was kept on the Rana, and bandaging was done daily or alternatively. Bandaging was done. For Paschat Karma, a patient was given Gandhakarasana Vati and Triphala Gugulu BD, both of them 1 BD for 30 days, and patient was advised to take Lagu Ushna Anabhishandi Bhojana. Then every day or alternate day I used to do the bandaging. For the duration of study is 22 days of trial study followed by 7 days of follow-up. Total study duration was 30 group for both group A and group B. So I took scales from the Bates-Johnson scale for wound criteria. That is 7 scales criteria I have taken. Wound size in centimeter, which I have divided in from 1 to 5. Then wound edges, necrotic tissue type, exudate type. All these I have graded from 1 to 5. Then exudant amount, peripheral tissue edema, granulation tissue, all these things from 1 to 5. These are from Bates-Johnson scale. Wound criteria are Rana Vedana. This is objective criteria. Rana Vedana, that is pain, Rana Daha, Rana Kandu, Rana Durgandha. These have been graded from 1 to 4. Next, statistical analysis. Standard mean, standard deviation were taken. Standard error of mean was taken. Standard error of difference between both the means was taken. Then Wilcoxon sign test was given done for within the group, and Mann-Whitney U test was done between the group. So all at the last mean rank was taken. Then after all these things, for p-value, if the p-value is more than 0.05, it is it was considered not significant. Less than 0.05 is significant, and less than 0.01 and less than 0.001 is highly significant. So these are all the mean data and standard deviation of both the subject and objective criteria before the treatment, after the treatment, and after the follow-up. And this was for within the group. This is in between the group. These are all the overall, this is the overall criteria where patient was after the treatment and after the follow-up, how much he had total relief. Then this was put in bar diagram. Coming to overall treatment of group effect of group A, among 30 patients, 4 were cured, 10 had marked improvement, 7 had moderate improvement, 4 had mild improvement, and 5 didn't had any changes. And this is for group B, slightly more than group A. So 5 were cured, 9 were marked improvement, 6 had moderate improvement, 6 had mild improvement, and 4 had no changes in it. So coming to the discussion, which all taken were Aragadadi Kashaya. It had Aragadadi Kashaya, Gana Kashaya from Ashtanga. It had 20 drugs of Katu Tikta Kashaya Rasa, Lagu Ruksha Tikshna Guna, Ushnavirya Katu Vipaka. So it was best for Rana Shodhana and Ropana. Next is Swarjikadi Taila. It had Swarjikadi Taila had Swarjikakshara, Saindavlavana, Dantimula, Chitrakamula, Shvetarka, Balataka Bija, Apamarga Bija, Tilataila, and Gomutra. All were having Katukshara Tikta Kashayarasa, Lagu Ruksha Tikshna, Ushnaguna, Ushnavirya, Katu Vipaka, and Rana Ropana, and all those features in it. Then Jatadi Taila, everyone knows it. So it had Tikta Katu Kashayarasa, Ushnavirya, Katu Vipaka, and Rana Shodhana and Ropana effect. So coming to conclusion of it, Dushtarana can be compared to non-healing ulcers. So it comes among Shashti Upakramas like Asha Prakshal and Pichu application. And among my study, all the drugs had direct references for Dushtarana, like Aragadudi Kashaya from Astanghrudaya, Swarjikadithala from Vaishajya Ratnavali in Chakradatta, Jatadithala from Sharangara Samhita. And these were all the statistically results from all the both the groups. These were all between group A and group B results. So coming at the end, treatment assessment of treatment was like group A had 27.3% of relief, group B had 40% of relief. When compared overall, 41 to 42% were comparison and 49 to 51%. So slightly group B was better than group A, but both the groups had efficiently good results like 41 and 42%. Like the summaries, alternate hypothesis can be taken for for the thesis. This one, group B was better than group A, and both the groups were better for healing non-healing ulcers. So these were all the ingredients and preparation of Aragadadi Kashaya. These were for Swarjikadi Tela and Jatyadi Tela. These were all Jatadi Gandakrasana Tripala Gugulu. This was the procedure which was taken. Wound debridement, Aragadadi Kashaya Prakshalana, Swarjikadi Tela Pichu, and Rana Bandhana was done for all the patients of 60 group patients. This was group A from which has necrosis, which was healed it in 21 days. Then this was venous ulcer patient from group B. Thank you. Thank you, everyone.
Thank you, Dr. Arjun.
Thank you, Doctor. Thank you for the remarkable presentation. So next, I would like to invite Dr. Lavanya. I invite Dr. Lavanya.
Am I audible?
Yes, Dr.
Yes,
Arjun.
Doctor, you're audible.
Okay, one second, ma'am. Please share my.
Your screen is visible, Dr. Lavanya. Please start the session.
1 second. Good evening, everyone. Myself, Dr. Lavanya U. Am I audible, ma'am?
Yes,
Doctor,
audible,
you're
Doctor, audible.
audible. Please continue.
Good evening, ma'am. Myself, Dr. Lavanya U. My topic is a randomized comparative clinical study to evaluate the efficacy of Sadhya with the Gandharva Stadi Irenta Taila, followed by Agni Lepa and Dhanyamla Dhara in the management of Amavata under the guidance of G.S. Hadimani sir and under the co-guidance of Dr. Akshay Shetty sir. Introduction. The concept of Ama is unique to Ayurveda. The reduced understanding of Ama in general public leads to a repeated indulgence in the Nidana causing Ama. Madhavakara was the first Acharya who elaborated this disease in detail. Ama circulated throughout the body, indulging deeper dhatu, results from aggravated vata dosha. Managing vata dosha becomes an important aspect. Amavata management involves langana, swedana, and utilization of tikta katurasa dravya with the tipana qualities. And my objectives of the study are to evaluate the efficacy of Sadhya with the Gandharva Stadi Irenta Taila, followed by Agni Lepa, and Sadhya with Gandharva Stadi Irenta Taila, followed by Dhanyamla Dhara in the management of Amavata, and to compare the efficacy of both the groups in the management. And my hypothesis is, null hypothesis is there is neither significant effect of Sadhya followed by Agni Lepa, nor significant effect of Sadhya followed by Dhanyamla Dhara in the management of Amavata, and these are alternate hypothesis. Method of collection of data, where 40 patients fulfilled the inclusion and criteria were randomly grouped into two groups, Group A and Group B, comprising of 20 patients. And the diagnostic criteria are the patient presenting with a Lakshana of Amavata and the patients with RA factor positive and patients with increased CRP and ESR level. Inclusion criteria are subjects with either gender presenting with a Lakshana of Amavata and Sadhya Virechana Karma, Lepa, Dhara subject fit for these karma, and the age group between 20 to 60 years. Exclusion criteria are where the systemic disorders and with the interfere with the course of treatment, and subject unfit for Sadhya Virechana Karma, Lepa and Dhara. Sadhya Virechana karma is same for both Group A and Group B, where Purva karma includes Sarvanga Abhyanga with the Maha Vishagarbha Taila, followed by Sarvanga Mridubhashpa Svedana with Ushna Jala and followed by Ushna Jala Snana. Pradhana karma include administration of Gandharva Astadi Eranda Taila with the Kshira as Anupana in the Shleshmagata Kala around 8:30 a.m. to 10 a.m. with 30 ml it is given, where patient made to drink half a glass of hot water when after each Vega. In Paschat observation of Vega, once the Vega is stopped, Patya Ahara was given. Agnilepa, Purva Karma, Pradhana Karma, Paschat Karma include where collection of all the necessary equipments and collection of drawn wet drugs. Wet dry drugs include Lashuna, Lavanga, Marisha, Sarshapa, Haridra powdered in a mixer, and wet drugs like fresh leaves of Agnimantha, Tulasi, Nirgundi were taken and pounded and chopped into small pieces. Both are made into paste form, adding little water. Pradhana karma include freshly prepared Agnilepa is applied in a pratiloma gati, opposite direction to the hair follicle, below the neck area, around 8 a.m. to 10 p.m. And patient is made to allowed to sit in a Nivata Graha. In a Paschat karma, once the paste get dried, it is removed and advised to take a lukewarm water bath, and then patient is advised to take a Lagu Ushna Abhishandi Bhojana. In dhara, the ingredients like tandula, prituka, kulatta, laja, kangubija, kodrava, nimbuka, deepeka, jala. It is taken and then the formulation. For each patient or single procedure, 5 liters of dhanyamla is added with 3 liters of hot water. Then dhanyamla is made indirectly hot with the patient tolerance. Then poured with a height of 12 angula in a circular manner bilaterally using a dhara patra. Then after that, patient body is cleaned with a soft towel made to rest for an hour. Then take a Ushna Jala Snana. Then advised to take a Drava Lagu Ushna Ahara. Then assessment criteria are done based on these criteria. Sandishula, Sandishota, Stabdagatrata, Angamarda, Aruchi, Trushna, Alasya, Gaurava, Jwara, and Apaka. And objective criteria are ESR, RA factor, and C-reactive protein. The observation goes like this. The patient's predominance of 41 to 50 years of age, the 60% of the age, where Sushruta mentioned after 40 years of age, the Dhatu, Indriya, Bala and Virya going to become Kshina. So Samprapti of Tamavata goes with that. Gender were maximum of female patient 57 to 57.5%, where female immunity system is stronger and more prone to the diseases. Occupation or farmers are maximum, where physical work is more and vata vriddhi will be more. Then these are gradings after before treatment and after follow-up. Overall treatment assessment after treatment, before treatment, after treatment, and after follow-up are here. On comparing total improvement in between Group A and Group B before treatment and after treatment is 49% to 59%. And before treatment, after follow-up, overall assessment was 51 to 49%. Discussion. Amavata is an Amodbhava Vyadhi, where disease is Madhyama Marga Roga. Madhavakara considered this Vyasi Sahakashtam Sarva Roganam. Among all the disease, this disease caused significant damage to the Sandhi. Chikitsa of Amavata is been dealt in 2 stages, where Amavasta and Niramavasta. Primarily, aim is to treat Ama Pachana and Nirharana with proper care of Vata, followed by Kevala Vata Chikitsa. Here, Agnilepa and Dharnipadhara is one among Bahya Upakramas. Agnilepa, where it is a folklore practice, consists of combination of Ushna Virya Dravyas and said to bring about the effect of reduction of signs and symptoms of Sandhi, Shula, Shota, Stabdagatrata, Angamarda, Gaurava, Trushna, etc. by delivering their respective guna when applied over the skin. It does the Kapha Vatahara. Ushna Virya of Lepa absorbed by the skin through the Brajakapetta into all the siras. Dhanyamla, it is a sandhana preparation that is having Agneya, Tikshna, Ushnaguna, and most of the ingredients are Ushnavirya, which have combined effect of guna of sandhana varga, thereby showing the effect at the level of skin. Sadhya Virechana Karma implies rapid purgation. This process is administered in condition like Pitta Vyadhi before applying Shodhana or Shamana Aushadhi to cleanse the Koshta, which is why it is also referred to as Koshta Shuddhi. Conclusion. First time Acharya Madhavakara described the disease elaborately with the Nidana, Samprapti, Pratyatma Lakshana, etc. The present study is to compare the clinical study wherein 40 groups fulfill both the criteria with the 20 patients each. Comparison, the effect of treatment was statistically non-significant between both the groups, Group A and Group B, with respect to all the 13 assessment parameters. Statistically, Group A was comparatively better than Group B in 8 parameters like Sandhi Shula, Stabdagatrata, Angamarda, RA factor, CRP, and Group B was comparatively better than Group B in 3 parameters. And Group B has same effect in 2 parameters like Trishna and Jwara. These are my reference. This is Agni Lepa and ingredients of Dhanyamla Dhara, Dhanyamla preparation. This is procedure for Agni Lepa, which is first Sadhya Virechana Karma with Gandharva Astadhira Taila, followed by Abhyanga, Mrudubhashpa Sveda, then Agni Lepa. And this is procedure of Dhanyamla Dhara. Thank you.
Thank you, Dr. Lavanya,
Thank
for the nice presentation.
So next I invite Dr. Sayali Misal.
Hello, ma'am. Am I audible?
Good evening, doctor. You are audible.
Thank you, ma'am. I'm sharing my screen. Okay, good evening all. Myself, Dr. Sayali Misal. I'm from RasaBhaishajya Kalpana, Department of Trividha Medical College, Shevgaon, Maharashtra. My article titled by Dr. R.N. Suryavanshi, ma'am. My topic is the literature review of sandhigata vata and its treatment with the reference to the osteoarthritis. The abstract is the sandhigata vata is a degenerative joint disorder. Lifestyles play a very important role in sandhigata vata. As it described under the Vatvadi, almost every literature of Ayurveda, this disease mainly gets aggravated in the old age, as well as the dhatu undergoes shaya, which lead to the aggravation of vata. It is also prevalent in the younger generation. Osteoarthritis of the knee joint, which is almost identical to sandhigata vata, described in the Ayurveda with respect to the etiology, pathology, and clinical features. It generally limits the activity of the day-to-day life. By taking treatment with random modern medicines like analgesic, steroid, etc., which give relief for a limited time period, but continuous using of such medicine have adverse effect and extremely hazardous. For this purpose of prevention and cure, various medicines are mentioned in the Ayurvedic classic, which serve as the healthy life. The introduction, the osteoarthritis is a degenerative wear and tear joint disease that typically leads to the pain and stiffness of the joint. If the symptoms get worse, they can greatly affect your ability to move. The prevalence rate of sandhigata vata is 22 to 39% in India, and it increases day by day due to the lifestyle changes. According to the World Health Organization, osteoarthritis, that is sandhigata vata, is a major social problem affecting the bed-bearing joints. Example, knee, lower back, hips, etc. Among over 100 different types of arthritic conditions, osteoarthritis is the commonly occurring type and the commonest initial site of the knee joint. That is Janu Sandhi, as we know. Janu Sandhigat Vata is more common in women than men. It is usually affect the both Janu Sandhis. The aims and objective of the article to explain the role of drugs and panchakarma therapy enumerated in ancient Ayurvedic texts, which will have the beneficial in management of Sandhivata. Then the materials and method. As the study is a review study, the available literature, samhitas, and other books are searched for the disease and analyzed to get the comprehensive concept in the management and Sandhivata. Electronic databases, complementary and alternative medicines, PubMed, Google Scholar Medicine, etc. Observation, disease review. Sannikrishta Hetu. Ativyam, that is the excessive of physical exercise. Abhighata, that is injury to the joint. Marmaghata, pradhavana, etc. Vipak, Viparkshit hetu is a they are rasas like kashakatu tikta, guna, ruksha, shita, and lagu. The clinical features of Sandhivata. The Lakshana of Sandhivata are described in the Charak Samhita as Vata Pradhana station, that is the tenderness. Then Shotha, that is swelling. Prasarana Kuchaprastasana, that is the pain during the extension and flexion of the joints. In Sushrit Nidana, Lakshana are described as Hanti Sandhi, that is stiffness. Sandhi Shopha, that is swelling. Sandhi Shola, that is pain in joints. And Asti Shodha, that is degeneration. Then the types. According to the Samprapti, Dhatu Kshayajana Sandhigatvata, that is degeneration occurs most commonly. Then Avarnajanya Sandhigatvata, that is the primary cause is Avarna of a kapha by the Vayu. Then both by Kshaya as well as Avarna. Then second type is in the line of Nija and Agantuja, it can be classified into two varieties. Nija, that is due to the wettation of the Vata by Dhatu Kshaya. Then Agnituja, that is due to the trauma. Then Samprapti, Dhatuksha Janya. Vata dosha is predominant in the old age and Kapha is decreased. Also, the Agni gets impaired due to which Dhatus produced are not at their best, which is ultimately leads to the degeneration. As Kapha is decreased, the Slekshna Kapha in joints also depletes, the resulting in the Shaya Asti Sandhi. Then Avarna Janna. In the obese, usually Sandhivata occurs in the weight-bearing joints. As Meda Dhatu is produced in the excess, it will cause the obstruction and does not nourishes the Uttaratta Dhatus leading to the Shaya. The excessive fat will have a Avarna of Vata. This way, take the Vata when settled down in the joints will the produce the Sandhivata. Then Dosh. Dosh involve the Vata and Sleshma Kapha. Dusha, Asti, Majja, Meda. Srotas, Asti Vasrotas, Majja Vasrotas, and Medu Vasrotas. Sroto Drushti, Sangha, Agni, Manda. Ubhastava, Pakvashaya. Rogamarga, Madhyam. Vyadhi Swabhava, Chirkaliga. The management of Sandhivata. The management includes the lifestyle modification, change in dietary habits, yoga, regular exercise, Abhyantar Snehan, Svedan, Mrudu Anumolam, Lepan, Raktamokshan, Dhana Karma, and Shambarchara. The leech therapy for the sympathetic relief in the osteoarthritis. The active compounds in the leech saliva and their local release, that is the synovial fluid, has anti-inflammatory properties. Vasti Chikitsa, which is considered as the heart treatment and is the best for Vata Vadis and also effective in osteoarthritis. Snehan Basti will not only help in the decreasing pain but also promote the strength to the bones. Studies done with the Kshira Balatela Basti were found significant in the reducing the symptoms of Sandhivata. Drugs for the osteoarthritis include the Google preparations like uh, Vatari Google, Yogaraj Google, Triyodoshagna Google. They are beneficial. Then discussion and conclusions. The treatment of Sandhivata is mainly done by reducing the elevated Vata dosha and increase the Sleshma kapha in joints so that the movement of joints can be increased. Since this is another age-related degenerative disorder, it may persist for the lifetime, but through the changes in lifestyle and treatment, the symptoms of Sandhivata can be reduced and the disease can be stopped in its primordial and primary stage to lead the good quality of life. These are the references. Thank you.
Thank you, Dr. Sayali.
Ma'am, there's also my poster presentation. I will present.
Yeah, doctor, you can present.
Thank you, ma'am. The theme of poster is the lifestyle disorder, Ayurvedic management, the review of management of childhood obesity in Ayurvedic perspective. The credentials are same as the article. The need of the study is the obesity in the children is becoming more common, and obese children tends to become obese adult, influenced by genetic, biological, psychological factors and the health behaviors. Overweight and obesity is a complex public health problem affecting the major developing countries. The study aims to formulate the guidelines for management and treatment option for the childhood obesity. and the psychological and medical comorbidities in the Ayurveda. The methods include the study is carried out by literary research through the Charak Samhita, Ashtang Hriday research article, and the modern medical textbook. The Ayurvedic management include the causes of obesity are overeating, environmental factors, over medications, family history, lack of exercise, genetics, and the pregnancy. So, the analysis, the line of treatment in the Ayurveda, Nidan Parivarjana, the Nidan of the Saula can be broadly classified under the Aharantak Nidan, like the excessive eating, having meal before the digestion of previous meals. Viharatmak Nidan, such as a lack of physical exercise, daytime sleeping, sedentary lifestyle, Bijadosha Nidan, and Mansik Nidan. The lifestyle modification include the weight reduction, timely sleeping and awaking, regular practice of yoga, and herbal medication. Kafagna and Medogna diet, medicines, Guru Rakshak, Kathina like Yavakultha, and Trundhanya in diet, drinking hot water. In childhood obesity, Pathyapath is more important than the medical treatment. Shaman Chikitsa includes Shilajatu Kumbha, Chandra Pravavati, Kumbhajatu Google curves like Triphala Google. Bhasma like Loho Bhasma and Vanga Bhasma are also useful. Shodhan Chikitsa include Niroha Basti, which is usually given with the Vatsa-kadigana. Mrudu Anuloman also useful. Example like Gomutra Hari. These pictures tell about the Nidan Parivarjan, which shows the lifestyle modification, that is wake up at Brahma Muhurta, Udavartana, Gugul, Triphala, Madhu, Takra, Shilajatu, Barley Roti, Gomutra, Panchakarma, Chinta, and the Vyaya. The results Saulya as a Sanaparjanya Vadi as the principle for the Chikista, Kurucha Apartandan Chikista, Nidan Parivarjan, that is the avoidance of etiological factors for the disease, lifestyle modification, Shaman Chikista, Shodhan Chikista, Ahar Dravya, Yogasan, and Paranami. The possible way in day-to-day life for the childhood obesity are the following. They are Vata Shamak Ahar, Ruksha Udavartan, oral medication like Triphala Google, evidence-based interventions. Appropriate diagnosis and screening for the risk factor should be made and treatment should be panel accordingly. The discussion is that the evidence-based intervention for obesity are available like community interventions, school-based interventions, family-based interventions, primary health care interventions by the developmental period of the all stages of development from birth to the 18 years. Conclusion is that the Ayurveda has an upper edge in treating obesity with emphasis on the root cause. This review about the obesity is proved that the proper medication as per Ayurveda guidelines will definitely control obesity without the hazardous side effect. Obesity can be managed by the well following the Patya Apatyas, Ahar and Yoga mentioned in the Ayurveda. These are the reference. Thank you, ma'am.
Thank you, Dr. Sayali. Thank you for the nice presentation. Next, I invite Dr. Anjali Patel for the paper presentation. Dr. Anjali Patel, are you there?
Yes. Am I audible?
Yes, Doctor. Audible, Doctor.
Okay. Sharing my slide.
Okay, Doctor.
Okay. So myself, Dr. Anjali Patel. I'm a scholar final year, and I'm from Department of Prasuti Tantra Evam Stri Rog from Late Kedari Redekar Ayurvedic Mahavidyalaya, Gadinglash, Kolhapur, Maharashtra. So today my topic is asthidhara, which is menorrhagia in modern science. Introduction. The first of all, we will see introduction. What is asthidhara? So asthidhara is a gynecological disease manifesting as combination of excessive bleeding per vagina and also with backache, pain in lower abdomen, and weakness. The description of asthidhara is available in Veda and Purana. Acharya Charaka considered it as one of the Rakta Pradoshaj Vikar and also under Apitta Vritta Apanvayu Dushti. Acharya Shishru has mentioned it under Pitta Samyukta Apan and in Rakta Pradoshaj Vyadhi. Ashtang Shangraha has explained Raktayoni Vyapad and said Asrigdar and Pradar as its synonymous. And Ashtang Hriday
Hello, Dr. Anjali.
Hello, Dr. Anjali, can you hear me? Hello, Dr. Anjali, can you hear me? Okay, next I invite Dr. Lavanya for the paper presentation. Hello, Dr. Lavanya.
Good evening, sir.
Good evening, doctor. Please share the screen, doctor.
By many Nidanas like alcohol use, sedentary lifestyle, smoking, etc. Hello.
Hello, Dr. Lavanya, can you hear me?
Yeah, sir.
Doctor, screen is not visible, doctor.
1 second, sir.
Dr. Lavanya, if you have any problem with screen sharing, we will share for you, doctor. Hello, Dr. Lavanya, can you hear me? Hello, Dr. Lavanya, can you hear me? Hello, Dr. Lavanya, can you hear me? Okay, next I invite Dr. Abhishek for the paper presentation.
Yes, sir. Am I audible?
Yes, Dr. Audible, doctor.
Okay, I'm sharing the screen. So, can you see the screen, sir?
Screen is not
So,
visible,
can you see
doctor.
the screen?
Screen is not visible.
Okay, just a minute, sir. Sorry, sir. I think I have some issues in sharing the screen. Please
Don't worry,
give me
doctor. I will share for you.
yeah, okay, fine, sir. Fine.
Please start the session, doctor.
Yes, sir. Yes, sir. Good evening, everyone. Myself, Dr. Abhishek, second year PG scholar from Department of PG Studies in Dravyaguna, JSS Ayurvedic Medical College, Mysore. Today, I'm here to present my topic, that is Castaushadis in Arshas. Coming to the introduction, Chikitsa of Arshas in Ayurveda comprises of a treatment using herbo-mineral and animal-urgent drugs, individually and in combination. Acharya Charaka has explained Arshogna Mahakashaya in Sutrasthana of Charaka Samhita. Drugs that mentioned in Vibandha and Baddha Purisha can also be used in Arsha Chikitsa. In practice, compound medicinal formulations are more preferred as compared to that of single drugs due to their cumulative effect. Coming to the next slide. Let's have a look on Arshogna Mahakashaya. Here you can see that Kutaja, Bilva, Chitraka, Nagara, and Ativisha. If we look upon the similarities mentioned here in Guna, you can notice that the Lagu and Ruksha Guna are more common among all these five. And in Rasa, if you notice, the Katu, Tikta, Rasa are more common, are similar in among these five. And in Virya, Ushna Virya is more similar. And in Vipaka, Katu Vipaka is more common among the given drugs. And if you glance on Doshagnata of the given drugs, you can notice that most of the drugs are Kapha and Vatagna. Next slide. The rest of the drugs are Abhaya, Danvayasa, Daruharidra, Vacha, and Chavya. Here again, if you look on the Rasa Panchaka, similarities in Rasa Panchakas, you can notice that Lagu, Ruksha, Guna are more similar. And in Rasa again, Tikta and Katu Rasa are more similar. And in Virya, Ushna Virya is more common. And in Vipaka again, Katu Vipaka is more common. So when we look upon the Arshogna Mahakashaya, so based upon these similarities and based upon the Doshagnata given, that is Kapha and Vatagnata, so probably might have given in Arshogna Mahakashaya. Coming to the next slide. Based upon the similarities which we saw in previous slides, if we analyze the probable mode of action, here the symptoms of Arshas are Mandagni, Vibandha, Vedana, and Shota. And here the Chitraka and Nagara being Deepaniya, they clear the Ama and corrects the Mandagni. And Haritaki being Anlomana, it clears the Vibandha and lessens the pressure on rectal veins, thus relieving the symptoms of Mala Vibandha, Shula, and Shota. Chitraka, Ativisha, Daruharidra, and Vacha, they comes under Lekhaniya Gana, and hence they help in reducing the size of Masankura and reduction of Sthanika Shota. And Chitraka and Nagara comes under Shula Prashamana Gana, and hence help to reduce the pain in Arshas. And in Arshogna Mahakashaya, all drugs work together to fight the symptoms of Arshas and hence cure the disease. Coming to the next slide. Let's go on some different aspect, that is concentrating on chemical constituents of the drugs. Here, if you see Kutaja, which belongs to Apocynaceae family, is having steroidal alkaloids, resin, flavonoids, etc. And the usual parts of Kutaja are seeds, leaves, and stem bark. And the dosage is Churna 3 to 6 grams, Kashaya 12 to 24 ml. And the yogas are Kutaja Pratisaraniya Kshara for external application in Arshas. Next slide. Bilva, which belongs to Rutaceae family, chemical constituents are umbelliferon, xanthotonin, etc. And useful parts are fruit, leaves, and root. Dosage, that is Patrasvarasa 10 to 12 ml, Churna 3 to 5 grams, and decoction 12 to 24 ml. Churna prepared with Bilva, Nagara, and Chitraka should be consumed with Takra. And the Phalamajja of Bilva is also given along with Takra in Arshas. Next. Chitraka belongs to Plumbaginaceae family. Chemical constituents are plumbagin, plumbagic acid, etc. Useful parts are root. Dosage, Churna 1 to 2 grams. Takra prepared in earthen pot, which is smeared with the kalka of Chitraka, is useful in Arshas. And the paste of Chitraka and Nagara is applied locally in Arshas. Next slide. Nagara belongs to Cetamine family. Ginger glycolipids A, B, C, and volatile oils, etc. are the chemical constituents. Useful part is the rhizome. Dosage, Churna 1 to 2 grams, and Swarasa 5 to 10 ml. Yoga, Nagara is given along with Guda in Vardhamana Prayoga starting from 2 tala per day till it reaches 20 tala and decreased in the same pattern in Arshas. Next slide. Ativisha, Aconitum heterophyllum, belongs to Ranunculus family. Chemical constants are aconitic acid and atizine. Usual part is root and the dosage is churna 1 to 2 grams. Sorry, 1 to 3 grams. Next slide. Next is Abhaya, that is Haritaki, belongs to Combretaceae family. Chemical constants are gibberellic acid, tannic acid, etc. Useful part is fruit, dosage 1 to 6 gram, that is fruit powder. Fruit of Haritaki is taken along with Guda before taking food. They both act as anulomaka. And Haritaki churna is given along with Takra in Ashas. Next slide, sir. Danvayasa, that is Fagonia arabica, belongs to Zygophyllaceae family. Chemical constants are galactocatagen and catagen. Useful parts are roots, dosage, Swarasa 5 to 10 ml and Kashaya 12 to 24 ml. Kashaya of Danvayasa, Eshtimadu, Badara and Patola is used in Prakshalana of the Ashas if it is bleeding piles and all. Daru Haridra, Latin name Berberis aristata, belongs to Berberidaceae family. Chemical constants are berberin, taxylamine, etc. Useful parts are root, stem, and fruit. Dosage churna 3 to 6 grams and kashaya 12 to 24 ml. Paste of Daru Haridra is applied as an external application in Arshas and Bagandhara. Here, the twak of root is used, and because of less availability of the drug, the twak of bark, the bark is also used. Next slide, sir. Vacha, that is Acorus calamus, belongs to Aeraceae family. Chemical constituents are calarin, calaminonin. Useful parts are rhizome. Dosage churna 1 to 2 rati, as it is tikshna. And the dhupa of roasted vacha and ajamoda is given in Arshas. Next slide. Next slide. Chavya, that is Piper retrofractum, belongs to Piperaceae family. Chemical constants, piperin and cytosterol. Useful parts, root, dosage, churna 1 to 2 grams, yoga, kankayanavati and chavyadhigruta, etc. Next slide, sir. Coming to Ekamolika Prayoga, that is Abhyantara Prayoga, Trivrat Churna is given along with Triphala Kasha in Arshas, and Chitraka and Nagara is given with Sidhu. Chitraka is given along with Takra and Hingu. Surna, the Swarasa of rhizome of Surna is extracted by Puttapaka method and is given along with Taila and Lavana. Next slide, sir. Ekamolika Prayoga, that is Bahya Prayoga. Snohi Kshira mixed with Harida Churna is used for external application in Arshas. Salka of Pipali is mixed with Haridra Churna and is used for external application. And Arka Kshira along with Alabo and Ajamutra used for external application. Next slide, sir. Compound formulations. Let us go based upon Panchaveda Kashaya Kalpana, that is Vati and all. Coming to the first point, that is Vati, Kankayana Vati. Dosage 4 grams in morning with cold water. It is helpful in all types of Arshas. Swalpa Surana Modaka, Vaishajya Ratnavali reference, dosage 1 tola in bleeding piles. Ballatakadi Modaka, 4 grams in Pitta jars. Next slide, sir. Churna and Kashaya. Samangadi Churna, half to 1 tola with Ajakshira in bleeding piles. Sama Sharkara Churna, it is from AFI reference, 2 to 4 grams in non-bleeding piles. Patyadikwata, 1 pala in non-bleeding piles. Chandanaadikwata, Vaishajya Ratnavali reference, dosage 1 pala in bleeding piles. Next, sir. Asava and Arishta. Abhaya Arishta of Vaishajya Ratnavali reference, 2 pala with Jala in all types of Arshas. Draksha Sava, 1 to 2 tala with Jala in all types of Arshas. Dantya Arishta, 2 tala with Jala in all types of Arshas. Next, sir. Taila and Gruta. Vyoshadi Gruta of Vaishajya Ratnavali reference, 3 to 5 grams is given along with milk. Pipalyadi Taila for Basti, that is Anuvasana Basti, it is used, and Jatyadi Taila for external application. Next slide, sir. Here are a few proprietary formulations. Capsule Ashonil of AAF Pharmacy. The key ingredients are Haritaki, Katuki, Loha Basma, etc. And the tablet Arshahita, Surana and Sarjarasa are the key ingredients. It's of SDL Pharmacy. Tablet Pilex, Aragvata, Haritaki, Vibhitaki, etc. are the key ingredients of Himalaya Pharmacy. Ointment Sonarin, key ingredients are Kasi Sadi Taila and Vranaropana Taila of Phytopharma Pharmacy. Tap Pylif, Haritaki, Chitraka Nimba are the key ingredients of Charak Pharmacy. And Tap Pylorid, Chirabilva and Shuddha Gandhaka are the key ingredients, which is of Nagarjuna Pharmacy. Thank you.
Thank you, Doctor.
Thank you, Doctor.
Next, I invite Dr. Ankita Srikanth for the paper presentation.
Yes, sir.
Okay, Doctor. Please share the screen, Doctor.
I have some error to share my PPT, sir. Can you please sharing my PPT?
Okay, Doctor. Please start the session, Doctor.
Yes. Good evening, all of you. Myself, Dr. Ankita Vitkar, PG scholar in Kriya Sharir from GSC Dharashiv. I am going to present you the topic Secret of Nadi Pariksha under the guidance of my guide, Dr. Ravindra Dhingine, sir. We all know the concept of Nadi Pariksha. This concept is found in various Ayurveda Sahita like Bhavaprakash, Raman Sahita, Kanat, etc. Sharangdar used Nadi Pariksha done to analyze Tridosh in Sharir and also in diagnosis and prognosis of disease, and in Yogratnakar it is mentioned under Ashtavid Pariksha. Sharangdar said that Karasya Angushtu Mule Adhamni Jiva Sakshini Tacheshtam Sukham Dukkham Neyam Kayasya Pandite. That means the presence of Nadi at the Angushtumal is evidence of life. Nadi Pariksha is done to analyze and estimate the status of Tridoshi in the body, that are the fundamental elements of health, and also find out the vitiated doshas in patients. Next, please. The aim of my study is to understand the Prakrut and Vikrut dosha avastha in Sharir with the help of Nadi Pariksha, and the objectives are to understand the concept of Nadi in Ayurveda and to appraisal clinical significance of Nadi Pariksha in context to Prakrut and Vikrut dosha avastha in Sharir. Next slide. Materials regarding Nadi Pariksha were searched from Brihatrai, Lagutrai, Yogratnakar and from Ramankrut Nadi Vigyan. Authentic database such as Google Scholar, PubMed, etc. were searched using the word Nadi Pariksha. Also, various authentic journals, articles regarding Nadi Pariksha as well as Ashtavid Pariksha were referred. Next, please. Discussion. Before starting with abnormal, we have to know about the normal, that is Swastha Nadi, that means healthy pulse. Having a regular rate and rhythm, a healthy person's pulse is stable and powerful, like a Gajagamini. That means a person with healthy pulse is seen to have a happy and fresh face. Vat, Pitta and Kapha Nadi lies respectively under Tarjani, Madhyama and Anamika of examining Vaidya. Use right hand for male patients and left hand for female patients because it is best felt in respective hands. While examining Nadi, we have to know about or check different parameters like Gati, Vek, Tal, Bal, Akruti, Kathina, etc. Next slide. Nadi observed in Prakrut Doshika Vistha in Vata, Pitta and Kapha are Sarpa, Manduk, Hans Gati respectively, as well as in Vikrut Avastha it is Vakra, Chapal and Sthira Gati respectively. Vatas Nadi have Jalauka, Sarpayo Gati, like leech and snake-like movement. Also, Vat Nadi is a superficial, cold, light, thin, feeble and empty. With more pressure, it disappears. It moves fast and may become irregular. Pitta's Nadi have Kulinga, Kak and Manduk Gati. That means sparrow, crow and frog-like movement. Also, Pitta Nadi is full with strong throb. It is hot and abrupt with high amplitude, good volume and considerable force.
Kaphaj Nadi have Hans and Paravat Gati, that is swan and pigeon like movement, and it is slow in movement. Next slide, please. We can see here Vatik Nadi, Paitik Nadi, and Shleshmik Nadi in the form of previous slide, sir. We can see here Vatik, Paitik, and Shleshmik Nadi in the form of graph. Vatik Nadi is fast and irregular. Paitik Nadi have high amplitude, and Shleshmik Nadi is slow. We can see here. Next slide, please. Asadhya Nadi, which is very slow thread form, it feels Nadi pulsation stops in between, that is intermittently. This lost and found Nadi shows incurable sign in Tridosh Rogi. Nadi in other Vikrutavastha, that means in Jwara Nadi feels Gambhir and Ushna and Vegvati. In Kam and Krodha Vegvaha Nadi, we have find. Am, Guru and Karyasi Nadi, Kshudit have Chapal Nadi, Asadhya Vedi have Kampate and Spandate pulsations. Next slide. We all know about the Hruday. Hruday is a place of Chetna, by virtue of which we can feel Sukha and Dukha. When the Hruday contracts and expands, the blood flows in and out of the Hruday, taking it with blood outside of the Hruday into the arteries. In this way, by contraction and relaxation of the Hruday, the Nadi starts moving. It is convenient to divide the reading of Nadi into 7 levels. That is, first level is Vikruti, second level Manas Vikruti, third level Sabdosh, fourth level Ojas, Tejas and Pran, fifth level Dhatu, sixth level Manas Prakruti, and seventh level Prakruti. Next slide, please. Although the Nadi Pareeksha is not directly defined in Brahtrai, but it is mentioned in 7th Adhyay in Sharir Sthan of Shushru Sahita and 3rd Adhyay of Indriya Sthan of Charak Sahita. Next slide, please. Lastly, we concluded that in Ayurvedic texts, Nadi Pareeksha plays an important role to know the Prakrut and Vikrut dosh, Ahar, Jirna, Jirnavastha, and also Sadhya, Sadhyavastha of Vedi. Nadi Pareeksha is the science of observing the pulse from a perspective of diagnosis of human body, mind, and subconscious. Next, please. I have taken references from these granthas and articles. Thank you.
Thank you, doctor. Thank you for the presentation.
So next I invite Dr. Lavanya.
Am I audible, ma'am?
Yes, doctor. Audible, doctor.
Good evening,
Please start the
everyone.
session.
Myself Dr. Lavanya Yu. My topic is Virechana and aiding liver diseases under the guidance of Dr. J.S. Harimani sir, under the purview of Dr. Akshay Ashati sir. This picture depicts the by doing many nidanas like alcohol use, sedentary lifestyle, smoking, etc. A liver disease occurs. Panchakarma and the liver diseases. Prevalence of liver disease in Ayurveda have been increasing day by day. Liver diseases and its management are described in Ayurveda in a scattered form, like Ekrit Vriddhi, hepatomegaly, Ekrukshaya, cirrhosis of liver, Ekrit Vriddhi, liver abscess, Granthi, hepatic cyst, and different disease found in Ayurveda literature based on mass, morphology, etc., like Kamala, Kumbha Kamala, Halimaka, etc., are clinical features based on function of liver disorder. There are different modes and routes of administration to cure the disease for the evacuation of the disease. Virechana therapeutic eliminative process. This is particular efficacy in Ekrut Vikara. Virechana Dravya Karmukata. After the Aushadha administration, the Dravya absorbs due to its virya like Vyavahi Guna, quick absorption, Vikasi Guna, Dhatu Shitilata, Tikshna Guna, Vichindana, and Ushna, Vishandana of dosha, Sangata dosha, that is liquefaction, circulars all over the body through the macro and micro channels of the body, through Sukshma Siras by the Anupravana Bhavat, and by the Prabhava, Prithvi and Jala Mahabhuta constitutes the presence of Guna and thus do the Virechana. Virechana drugs according to the mode of action, some relevant data are, according to Acharya Sharangadhara, classified drugs from their mode of action, and a group of drugs known as Virechanopaga mentioned by the Acharya Charaka, which may also be read to this classification. Some are Anulomana, कृत्वा पाकं मलानां यद्भित्वा बन्धमदोनयेत् तच्चानुलोमनं ध्येयं यथा प्रोक्त हरितकी that is drugs which move the mala downwards after the digestion and breaking their bandha called anulomana. Example is haritaki. Sramsana paktavyam yad apakvaiva slishtam koshte maladikam. That is the literal meaning of sramsana is to slip or to fall down. In sramsana, the drugs which brings the semi-digested and sticky mala which without causing their digestion is samsana. Example arabhada. Then Vedana, Maladikam Abadam cha Baddam va Pinditam Malaihi, that drugs which disintegrates the Abadda, that is unformed, and Badda, formed Mala, and also Pindita Mala in a dried form mass, forms of Mala by facilitating penetration into it and then evacuating through the lower gut is called Vedana. Example is Katuki. And Charaka mentioned Vedaniya Gana also, the drugs like Suvaha, Arka, Urubuka, Agnimuki, etc. Then Rachana, the drugs which eliminates the Pakwa and Apakwa Mala or dosha by making them watery through the lower gut is Rachana. Example is Trivrut. And Charaka mentioned Virechanupaga Gana like Draksha, Kashmarya, Parushaka, etc. The mechanism in modern involves few steps which are like purgatives, that are osmotic action, net water absorption and propulsion, and the laxatives, inhibition, enhancement and PG synthesis. In classical literature, many diseases mentioned as told earlier like Kushta, Udara, Kamala, Halimaka, Pandu, Visarpa mentioned by Charaka, Sushruta and Vagbhata. In Charaka view, many diseases told where Virechana is particularly indicated and a few mentioned here. In Kushta, Pittotareshu Moksho Raktasya Virechanam cha Agre. Virechana is told as an Agra treatment. In Udara, Nityameva Virechana is told. And in Pandu, Pandvamai Snigdha Tikshne Urdhva Anulomanam. In both the ways, the Shodhana is told. In Kamala, Samshodhyo Mrudubis Tiktai, Kamali to Virechana. Virechana is told as Mrudu and using Mrudu and Tikta Dravya. In Halimaka, Vireko Madhuraprayam Bhajet, Pitta Anilapaham. And in Visarpa, Shonitasyavam cha Virekam cha Visheshataha. Virechana is Vishesha treatment here. And in Visha, Hriddahe Praseke va Vireka Vamanam Rusham. And many research was done and going on, and few are mentioned using different like in Pittaja Kushta, Arabhadadi Kwata is highly significant, and in Eka Kushta, Pachana with Jirakadi Churna, Snehpana with Gugulu, Tittaka Grita, and Trivrit Leha for the Virechana. Here it is effective in remission. And in Vicharchika, Haritaki Kwata, Erinda Taila, Ichabedi Rasa and Rasana are used, and recurrence rate, curing rate is more and recurrence also less. In summary, Shodhana is particularly seen to be the effective in management of the Ekrut Vikara. Advanced evaluation of mechanism with special reference to the liver disease is need of an hour. And the world is purgatives, and these are my few references from articles and Samhita. Stay healthy naturally. Thank you.
Thank you, Dr. Lavanya.
Thank you,
Thank you for the wonderful presentation.
So
Next,
next I invite Dr. Anjali Patel.
Hello.
Hello, Dr. Anjali.
Yeah. Am I audible?
Yes, doctor, you are audible.
Sir, please can you share my PPT presentation? I was unable to share.
Okay, just a moment, doctor.
Yes.
Doctor, you have to complete the Nirikti slide.
Okay.
Next is a definition slide you have to start, doctor.
Okay. Okay. Thank you. Thank you. Okay. So I'm starting with the definition of asthidhara. प्रदीर्यते इति विस्तारितो भवति इति प्रदरः अश्रुग दीर्यते यस्मिन् इति अश्रुगधर इत्येषापि निरुक्तिरत्य बोद्धव्या. According to Acharya Charaka, due to pradirana, that is excessive excretion of raja, it is known as a pradara. According to Chakramani Tika, there is a dharana of ashrik, hence it is known as a ashrikdar. When a normal menstrual bleeding pattern is altered in reference of duration, amount, color, or the cycle, the conditions is called arthav dushti. Next is etiology, that is Nidan, Charak Sanhita. In excessive intake of a lavan, amla, katu, vidahi, payasa, dadi, mastu, etc. will causes a shrikdara. According to Acharya Shushruta Sanhita, pitta vritta apan vayu will cause a shrikdara. Ashtanga Sangraha has explained as increase in amount of blood, that is ativritti of rakta will cause a shrikdara. Ashtanga Hridaya, Pittavrita Apanvayu will cause Ashrikdara. In Madhav Nidan, Bhava Prakash, Yoga Ratnakar, Viruddha Bhojan and Madhyadi, Mandagni, Shoka, etc. will causes Ashrikdara. Next is pathogenesis. Yeah. So, Vata, Pitta and Kapha increases. So, the vitiation of a three dosha occurred. Hence, Upadhatu Rupa Arthav increases due to excessive Rakta. And Rakta increases because of a Pitta Prakopak Nidana Sevan. So, the Garbhashayagat Sira affects the uterine vascular apparatus, which causes uterine congestion. And so, increased uterine circulation due to the Dushit Vyan Vayu. Apan Vayu also gets dushit, which causes excessive and prolonged bleeding, and hence which causes a shrikdara. This is general pathogenesis. Next is samyak lakshana. So, according to the Acharya Charak, aggravates the vata affects in the uterine vessels and boosts the amount of blood. And this increase in blood thus causes increase in menstrual blood and creates rakta pradar. Acharya Charak also says that excessive vaginal bleeding during menstruation is the only symptom of Ashrikdara. But according to the Sushruta, there are body ache and pain symptoms present in all type of Ashrikdara with excessive vaginal bleeding. Acharya Dalhan says in commentary on Shishruta Samhita that burning sensation in lower portion of growing pelvic region, back and renal region, and severe pain in the uterus as symptoms present in Ashrikdara. Viruddha Vagbhat has explained excessive bleeding during menstrual or intermenstrual period as symptom of Ashrikdara. Next is classification. Okay, so classification, various authors, Acharya Charak, Shushruta and Vagbhat has classified as Vatash, Pittash, Kafash and Sannipatash as classification. In Vatash Ashrikdara, there will be etiology is Ruksha Dravya, in Pittash, Amla Lavan, Kshara, Ushna Dravya, and in Kafach, Guru Dravya, and in Sannipatat, Sarvahetu. Discharge in Vata Ashrikdara, there will be a discharge like frothy, watery. In Pittash, there will be a bluish, yellowish, blackish discharge will be there. In Kafach Ashrikdara, there will be a sticky, white, thick discharge will be there. And in Sannipatash, there will be a foul smell, slimy, and yellowish discharge will be there. So these are some of classification according to different acharya. The next slide is prognosis. Okay, so it is either it can be a sadhya or asadhya. If there is a ek dosha ashrikdar, that will be a sadhya ashrikdar, and asadhya is a sannipatash ashrikdar is a asadhya. The female having following features is considered as asadhya. They are atyadik rajasrav, either there will be a trishna, daha, vara, kshina, rakta or daurbalya. Upadrava, there are complications. So what are the complications of Ashrikdara? There will be a Daurbalya, Brahma, Murcha, Tama, Trishna, Daha, Pandu, Vata Roga and Shoka. Now the treatment. So what will be the treatment or chikitsa? According to Charak, chikitsa prescribed for Vataladi Yoni Vyapat should be also be used in the respective Ashrikdara. According to the Acharya Charak and Vagbhat, it should be treated on the lines of Raktatisar and Raktarsha. Charak explained the treatment to be like for Rakta Yoni, that is Rakta Sthapan Aushadhi, after giving the consideration to the association of dosha. Treatment on the lines of Adoga Rakta Pitta is to be applied. Use of Basti is beneficial. Viration is indicated in all type of Artha Vikar. Now, what are the drugs for external use? Nasya and Abhyanga of Shatapushpa oil are beneficial in Ashrikdara. Use of Uttarbasti is also beneficial in Ashrikdara. Chandanadi Nirubasti, Rasanadi Nirubasti, Madhukadi Anuvasan Basti, Rasanadi Astapan Basti, and Mustakadi Yapana Basti are used in Ashrikdar. Next, these are some of drugs for internal use. Vati Kalpana, there will be a Gokshuradi Gugul, Chandra Prabhadi Prabhavati. In Kwatha Kalpana, that is in decoction, we can use Dravyadi Kwatha prepared from a pushpa of a Dhatki and Puga for 3 days to cure Ashrikdara. There will be Grita and Tel also given, the like Shita, Kalyanaka Grita, Shalmali Grita, etc. In Kalpa and Kalka and Churna Kalpana, pasted root of Tandulia with honey and Rasanjan and honey mixture should be taken with rice. Water is also used in Ashrikdara. Use of Elakadi Aushadhi, single drug preparation, that is Ashoka, Kamala, Durva, etc. to be used. Tel, Shatapushpa Tel and Shatavari Tel to be used. And Anya Yoga, use of Lasunadi Kalpa and Shatapushpa and Shatavari Kalpa. Now, next slide, menorrhagia. So, what is menorrhagia? An altered menstrual cycle and duration with increase in quality of a menstrual loss. What are the causes of menorrhagia? Purpurea, leukemia, severe anemia, undernutrition, PID, IUCD, polyp, etc. will be the causes of menorrhagia. Symptoms. So, there will be anemia, passing lots of clots, weakness will be there. Investigation. To exclude other causes, we have to do sonography, ultrasound, and PS and PV examination will be there. Diagnosis. When other causes excluded and uterus and ovaries remain normal, based on clinical features, DUB is diagnosed. Thank you. Thank you so much.
Thank you, doctor.
Thank you, doctor.
Thank you so much.
Next, I invite Dr. Anil Govindrao Jadhav for the paper presentation. Hello, Dr. Anil, are you there? Hello, Dr. Anil Jadhav, are you there? Hello, Dr. Anil Jadhav, are you there? Okay, next I invite Dr. Mahesh for the paper presentation. Dr. Mahesh Sonavani, are you there? Hello, Dr. Mahesh, are you there? Hello, Dr. Mahesh, are you there? Okay, next I invite Dr. Aiyesha Gulfam Sayyed for the paper and poster presentation. Hello, Dr. Aiyesha.
Yes, yes.
Okay, doctor, please share the screen, doctor.
Yes, sir. I'll share my screen. Sir, actually, I am presenting paper and posters. So
Yeah.
we
First
start
you,
with the
first you have to present paper, doctor.
Yes, yes, I'll share. सुहेल क्या हो रहा है?
Hello, doctor.
Sir, 2 minutes. I'm trying.
Have any problem with screen sharing, doctor?
Yes, sir, I'm having problem. Can you share my
I will share for you, doctor. Just a
Okay.
moment. Please start the session, doctor.
Yes. Welcome everyone. Myself, Dr. Aiyesha Sayyed. I am PG Scholar third year student from BSDT, Ayurveda Mahavidyalaya, Pune. So today I am going to present the paper on conceptual study of purishdharakala in relation to asthidhara. Next slide. So today these topics I am going to talk about introduction. So talking about the introduction, I'll start with the definition of the kala. So kala is a limiting membrane between the dhatu and ashay. It is a membrane-like structure present between the dhatu and ashay. So kala does the dharan of the respective dhatu. Wherever in whichever region the kala is present, in that region whichever dhatu is present, so it causes the function of dharan of its particular dhatus. If any function of the kala is disturbed, the pathology occurs. So there is any problem in the kala, there can be a problem or there can be a disease which occurs because of the kala. So for the treatment purpose, kala is very important. According to Acharya Shushrut, he has said the Sapta Kala, means there are 7 kalas, starting from Mansadhara Kala, Raktadhara Kala, Medodhara Kala, Shleshmadhara Kala, Purishdhara Kala, Pittadhara Kala and Shukradhara Kala. So in which we are studying today about the Purishdhara Kala. He has not considered Asthidhara Kala in his study. So next slide, please. So talking about the Purishdhara Kala is the 5th Kala amongst them, as we saw already. And it is also called as a Maladhara Kala. So Purishdhara Kala is a membrane or the layer type structure that holds or forms the Purish. So it is located in the Pakwashay, in the Antakosht. And this Kala found within the Koshta at the level of Yakri. And what it does the differentiation of the Purish at the site of Undu. Talking in the modern anatomy, it is at the level of cecum. So purishdharakala helps to separate the water and nutrients from the stool. So this is the function of the purishdharakala, as it is a limiting membrane. So it separates the water and nutrient from the stool. And functionally it can be correlated with the large intestine, mainly cecum part. So that segregates the nutrient from the mala. So purishdharakala main function we can consider as the just segregating or separating the nutrients from the mala so that it doesn't go in the waste. Next. Talking about the asthidhara kala. So asthidhara kala is a unique concept of Acharya Dalhan. We saw in Sushrut Samhita or Sushrut has not accepted any such kind of kala, asthidhara kala. But Acharya Dalhan has commented on Sushrut, Acharya Sushrut, and he has said that ya eva kala purishdhara sa eva asthidhara, means whatever description is given about the purishdhara kala is same like asthidhara kala. So according to him, asthidhara kala and purishdhara kala is same, completely same. So he has considered like that. Next slide. We will see the relation of the purishdhara kala and asthidhara kala. So asthidhatu is the 5th among the sapta dhatu. We know there are 7 dhatus in the body. From them, asthidhatu is the 5th. So according to the Sushrut, there is a Vishuvek. They are 7. Dhatus are also 7. And whenever the Vishuvek is Vishaveg is going on, they take the Ashraya of Sapta Kala for Vishavegantar. Vishavegantar means from one Veg to another Veg. When it is going through the Kalas, from those 7 kalas, and they exhibit the symptoms accordingly. Means whenever the wish is in the Mansdhara kala or talking in the Raktadhara kala, so it will exhibit the symptoms in that kala, in that particular area or in that particular region. So when it is in the 5th wish week, it is in the 5th wish week. This when wish is in the 5th kala, it that is in Purishdhara Kala. So as we saw, Purishdhara Kala is the 5th Kala, and when Vishveg is in 5th stage, it exhibits the symptom related to the Asthi Dhatu. So whenever the Vishveg is a 5th Vishveg, that wish is in Purishdhara Kala, it shows the pathology related to the Asthi Dhatu. Like it shows the symptoms like Parvabhed. So from this relation, we can say that Purishdhara Kala and Asthidhara Kala are related, or they have a relation, or the comment of the Dalhan is true. So next slide. My aim and object of the study is to explore the purishdharakala, to explore the asthidhara, and to study the concept of purisha kalasa eva asthidhara. Next slide, sir. For this study, I have studied the classical text of Ayurveda, that is Lagutrai and Bruhatrai, along with the Tika, and journal, books, research articles, and web search I have done for more precise information. Next slide, sir. Kala is a limiting membrane, as we already saw, Dhatu and Ashay. Purishdhara Kala is situated over the Pakvashay, especially in the Unduk region, and the Vishaveg that take Ashray of Sapta Kala for Vishavegantar, especially in the fifth Veg. In fifth Vishaveg, it is the fifth Kala, that is Purishdhara Kala. Whenever the Vishveg is occurring, it occurs according to the Kala. So first it is in Mansadhara Kala, then in Raktadhara Kala. Likewise, when it comes to fifth Veg, it comes to Purishdhara Kala and it shows the symptoms related to the Asti Dhatu, which is a Parva Bhed. Conclusion: due to the symptoms of the Parva Bhed in fifth Vishwe, that is when Vish is in Purishdhara Kala, it depicts the symptom of Astiva Srotas. Hence, the Purishdhara Kala is similar to Asthidhara Kala. So, from this, we can say that yes, Purishdhara Kala is similar to the Asthidhara Kala. So, whatever pathology or any problem or disease occurs in Purishdhara Kala, it may shows the symptom related to Asti as well. Thank you. Sir, can you
Thank you,
please
doctor.
Thank you, doctor.
please
Next is a poster presentation.
my actually poster presentation.
I will share the poster, doctor. Just a moment.
Yes.
Please start the session, doctor.
Yes, my poster is related to the Vihar in pregnancy. Vihar means what lifestyle should be like followed by the pregnant woman according to Ayurveda. So in Ayurveda, it is said that she should wear ornaments. She should do all the religious rites, and she should perform all the religious rites. She should do auspicious deeds and recite the rhymes. Hymns means whatever hymns is given. She should do that. Then she should wear the white and clean garments. Then pregnant woman should sit and sleep on the soft cushions. This and her place should be well fumigated, that it should be clean, it should be prevented from any harm, and her family should perform activities that are dear to her. So from all of this we can say that whatever is pleasing, whatever is good for her, whatever makes her happy should be the lifestyle of the pregnant woman according to Ayurveda. So this is my poster I wanted to present today. Thank you, everyone.
Thank you, doctor. Thank you for the presentation.
So next I invite Dr. Sumeta.
Yes.
Dr.
Good
Sumeta
evening.
Betse.
Good evening, doctor.
Good evening, ma'am. Am I audible?
Yes, doctor, you're
Yes,
audible.
doctor.
Sir, I'm having problem with sharing the PPT. Can you please share it?
Okay, doctor, just a moment.
Okay.
Dr. Sumeta, please start the session, doctor.
Okay, good evening. Myself, Dr. Sushmita H. I'm a PG student from the Department of w.s.r.to, KC Ajmera Ayurveda College. And today's my topic is Ayurveda for greater understanding and management of pain. So I'm starting with the definition of pain. It is an unpleasant sensory and emotional experience associated with actual or potential tissue damage, or described in terms of such damage. Also, which can be explained in terms of symptom underlying another disease. It is a symptom underlying another disease or the complication of the other disease. So, in spite of very advanced research in science, pain still remains the major cause of disability affecting the large number of population in the world. So pain is basically, it is an instant reaction for so many of us. Pain first strikes, we simply pop up a pill to relieve our symptoms. In a world where everyone is looking for means and medications to minimize and kill the pain, Ayurveda can be a ray of hope to understand the pain as a friend, not a foe. So, in my opinion, pain is always misunderstood. If we change the way we look at pain, we can certainly find a newer ways of controlling, managing, and reducing it. Thank you. Next slide, please. So, according to the classical text of Ayurveda, Acharya Sushruta explained pain as a separate entity termed as a shoal, which primarily implies colic. Also, Charak Samhita explained Mahakashaya, that is a compilation of 10 herbs in conditions like Angamarda Prashaman, that is body ache, Shula Prashamana for colic pain, Vedana Sthapaka Mahakashaya for hemorrhagic pain. So Ayurveda include treatment like Snehana Swedan, Agni Karma, Jaloka Ucharan, Vedana Karma, Lepa Karma, and Basti Karma. So these are the main upakramas followed in Ayurveda to treat the pain. Next slide. Ayurvedic management of pain. Yes, Prakriti Stalini Chikitsa, that is a health maintenance. We can maintain health by following daily dincharya and rutucharya and also other upakramas. Roganashini Chikitsa, that is disease cure. After taking a detailed history, darshan, sparshan, prashna, we have to know the cause of the disease and we treat it. Then Rasayan Chikitsa, after treating the disease, we have to restore the process, and Naistiki Chikitsa for a way of spiritual treatment. Next slide. Pain is mainly caused by two main ways of causing pain are Dhatukshayajanya and Vargavrujanya. As we all know, all in three doshas, Vata is main, which cause pain. So for this, we have to go under three main treatments like Shaman Chikitsa, Shodhan Chikitsa, Satvajay Chikitsa, Yoga therapy, and other miscellaneous upakramas, which are mentioned forwardly. Classification of pain. Pain is acute, subacute, and chronic. Acute causing for once a while, for short term, subacute. A larger interval than acute, and chronic for having a large number of time. Non-susceptive pain, neuropathic pain, psychogenic pain, through pain, pain assemblia. Understanding concept of pain through Ayurveda. Pain is called as Ruk, Ruja, Vedana, and Shul. Out of three doshas, vitiated Vata is the main causative factor responsible for all painful condition. This vitiation of Vata occurs in two ways. Dhatukshayajanya Vatarkop, that is increased catabolism, and Vargavrujanya Vatarkop, channel obstruction. The Ruksha and Chala, that is dryness and vibration gunas of Vata, are mainly involved in manifestation of pain. Also, there is a one gun, Shita, which vitiates the management of pain in Ayurveda. Snehana, external oleation. Svedana, sweat-inducing formation. Agni Karma, intentional heartburn therapy. Jaloka Ucharan, Hirudotherapy. Vedana Karma, therapeutic body piercing. Lepan Karma, application of medicated paste. Basti Karma, administration of medicated enema. Panchakarma, detoxification regime. Yes, Pigeon is a therapy where warm oil is continuously applied while the body is simultaneously massaged. And Shirodhara is a continuous pouring of warm oil on the third eye, that is midpoint between the both eyebrows. These are the Panchakarma upakramas. Also, we have next slide. Miscellaneous upakramas, that is modalities for pain management. In Udva Chaturgatroga, Shirodhara, pouring of medicated oil over forehead. Abhyanga, massage therapy. Pichu, application of medicated cotton swab. Anjan, application of medicated coal. eye care with medicated oil, Karnapuran ear therapy with medicated oil. बाह्य स्नेहन स्वेदन, स्थानिक बस्ती, रिद बस्ती, external oleation cardiac region, cardiac pain, पृष्ठ बस्ती, external oleation in pain at scapular region. Abdominal region, snehan, snehapan, external oleation, for example, ingestion of ghee, anuloman purgatives, abhyanga, virechan induced purgation, vatanuloman antiflatulent modalities like, okay. Nutrition is a key to tackling pain symptoms. A sattvic diet pacifying to both vata and pitta doshas is recommended. Shadrasahar sevana. Murmur therapy. Murmur therapy has a special role to play in pain management. Instant pain relief is a motive of murmur therapy. So, stimulation of murmur can produce analgesia by secreting a number of prostaglandin inhibitors, endorphins, interferon, and other opioid-like substances. These are the messengers for the brain, which relieves the pain. So, are 100 times more potent than opium. The types of pain occurred in shoulder region. The Shipra murmur and Kurpara murmur should get stimulated. Pain in abdomen, then Kurpara and Urvi murmur, which is situated on the hand. Chest pain, Kurpara, Urvi, and Ani murmur. Then cervical neck pain occurs. Then Shipra, Kurpa, and Ani murmur. And leg knee pain occurs. Then Shipra, Gulfa murmur should get stimulated. Next is next slide. Yoga brings energy and flexibility to the body, reduces stiffness of muscle and joints, control the mind, promote general well-being. For example, a forward bend, uttasana, knees to chest, apanasana. Also, the pranayama is a valuable tool to manage pain, increase the pain threshold, regulating the breath revitalizes the body. So, cultivating a positive state of mind, doing meditation reduces anxiety and stress in painful condition, improve mental and emotional states, helps to improve mood, make an effort to improve quality of sleep, meditating. All these treatments are pacifying the aggravated vata over the body. In Ayurveda, pain is considered as aggravation of vata dosh. This may be vata alone or accompanied with the other doshas. Ayurveda present cautious, self-aware pain-reducing techniques that are effective and non-addictive. Vedana Sthapana, Shul Prashaman, Angamarda, Prashaman formulations, and Ayurvedic therapies like Abhyanga, Svedan, Basti, Agni Karma, Rakta Mokshan, Marma therapy has a special role in pain management. Simple yogic postures, basic Panchakarma like Snehan, Nasya, Basti, Svedan, music, mantra, food, and herb mineral preparations can be used for specific disease, person, or symptoms. So, increase the pain threshold and reduction of the causes of pain is a whole new approach towards the pain. Thank you so much.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. Mayuri Namtio Atare for the paper presentation.
Yes, sir.
Hello, Dr. Mayuri. Please share the screen, doctor.
Yes, sir. Yes, am I audible?
Yes, doctor, you're audible.
Okay. Good evening. My name is Dr. Mayuri Atre. I am a final year PG student from BSDT's Ayurveda Mahavidyalaya. And my
Hello,
topic.
doctor.
Yes.
Your PPT is not visible, doctor. Your screen is visible, but the files are, we can see only files. Your PPT is not visible, doctor.
Okay, 1 second.
Please open your PPT, then share the screen, doctor.
Okay.
Okay, now visible, doctor. Please start the session.
Okay. So my topic for presentation is Pathya, understanding the significance and application of Pathya in principles in Ayurveda. So my paper focuses is that Ayurveda has many fundamental principles such as Rutucharya, Dincharya, etc., which central idea is the concept is Pathya and Apathya, originating from the root word Pathya.
Doctor, now your screen is not visible, doctor.
Is it visible?
No, doctor, not visible, doctor. Doctor, I will share for you, doctor.
Okay.
Please start the session, doctor.
Okay, so my paper focuses on Pathya. So Ayurveda establishes various fundamental principles such as Rutucharya and Dincharya to preserve health. So central to this ethos is the concept of Pathya and Apathya, originating from the root word Patha, denoting a way or channel. This distinction between Pathya and Apathya extends beyond the daily living practices. It represents a cornerstone of Ayurveda's philosophy. Understanding and applying the principles of Pathya and Apathya plays a pivotal role in promoting healthy living and treating ailments within Ayurvedic practices. The paper dwells into profound significance and practical application of Pathya and Apathya in the realm of Ayurveda, shedding light on their crucial role in holistic health management. Next slide. So the aim of the paper is to explore, elucidate, and analyze the profound significance and practical application of Pathya principles within Ayurveda. Its aim is to dwell in the depth of Ayurvedic concepts, particularly emphasizing the pivotal role of Pathya in holistic health management. My object is to define and explain Pathya and Apathya. And my another objective is Pathya in disease management, to explore, analyze the role of Pathya in disease prevention, management, and the potential for holistic healing. Next slide, please. So materials. So Pathya was reviewed from Charak Samhita, Sushrut Samhita, Kashyap Samhita, especially focusing on guidelines related to Pathya. Comprehensive review and analysis of these ancient texts were conducted. Additionally, recent articles, journals, e-journals were systematically searched and reviewed, compiled contemporary reviews on Pathya and Pathya. The data obtained from both ancient texts and recent publications were compared and synthesized to derive comprehensive insights into Pathya and Apathya for this study. Next slide, please. So, Ayurveda emphasizes diet and lifestyle within its treatment framework. So, Pathya and Apathya principle plays a crucial role in managing disease, sometimes alone being sufficient for curing certain stages of Vyadhi. Swasthavruta details Dincharya and Rutucharya with Ahara as a significant component. In Ayurvedic texts, Nidanas, the causative factors align with Ahar, Vihar, Aushad, etc. The primary treatment principle is Nidan Parivarjanya. The causative factors are deemed as Apathya, indicating they contribute to disease manifestation. Consequently, all diseases causing factors are considered Apathya in Ayurveda. Pathya, precisely prepared and balanced food, termed Mahabhaishajya by Acharya Kashyapa, holds this significance. Ayurveda aims to overcome disease and maintain health with Bhaishajya, Ahar, and Vihar as integral parts of treatment. Ahara as a crucial aspect features prominently in Pathya and Apathya guidelines. So the synonyms are pathya. For the pathya are satmya, swastha vrittakar, upashaya, swastha ahara parikala, hita ahara, and swastha urjaskar. While as synonyms for apatya used in the text are asatmya, swastha ahitakar, anupashaya, ahitakar, aushadha parinamakar, arashramakar, and dhatu. Okay. So the nirukti, so the word pathya is derived from the dhatu, that is patha, which means a way or channel. In Charak Sutrastan 25th chapter, Acharya has described pathya as it is one which is said to encompass nourishing ahar vihar that soothes the mind, benefits the body, and supplies nutrients, whereas apatya represents the opposite. In Monier Williams, that is a dictionary, it states that pathya in Sanskrit signifies being healthy, fit, suitable, or appropriate, associated with a specific way. Next slide, please. So, why is pathya and apatya important? So, Charka elucidated how pathya roles extends to softening circulation channels stiffened by aggravated dosha, aiding in the alleviations of imbalances. Sushruta has written a separate chapter in Sutrastan as Hitahar and Ahitahar, where he has specifically addressed beneficial and detrimental factors, reinforcing the foundational role of apatya principles in Ayurveda's approach to health. Next slide. So why is pathya important? So pathya finds multiple mentions across Ayurvedic texts, specifically within Swastha Vrutta, Dincharya and Rutucharya. It plays a crucial role in maintaining the balance of dhatus and preventing further vitiations of dosha. Pathya acts to normalize vitiated doshas, whereas apatya leads to imbalance and abnormalities. Different formulations of pathya like Manda, Peya, Vilipi must be tailored based on individual's need, specific disease, and timing. Therefore, adhering to the healthy consumption practices prescribed by pathya becomes imperative for patients seeking restoration and equilibrium in their health. Next slide, please. So, what are the effects we see in pathya? It is mentioned in Charak Sutrastan 25th chapter, in the 6th chapter in the Tika. It says that it nourishes the body, Sharira Upachaya, boosting vitality, enhancing complexion, and fostering happiness, which is stated as Bala Varuna Sukha Ayusha, sustaining longevity, that is Jivitam, improving the voice quality, that is Suswaryam, assisting in tissue growth, Sharira Dhatu Urjayati, optimizing overall body functions and health, supplying nutrition and strength. Next. So, Acharyas has given pathya and apatya according to the Rutucharya. So, in the Hemant Rutucharya, what is said to be pathya is snigdha, amla, lavan, rasayukta ahar, madira, sidhu, madhu, naveen chawal, dugdha padartha, ushna jala, taila malish, that is abhyanga, snigdha uptan, dhupa sevanam, garam garbha, and stri prasanga is said to be pathya, whereas vata vruddhikar ahar. So vata vruddhikar ahar contains all the things which are ruksha, laghu, vishad, which composes the properties of vata guna. Then prabal vayu, prabala, alpa ahar, and sattu. In Shishya Ritu, the pathyas are same as the Hemant Ritu, while as the apatya is Katu Tikta Kashairas, that is the vata vruddhikar ahar, Shita ahar, and Sheetal Annapan. In Vasanta Ritu, Sidhu Madhvik Pan, Vyayam, Uttam, etc. is said to be Pathya, while as Guru Amla Madhur Snigdha and Diva Swapna is said to be Apathya. In Grishma, Shita Graha Sevan, Dugdha Puran Shali Chawal Sevan, Jangal Pashuman Sevan is said to be Pathya, while as Lavan Amla Katu Ushna Vyayam is said to be Apathya. In Varsha Rutu, Amla Lavan Rasa Pradhana, Snigdha Bhojana, Gehu is said to be Pathya, while as Udmantha, Divaswap, Nadijal, Vyayam, Atapa, and Vyava is said to be Apathya. In Sharad, madhur laghu sheeta virya tikta ghrita pan and rakta mokshan is pathya, while as atapa taila anupamamsa ksharadati is said to be apathya. Next. So Acharyas has given pathya according to the disease. I have mentioned few, but it is given in all disease. So things which are contraindicated in New Jara is said that we should avoid day sleeping, that is diva swap, bathing, massage, heavy meals, sexual activity, anger, wind exposure, and strenuous exercise. Whereas pathya diet for Jwara is given as Yavavu, Odan, Laja. Additionally, grains such as Raktashali when mature, that is Purana, so that it will not the doshas will not increase, because already the Agni is very low, and certain varieties of rice like Shashti Shalik are permissible. Pathya in Rakta Pitta is said to be Shali, Shashti Shalik, Nivar, Kodru, Prashanti, Shamyak, and Priyangu. Pathyahar for Gulma is consumption of 8 cereals, animal meat, soups, kulath, and mugda. Next. Next slide. Discussion. So, holistic health view. Ayurveda sees food as both a cause and cure for alignments within its pathya-apatya system, taking a holistic approach to health. It targets faulty eating habits, key contributors to health problems, employing scientific dietary planning for effective health management. Beyond diet, Ayurveda integrates daily and seasonal routines crucial for overall health enhancement. Pathya varies due to individual factors like age, psychological dosha, and more, necessitating personalized diet plans. Ayurvedic health management relies on adaptable and personalized dietary strategies for optimal results. Pathya represents a trouble-free, mind-pleasing path, while Apathya signifies the unpleasant, ignoring thing. This is the difference we cannot unwise. Pathya maintains health, sustains bodily functions, ensures organ wellness, nourishing the mind, prevents disease, and corrects bodily irregularities. Embarrassing Pathya over Apathya is pivotal, given this role in prevention, which is more effective than curing elements. Thank you.
Thank you, Doctor. So next I invite Dr. Ashwini.
Good evening, ma'am.
Good evening, Doctor.
Ma'am, can you share my PPT?
Wait
Just a moment, doctor. I will share for you. Hello, doctor. Please start the session, doctor.
Myself, Dr. Ashwini Rautmare, PG third year from JSC College, Usmanabad. My topic name is Anatomical Aspect of Pitta-dharakala. Next slide, please. Sushruta Samhita is the earliest treasure of anatomical concept which illustrates the structure on both gross and microscopic level. Kala Sharir is one of such concept which is described with location, enumeration, example, and clinical utility in Garbha Vyakran Sharir Adhyay of Sharir Sthan. Kala is limiting membrane or layers in our body situated between Dhatu and Ashay. After discovery of microscope, Kala Sharir has got its place in today's science as separate entity of epithelium tissue membrane in anatomy. Pitta-dharakala, also known as Grahani, is the main site of Agni. As per Acharyas, critical review study is essential on the available descriptions about Pitta-dharakala to understand the exact anatomic correlations. Next slide. Aim and objective to study and analyze the structural entity and utility of Pitta-dharakala in the illumination of modern anatomy. Review all the available literature related to Pitta-dharakala in classic and compare it with contemporary science. Next. Kala separates Dhatu and Ashay. It is thin membranous entity which lines the internal cavity of Ashay blood vessel fibrous capsule of the joint. Sushruta has described Kala after Tvaka in Garbhavyakarana Adhyay in Sharirsthan. Dallan also tried to give an exact explanation on it. Kala have important function of either secreting enzymes, hormones, absorption, providing nutrition, etc. Next, the fluid between the dhatu and ashay subjected to heat develop from ushma gives rise to kala. The kala is covered by layer of phlegm. Many diseases of modern era are specially related with kala, such as grahani, durmedas, infertility, musculoskeletal disorder, and IBS. Next, Sapta kala. There are 7 kalas: Mansadhara kala, Raktadhara, Metodhara, Shleshmadhara, Purishdhara, Pittadhara, and Shukradhara. Pittadhara kala, it comes in 6th order. It receives four varieties of food prepared from amashay and holds in the pakvashay. It is situated between pakvashay and amashay. पक्वाशय आमाशय मध्यस्थ ग्रहणी परिकर्षित षष्ठी पित्तधराणाम या चतुर्विध अन्नपानम युक्तम आमाशयत प्रच्युतम पक्वाशयपसितम धारयति. Next, so it states that Pittadhara kala is such below to that of Ashaya, which holds the undigested food, and in the Ashaya, which propels the digested food for absorption with the function of assimilation, as the sigmoid colon and rectum are termed as purishdharakala and lined by purishdharakala. These parts of the GIT are ruled out of the discussion of Pittadharakala. Next, consideration of Amashay. From mouth to Amashay, 4 food varieties are passed in undigested form, thus comfortably can be termed as Amashay. As the fat digestion is continued till to that of jejunum, it has to be considered even the duodenum is also as a part of Amashay. Even at the jejunum, absorption doesn't take place, thus till to that of ileum, jejunum functions, Amashay extends. The part between jejunum and sigmoid colon is the ileum. Pakva Amashay Madhya is anatomically Pittadharakala or Grahani. Next, embryological correlations. The superior part and upper half of a descending part of duodenum are derived from foregut. The rest of the duodenum develops from the most proximal part of midgut. Pittadharakala is Pakva Amashay Madhyastha. Amashay is the part of Mahasruta situated above the small intestine and also said to be situated about Pittashay. Site of Pitta is Pakva Amashay Madhya. This Pitta is called Agni and has same functions like Pachak Agni. Next, discussion. Acharya Sushruta has stated the kala are the structures in the form of linings and limitations between dhatu and ashay. According to modern point of view, membranous connective tissue can be present in between dhatu and ashay. Pittadhara kala occupies the part of Mahasrutas. Mahasrutas or GIT is found to be made up of mucus, submucous, muscular, and serous layers. So, Pittadhara kala can be attributed with GIT. Next, Acharya Charaka has described Grahani but not Pittadhara Kala. He stated the Grahani is the seat of Agni. According to Vagbhat, Pittadhara Kala is called Grahani. So it is understood that Pittadhara Kala is same as Grahani. As per Ashtangrudaya, Pittadhara Kala is placed in Pakvashay where the Agni is set with Tej of Pitta. Next, conclusion. Kala is said to be Snayu, Jarayu, and Shleshmal. That means these are fibrous, serous, and mucous in nature. Serially, Pittadhara Kala is 6th one, which is Pakva Amashay Madhya. That means it occupies the part of GIT. Pittadhara Kala can be correlated with mucous membrane, which extend from lower part of stomach to ileocecal junction. 2 major functions of Pittadhara Kala are digestion of food and absorption of digested food. And to perform these, it has specific morphological, physiological, and histological modifications. Thank you.
Thank you,
Dr.
Doctor.
Aishi.
So next I invite Dr. Mahesh Sonavane. I invite Dr. Mahesh.
Hello. Am I audible?
Yes, Dr. Mahesh,
Yes,
you are
Doctor,
audible.
you are audible.
Good evening, everybody. Myself, Dr. Mahesh. I'm the final students of Ayurveda College Shavgaon from RasaBhaishajya Kalpana department. So my subject is standardization of Bhasma in classical and modern view. So in the new era of the practicing the Ayurveda medicine, a number of questions arises regarding the quality and standardization of the herbal medicine and mineral medicine, so that it is a need of time to be a standardization of Ayurvedic medicine as regarding the WHO guidelines and the Ayurveda classical views. Standardization is the measurement of ensuring the quality and is to describe all the measures which are taken during the manufacturing process and quality leading to the reproducible quality.
Excuse me,
So,
Dr.
WHO
Mahesh.
guidelines for herbal drugs.
Hello, Dr. Mahesh.
Yes.
Doctor, your slide is not moving, doctor. It is shown in the first slide.
My slide is not moving.
Not moving, doctor.
Now?
No, not moving, doctor. Now moving, doctor. It is okay. Now moving. Please continue, doctor.
So it is visible.
Yes, doctor. Visible. Visible.
Okay.
Please continue, doctor.
So WHO guidelines, as you compare to the modern and Ayurveda, there are different guidelines regarding the Ayurveda and moderns. So WHO guidelines is contain the moisture content, microbial count, heavy metals, specific gravity, melting point, boiling point, loss of drying, ash value, acid, water soluble ash values. So the difference as per the standards. So when are you preparing the medicine, the things should be taken in consideration so that practicing the medical thing, practicing the medicine, not come in under the legal or illegal medical legal concepts. So this is the need of standardization. As per the ancient methods, they are particularly plasma have good preventive regenerating potential. There is need of systematic and well-organized coordination of islands along with the adequate infrastructure and facility to solve various problems related to standardization of Rasaushadhi, metallic Bhasma. Bhasma is safe when prepared and used properly. Use of Bhasma when prepared in improper and shortcut ways can prove injurious to the health. Past scenario. Earlier, medicine was prepared by physicians themselves for their patients. The physicians were qualified, to identify the materials. They are well trained in various processes. They were followed by guidelines of Shastra. Experienced teachers were available according to the immediate need of patient. They are modified and furnished as per the occupied understanding. Present scenario. Nowadays, we see that the commercialization and professionalization of medicines have been done. Physicians today are more involved in diagnosis and treatment. Drugs are manufactured has gone into the hands of pharmacy. Large scale production, they compromise with the quality and quantity of material. Compromise with the longer and lengthy procedures. Equivalent substitutes are added in the compounds are not validated. The exact imported procedure either altered or made shortcut. This lead to the decline in the quality of Ayurvedic drugs. So standardization of Ayurvedic drugs is thus felt necessary. So standardization itself contains raw material, process, and final products. The three stages are comes under the standardizations. So in raw material, we can see the metals, minerals. These are packed with some are krutim, some are lab prepared, some are from animal origins like we can say Prava, herbal medicine specific seasons collection parts use. They should be in that way they have obtained. It should be important. The process and methodology. The process like Shodhan, Charan, Maran with the classical methods, with the advanced apparatus, or you can with Valuka Yantra Puta or the modern way furnace you can use for the process. And the final products. When the product is prepared, there should be physical organoleptic characters should be taken, chemical properties should be taken, the instrumental, the XRD or the other things, ash values uh, should be conducted so that we can come to know that the final product of the Bhasma have that much potency and don't have any impurities or the toxic substances like heavy metals. Preparation of basma as per the text, as per the classical views. The important process of making basma as purva karma. We can say that shodhan or purification. Pradhan karma like maran, incineration, calcination, and pachat karma. That is called lohita karma or amrita karma. For the production of basma, shodhan, maran, these are two fold procedures are the important steps, including some intermediate procedures in respect to particular materials like dhanyabrak for abrak and jarna for lead, tin, and zinc. Effect of Shodhana. So what happens after the Shodhan? If Shodhan is additional and separation process, it is the process of Maran. The following effects are observed during the Shodhan. Material becomes free from visible and invisible impurities. Masses of minerals convert into fine and brittle. Develop fineness, brittleness passes the Bhavana process. Particle reduction takes place. Induction of organic therapeutic properties in inorganic material. Bhavana and its effects. It is a wet titration process. Advantage of Bhavana are following. Materials are mixed uniformly. Materials are divided into fine surface area of material exposed and expanded, which facilitates reaction during the firing. Develop softness, smoothness, thickness in the material. Passes better binding of material. Enhance the therapeutic property of minerals and metals like we can say uh, when you use lower, which are is titled with Trividha or go Garrick with go group or like lemon. Pelletization. Pelletization is a process of making the disc, which is dry in a dryer or in the sun. Before putting in sharavas for sealing, it should be dried completely. Wet piles should not be allowed. Wet piles are subjected to put desired colors will not appear. Desired smoothness will be not developed. Sarva Samputikaran is arranged back in the earthen shower, converted with other shower. Joint earthen lids should be sealed exactly 7 layers with the cloth and muds. Again, dry it in sun or in a dryer. Properly sealed prevents the escape of volatile materials. It prevents interference of outside gases, dirt, which avoids the contamination or another chemical reactions. Finally, sealed shara was subject to put testing of repeated heating till the material completely converted into bhasma. Desired characteristics often. Put a system for fitting. Puta is a specific system of fitting for the incineration materials and minerals. For the hard, soft, organic, inorganic, volatile, inflammable, according to heat resistance, various Puta has been described in a classical granthas. According to quantity of fuel, Mahaput, Gajaputta, Varaput, Kukutput, Kokuput, Go, Gorakhput, Banda, Tusha, etc. Puta mentioned. It depends on the number of the cow dungs and their quantities. Each every puta has different diameters, intensity of heat, mode of temperature, and time duration depends upon the puta. According to heat resistance, the material puta are selected and applied for the Maran purpose, such as for gold and silver, Lagu or Kaput put, Vanga, Nag, Yashoda, Kukut put, or Ardha Gajaput, Tamba in Vara put or Kukut put, Abrak, Lower, Vara Gajaput selected. Maran. Maran terms denotes the meaning of inflammation and calcination when the minerals, compounds, metals are subject of for heating on moderate to intense temperature. Compound matter converted into other compounds, whereas elements are get reduced to certain compounds. Nature of compounds depends upon the material added into the main material and exposure of environment. Various system of heating is applied to for these processes, but the Puta system is heating is common for Maran. Maran is associated with dissociation process. Elements are converted to certain compounds. Metals are reduced to ash like forms compounds. Compounds are converted to certain other compounds. Nature of the compounds found depends upon the material used for Maran. It may be sulfide, oxide, chloride, sulfate, depends upon the which mineral or which uh, material is going to process. Macro forms of material converted into microforms, means is larger to smaller. Heavy and solid material converted into light and soft. So post-operative specific treatments, we can say that after the preparation of the basma, the last stage is Lohitikaran and Amritikaran. In some case, post-operative procedures are also followed to achieve the effect of desired bas. Amritikaran is remove the remains blemishes of the basma. It enhances the therapeutic properties of the basma. Lohitikaran is develop desired red color in case of low and upper basma. Process reaction. Raushadis are mainly based on minerals, compound states, and metal selenium state. The base material, even when treated frequently with the plant extractives, and rated on the following reactions are observed: Marin's compound reduction and dissociation process. Plant extractives are converted into ash or soil organisms in organic forms depending upon the intensity of the plant. Compounds are reduced or converted into another compounds. Elements matter gradually reduce and convert into compound. Nature of compound depends upon the media as a catalyst added. Herbal reduces acidity particles in the formation compound or it may be present with the mineral compound. When grinding after each firing exposes the surface of metallic particles. Exposed surface is coated with the media of catalyst for further reaction. Bhasma Pareeksha. When all these things are completed, so we have the two types of Granthokta and modern standardization. The Bhasma Pareeksha given in the authentic text is
Hello, doctor.
hello.
Doctor, please speed up. You are exceeding the time limit.
Yes, ma'am. The physical properties like color, tastelessness, nidurmatva, apurvatva, nirutta, amla pariksha, or ashtavaksha. These are the things we can see the test, and this is the for the specific metals, minerals, and this is the one when we burn with the flames like Kartola, Kapil, Swarna with Pit. This is a modern parameter. We can perform this with these modern instruments like EDX, XRD, XRF, extraction chromatography, HPLC, so that we can come to know whether the different types of organic materials or natures are converted. This is the types of modern instruments which during the standardization of the materials. Instruments photos like how it appears. And this is the permission limit of heavy metals as per the API. And phytogenetic chemicals like color, LOD, total ash value, acid sulfide, water soluble ash, solubility, particle size, and intensity. Parameters for the different things which are given as per the API. And non-medicine, the Basma and its relation to modern non-medicine nanotechnology, increased surface area, enhanced solubility, increased rate of dissolution. Swalpa matra will work in large quantity. Conclusion: to get these properties of Raushadis, Basma, SOP, and SMT. Standard of operating procedure, standard multi-procedure should be followed as the mentioned as the literature for the modern technique. Thank you.
Thank you, doctor.
So next I invite Dr. Ashish Anna Mokal.
I am audible, ma'am.
Yes, doctor,
you're
audible. Please share the screen, doctor.
Yes. Hello.
Hello, doctor.
Some technical issues, sir. Please share my slide.
Okay, doctor. Please start the session, doctor.
Myself, Dr. Ashish Annamukal, PG second year student from Nidana department, under the guidance of Dr. Rajesh Maski sir from CIRC Ayurveda College, Nigdi, Pune. Topic of my presentation: pneumonia and COVID-19. Next, please. Introduction. It is an inflammatory condition of the lung that is caused by microbial agent. Pneumonitis is a general term that describes an inflammatory process in the lungs tissue that may be predispose a patient to or the patient at risk for the microbial invasion. It is a leading cause by the death from the infectious disease. Next, sir. Definition: an inflammation of the lungs is parenchyma, the respiratory bronchioles, and the alveoli. It is known as the pneumonia. Pneumonia is the mainly caused by the microorganism which enter the lower respiratory system and cause the infection. The microorganisms include the bacteria, mycobacteria, myoplasma, fungi, parasite, and viruses. Next, sir. Epidemiology. Common illness affecting the approximately 450 million people a year, occurring in all the parts of the world, and 4 million dead early. Rates are the greater in children less than 5 years and adults older than 75 years. These occur 5 times more in the developing world than the developing world. Next, sir. Classification according to the causative organism. Bacterial pneumonia, pneumococcal pneumonia caused by the streptococcal pneumonia, staphylococcal pneumonia caused by the streptococcus aureus, influenza pneumonia caused by the Haemophilus influenza, gram-negative bacteria pneumonia caused by the Klebsiella pneumonia, anaerobic bacteria pneumonia caused by the normal oral flora. Next slide, sir. Classification of viral: rhinovirus, coronavirus, influenza virus, respiratory syncytial virus, adenovirus, and parainfluenza. Herpes simplex virus rarely caused by the pneumonia in newborns, person with the cancer transplantation, and people with the significant ones. People following organ transplantation immunocompression present high rate of the cytomegalovirus pneumonia. Fungal pneumonia caused by the histoplasmosis, bactoplasmosis, ocodomycetes, aspergillosis, candidiasis. Classification according to the environment: community acquired pneumonia, hospital acquired pneumonia, pneumonia in a immunocompromised host, ventilator acquired pneumonia. Next, sir. Classification according to the area lungs involved and affected: lobar pneumonia, multilobar pneumonia, bronchial pneumonia, interstitial pneumonia, alveolar pneumonia, necrotizing pneumonia, segmental pneumonia. Etiology: there are many caused by pneumonia, including the bacteria, virus, myoplasma, fungus, agent, and the protozoa. It is may also result from the inhalation of a toxic or causative chemical, smoke, dust, gases, or aspiration of food, fluids, or vomiters. Pneumonia may be complicated to chronic illness. Risk factor: age 60 or older, smoking, air pollution, alter consciousness, alcoholism, head injury, anesthesia, drug overdose, tracheal intubation, upper respiratory tract infection, chronic disease, chronic lung disease, diabetic mellitus, heart disease, and cancer. Next slide, sir. Pathophysiology: infective agent, foreign substance, blood-borne organism that the enter of the blood circulation or aspiration of gastric content cause the inflammation of a pulmonary tissue affecting both ventilation and diffusion. The alveoli fill up the exudated and mucosal edema of alveolar membrane occur. Next slide, sir. Interference with the diffusion of oxygen and carbon dioxide or causing occlusion of alveoli resulting in a decreased alveolar oxygen tension. Hypoxia occurs with a retention of a carbon dioxide, shortness of breath, fatigue, crackles in the lungs, or decreased breath sounds. Next slide, sir. Clinical manifestations: fever, chills and sweating, productive cough, shortness of breath, pleuritic chest pain, hypoxia, fatigue, and tachypnea. Next slide. Diagnostic evaluation: physical examination, chest X-ray, gram stain and culture sensitivity test of the sputum, blood culture, immunological test detect the microbial agent, CT scans thorax, and transtracheal aspirate, fibrotic bronchoscopy and transcutaneous needle aspiration or biopsy, transcutaneous oxygen level analysis or ABG. Management: positive organism, Streptococcus pneumonia, penicillin. Antibiotic of the choice is penicillin G, penicillin V, amoxicillin clavinate, sulfametazole. Alternative antibiotic are microlide antibiotics such as azithromycin or clarithromycin, doxycycline or beta-lactamase such as the cefuroxime, linezolide. Staphylococcus aureus or the antibiotic choice is penicillin. Alternative antibiotic by the cephalosporin vancomycin or methicillin, resistance of the Streptococcus anuresis. Haemophilus influenza, antibiotic choice of the second, third generation of cephalosporin, beta-lactamase inhibitor, doxycycline. Alternative antibiotic are azithromycin. Next slide, sir. Management, oxygen therapy, nutritional support, fluid and electrolyte management, bronchodilator medicine, deep breathing exercise and spirometry, chest physiotherapy, percussion and vibrations, postural drainage and nasotracheal suction. Complication, empyema, lung abscess, bronchial obliterance, acute respiratory distress syndrome, sepsis, bacteremia, hypotension and shock, especially gram-negative bacteria, disease, particularly in elderly patients, atelectasis, pleural effusion, and pericarditis. Prognosis, with the treatment of most types of the bacterial pneumonia will be stabilized in 3 to 6 days. If often take a few weeks before most symptoms result in a person requiring hospitalization, mortality is maybe high as a 10%, and those requiring intensive care, it may be reached 30 to 50%. Expected outcome, the client will be able to airway with the breath sounds is clear and absence of the dyspnea and cyanosis. Improve the ventilation and oxygenation of the tissue by ABG within the client acceptable of the range. Participant in action to maximize oxygenation. Achieve the timely resolution of a current infection without any complication. Coronavirus and pneumonia. Most people who get a COVID-19 have a mild or moderate symptoms of the coughing, a fever, a gulp, a shortness of breath. But some who catch the new coronavirus get a severe pneumonia in both lungs. COVID-19 pneumonia is a serious illness that can be deadly. COVID-19 pneumonia symptoms. A fever, a dry cough, and shortness of breath are common early signs of the COVID-19. You may also have a fatigue, chills, nausea, vomiting, diarrhea, belly pain, muscle pain, body ache, headache, loss of smell, taste, a sore throat, congestion of runny nose, pinky eye, and skin rashes. How is COVID-19 pneumonia diagnosis? Blood test may be also show the sign of the COVID-19 pneumonia. This is including the low lymphocytes.
Doctor?
Yes, sir.
Doctor,
Yes, ma'am.
you're exceeding the time limit. Please be fast.
Yes, ma'am. COVID-19 pneumonia, high risk of the COVID-19 pneumonia. Take these tips, prevent the infection, wash your hand, wash and sanitizer gel that's the at least 60% alcohol. Avoid the niche, avoid the any who six, stay home and avoid the other 3 golden rules of the always wear the mask. The treatment of the intravenous IV fluid dehydration. Clinical trial looking the condition, treat the severe COVID-19 related to pneumonia, dexamethasone or corticosteroids. X-ray investigation for the normal COVID-19 pneumonia and COVID-19. That is the normal bacterial pneumonia, viral pneumonia, and COVID-19 pneumonia. CT scan normal lungs and COVID-19 affected lungs. Thank you so much.
Thank you, Doctor.
Thank you.
So next I invite Dr. Sushmita. I invite Dr. Sushmita.
Yes, ma'am. Am I audible?
Yes, Doctor.
Audible.
Yes, one sec. I'll share my screen. Good evening, everyone. Am I audible, ma'am?
Yes, Doctor. Audible, Doctor.
Hello.
Please
Yes,
start
Doctor,
the
you're
session.
audible.
Yes, myself, Dr. Sushmita, second year PG scholar, Department of RasaBhaishajya and Vaishajya Kalpana, Sri Shiva Yogeshwar Rural Ayurvedic Medical College and Hospital, Inchal. My topic is regarding overview of nanotechnology in Ayurveda. As we all know, nanotechnology is an emerging new branch of science in the present era, with many possible applications in various fields like medicine, health, transportation, etc. Next, introduction. Nanotechnology is the advanced scientific technology of the 21st century. The term nanotechnology is derived from the Greek word nanos, which means drop. It is a new technology in drug delivery system. It's aimed to develop devices and dosages in the range of 1 to 100 nanometer, which can be increased up to 1000. Nanotechnology makes use of nanoparticles that have a high surface area and can reach the targeted site because of its extremely small size. Nanotechnology and herbal science is combined to overcome the limitations of using herbal drugs. The development of novel drug delivery system for herbal medicines includes nanodose, which helps in enhancing the biosolubility, bioavailability, protection from toxicity, sustained delivery, etc. Next, branch of Ayurveda which deals with the herbo-mineral preparations are called as basmas, which is comes under a RasaShastra. RasaShastra is an integral part of Ayurveda, deals with numerous formulations based on metal herbal combinations. The major therapeutic actions of basmas are their ability for immunomodulation, anti-aging property, also known as rasayana in Ayurveda, ability to target the drugs to the site. Such Ayurvedic preparations are claimed to be non-toxic, absorbed readily, and biocompatible. Basmas used in Ayurveda for the treatment of various diseases for past several centuries. It is the oldest form of nanotechnology applied in Ayurveda. Basma is prepared by repeated marana and mardana of a metal with some herbal juices and a specific drug in Ayurveda. This concept is known as samskara, that is called as processing, done through shodhana, bhavana, and puttapaka procedures, which in turn reduces the particle size of the metals and minerals extremely finer. Nanotechnology science, which is a manipulation of matter on an atomic, molecular, and supramolecular scale. It is therefore common to see the plural form nanotechnologies as well as nanoscale technologies to refer to the broad range of research and applications whose common trait is regarding size. Applications of nanomaterials in the medicine, how it is applied. These applications include gene delivery, fluorescent biological labels, drug and biodetection of pathogens, probing of DNA, structure, tissue engineering, tumor detection, separation and purification of biological molecules and cells, detection of protein, MRI contrast enhancement, and phagokinetic studies. Like this, the nanomaterials were used. Nanotechnology and Ayurveda. Ayurvedic system of medicine is one of the oldest system of Indian traditional medicine. In this system, various medicines are based on metal mineral formulations, popularly known as basma. These different types of basmas, which are fabricated using traditional methods, are called as basmikarana. In the herbometallic preparations, the particles used have a diameter of about 10 to 15 nm. Basmas is now being considered Ayurvedic nanomedicine and provide opportunity for drug designing, employing modern concept of nanomedicine. With the increasing importance of nanotechnology in medicine and health sector, the emergence of engineered nanoparticles in therapeutics is disturbing due to their possible harmful effects. The early utilization of nanomedicine was in the form of Ayurvedic basma, which is comparatively safer for usage of humankind. The use of nanoparticles of metals in medical field has been a general practice in Ayurveda. During Bhasmikarana, the metals and minerals are treated to different processes or purification and incineration. That is, they change from their original state to its oxide state, which aims to reduce the particle size. The main of that. The Basma nanoparticles are organometallic and organomineral compounds having improved stability, performance, absorption, assimilation, bioavailability, and targeted delivery of the element. Nanocarriers used in drug delivery systems are like in nanotechnology, nanoparticles are used for site-specific drug delivery. In this technique, the required drug dose is used and the side effects are lowered significantly as the active agent is deposited in the morbid region only. This highly selective approach can reduce costs and pain to the patients. Nanomedicines used for the drug delivery are made up of nanoscale particles or the molecules which can improve drug bioavailability. Nanocarriers are used as a transport module for another substance such as drugs. They are used as the DDS. Commonly used nanocarriers includes liposomes, dendrimers, polymeric nanoparticles, silicon or carbon materials, magnetic nanoparticles, and nanoemulsions. Some are the here I'm quoting some examples with their nanoparticles consisting of and their dosage. Rajata Bhasma, which includes pure silver metal, ferric oxide, ferric sulfur, calcium, and silver chloride, with the traces amount of potassium, sodium, and aluminium, which is prescribed in case of respiratory disorders with a prescribed dose of 30 to 120 mg. Next is Swarna Bhasma, which consists of metallic gold, ferric oxide, silica, phosphates, salt, and traces of magnesium and copper. It is useful in the case of chronic diseases such as tuberculosis, cough, anemia, and the dose is 15 to 30 mg. We can prescribe. Next is Plasma, which consists of ferric oxide, ferrous oxide, and magnesium oxide with traces of potassium and phosphorus, which is used in case of Urakshata, that is chest pain, gulma, piles, liver diseases, and spleen diseases, anemia with a dose of 30 to 240 mg. The next is Tamra Bhasma, which consists of Tamra for a medicinal use where metallic sheet, bright reddish in color, heavy, soft with a having a high tensile strength. And apart from this, Tamra in management of krimi, that is worms, arshas, piles, stowel obesity, kshaya, it can be prescribed with a dose of 50 g. These are
Hello, doctor.
Hello. Hello.
Doctor,
Thank you,
is that
doctor.
over?
Last two slides are remaining, ma'am.
You have some. I think you have some network problem, right, doctor?
Yeah, it's a network issue. Sorry for the inconvenience. Sorry. These are some
It's
other
okay, doctor.
are detected. In case of calcium oxide, tamra bhasma peroxide, bhasma silver sulfide, mandura bhasma iron oxide, shanka bhasma calcium oxide, yashadu bhasma zinc oxide, swarna bhasma gold, and naga bhasma lead sulfide, trivanga bhasma lead tin zinc oxide, mukta bhasma calcite. Bhasma Pareeksha in case of Ayurvedic as well as modern. In case of Ayurvedic, there are physical tests like Rekha Purnatva, Lakshanatva, Sukshma, Anjana Sanibha, Varitara, and Unama. Chemical tests like Varna, Gatra Sattvatvam, Nischandratvam, Apunarbhavatvam, Nirutya, Amritikarana. In case of modern, there are some criteria like color, odor, particle size, lost on drying, total ash, and water soluble extractive, acid insoluble extractive, assay of element. The ultimate conclusion is like the combination of nanotechnology with Ayurvedic medicine will provide a very useful tool in designing future medicines with wise profile and toxicity. Ayurvedic formulation consisting of bhasma in ancient nanomedicine for treatment of various illness. Using nanotechnology principle, various dose-related adverse effects can be prevented as it has been able to reduce the amount of drug that needs to be loaded. This will also help to increase the potency and safety issues related to Ayurvedic drugs and formulations. On the basis of this review, we can conclude that the use of Ayurvedic drugs and the formulations in the nano carriers will increase the potential to treat the various chronic diseases. This will effectively increase the bioavailability and stability and will also reduce the dose of various potent drugs. Thank you.
Thank you, doctor.
Thank you,
Next is your poster
doctor.
presentation.
Yes.
Doctor, are you ready to present poster now, doctor?
Yeah, yes, I'm ready.
I will share the screen, doctor. Please start the session.
Oh, okay, sir. Yes, sir. May I start, sir?
Yes, please, doctor. Please start, doctor.
Yes, thank you. This is my paper presentation topic, that is advanced forms of lepa kalpana with special reference to ointments. Lepa kalpanas is one of the upakalpana which is mentioned in Ayurveda for external applications of the body surface. Absorption of drugs through the body surface deserves a special care for its optimum delivery. Lepa kalpana plays an important role in Ayurvedic system of medicine, but nowadays applications of lepa in an actual form and also it is having various disadvantages like impediment in utilization, protection trouble, non-accessibility of medications in all the seasons and so on. Consequently, pharmaceutical changes is the key for the better upgrade of adequate shelf life usability, agreeability and to the items. So there is advanced forms like ointments, gels and the creams. Lepa kalpanas in the ancient era where shushka dravyas are grouped with grounded with a water well and made into a paste and used as external applications. There are types of lepa like pralepa, pradeha, alepa and doshagna, vishagna, varna and other types. Their altered forms are like ointments, gels and the creams. Where in case of ointments, we use the bases, different types of bases are being used. And method of preparation, there are two methods in the preparation method, trituration method and emulsification method. Conclusion, topical application is providing the therapeutic benefit by reaching local tissues and with a minimal side effects. Hence, lepa kalpana is a very important treatment procedure for poison, arthritis, wound, etc. and also have a cosmetic value. In contemporary era, there are tremendous opportunities for the further advancement of lepa kalpana for much better therapeutic and cosmeceutical purposes. By adopting current science and technology, various advancements have been done in lepa kalpana and all these advanced doses form suitable in present scenario. Thank you.
Thank you, doctor. So next I welcome Dr. Sayali Misal Sayyed for the presentation.
Dr. Sonali, are you there? Hello, Dr. Sonali Misal, are you there? Okay, next I invite Dr. Rashmi Veer for the paper presentation. Hello, Dr. Rashmi Veer, are you there? Hello, Dr. Rashmi Veer, are you there?
Doctor, please unmute and respond.
Hello, Dr. Rashmi Veer, are you there? Next, I invite Dr. Pradeeksha for the poster presentation. Dr. Pradeeksha Madanraj Lade for the poster presentation. Dr. Pradeeksha, are you there?
Yes, sir. Yes, sir.
Okay, doctor, please share the screen, doctor.
Okay. Can you see my slide?
Yes, doctor. Visible. Please start, doctor.
Okay. Good evening, all of you. Myself, Dr. Pratiksha Madanraj Lade, PG second year student of Department Stree Roga and Prasuti Tantra from Dr. D.Y. Patil Ayurveda College, Pimpri, Pune. Here presenting a poster on the topic Garbhini Paricharya, that is antenatal care according to Charak, under guidance of Dr. Rahul Bharate sir. Okay, let's start. Here one of the sutra is given for Samanya Ahar Vihar of Garbhini, that is Tasmad Hitana Vihara. Tasmad Hitana Hara Viharana Praja Sampada Michanti Stri Visheshana Varjayata. Sutra says that उत्तम गुणयुक्त संतान की इच्छा रखने वाली स्त्री को अहित आहार विहार का त्याग करना चाहिए. So nowadays we can say that Garbhini have to avoid junk food, fermented food, alcohol, extra oily food, etc. And next is Mansanmasik Pathya of Garbhini. Acharya Charak has given month-wise schedule of Ahar for Garbhini in Charak Samhita Sharir Sthan. Let's see. First is Pratham Masa. Non-medicated milk should be taken in morning and evening. Only milk should be taken by Garbhini in morning and evening apart from Ahara. Then next, Dvitiya Masa, milk medicated with Madhura drugs. Madhura drugs like Kakoli, Kshir Kakoli, Jivak, Rushabhak, Meda, Mahameda, etc. There is a big list of Madhura drugs given in Viman Sthan of Charak Samhita. You can see. Then next is Tritiya Mansa, Kshira, that is milk medicated with Madhu and Ghita, should be taken by Garbhini in Tritiya Mas. Then Chaturth Mas, only butter or milk with butter Garbhini have to eat in Chaturth Mas. Then Pancham Mas, Ghita prepared with butter extracted from milk. That is, Garbhini have to include Ghita in her ahar, which is prepared with butter extracted from milk. Then Ghita medicated with the drugs of Madhura group suggested in Shashta and also Saptam Masa of pregnancy. Then Ashtam Mas, rice yavagu is suggested, which is prepared by milk and ghita. And then Navam Mas. In Navam Mas, Charak have advised use of Anwasan Basti with oil prepared with the drugs of Madhur group, as well as vaginal tampon of this oil should be given for lubrication of Garbhasthana and Garbhamarga for Sukha Prasava. So in this way, this is Mansanumansik Pathya for Garbhini of Ahara and Vihara. So next is benefits.
Hello, Dr. Pradiksha.
Hello, Dr. Pradiksha. Can you hear me? Hello, Dr. Pradiksha. Can you hear me? Okay, next I invite Dr. Uday Shirangrao Jadhav for the paper presentation. Dr. Uday, are you there?
Yes, sir, I am here.
Okay, doctor, please share the screen, doctor.
Okay.
Hello, Dr. Uday.
Hello, sir. Can you share the screen, sir?
Okay, doctor. Please start the session, doctor.
What, sir?
Please start the session, doctor. Screen is visible. Please start the session, doctor.
Okay, okay. Sorry, sir. Hello, myself, Dr. Uday, LKR Ayurvedic College, Good English, Kolhapur. Topic name: Role of Ayurveda in Pediatric Care. Next slide, sir. Introduction: Ayurveda is the science of life for preventive and curative aspect of disease. In Shushupakrama Adhyay of Kashyap Samhita, Human Sthan, Komarhotya has been termed to be the Adi Ang, first and the most important Ang of the 8 Ang of Ayurveda. Next. Childhood is the pillar of adulthood. Emotional, social, and physical development of young children has a direct effect on their overall development and on the adult they will become. That is why understanding the need to invest in very young children is so important, so as to maximize their future well-being. Nowadays, number of newer diseases are arising due to various microbial mutation, leading to almost availability of no treatment at all. Therefore, a strong immunity should be developed among children to fight against the disease and providing special care in prevention of upcoming disease as well. Here, Ayurveda plays a major role in promoting safe and effective measures to not only treat disease but also maintain the health by improving one's immunity of the body. Hence, the long-standing motto of Ayurveda of maintaining health as well as curing the disease in children will not be suppressed despite of fast-forward generation and improper lifestyle. Next. Aim and objective. Aim to study the role of Ayurveda in pediatric care. Objective to discuss various ways of child care described in Ayurveda. To understand role of Ayurveda for healthy well-being of child. Next. Materials and method. Pediatric care needs different therapeutic approaches for the management of various diseases as compared to disease of adult age. Ayurveda suggests different modalities for the prevention, diagnosis, and treatment of pediatric disease. Therefore, preventive aspects of include stanyapan, role of dincharya, and ritucharya, etc. Diagnostic features include external symptoms considering stanya dushti, bija dushti, graha rog, and lifestyle associated with mother and child. To study the role of Ayurveda in pediatric care as per classical guidelines, the literature search was performed using the following electronic database: Google, Google Scholar, PubMed, Science Direct, Cochrane's library, different research journals using keywords like Ayurveda, immunity, Balrog, immunization, doshas, and its effects as per as Ayurveda, Pamadhutya. Next. Discussion. WHO states that health is a state of complete physical, mental, and social well-being and infirmity. But Ayurveda has defined health is a very subtle way that health is a state where the three doshas, Agni, Saptadhatu, Mala are all in balanced state along with pleasant state of Atma, Indriya, and Man. Therefore, the Vedic Kshamata also depends on all these factors. In the case of children, their immunity depends on various factors apart from mere eating habits, vaccination schedules. Other factors are preconception care, optimum quality of reproductive organs of parents for better progeny, lack of proper sleep patterns, socialization, and parenting, etc. Next. Preconception care, physical feature of child, the behavior, etc. all depend on the child's parents. Therefore, it concludes that all the features of child are decided at the time of conception. As per modern science, genetics play a major role in inheritance of traits from their parents. In the same way, disease can also be inherited through the genes. Gene mutation can take place due to the chromosomal abnormality. These abnormalities can get developed due to the improper lifestyle of parents, like consuming heavy amount of junk food on a regular basis, late night sleep patterns, alcohol, smoking, etc., leading to the same traits getting inherited by the child. As per Ayurveda, Shukra and Shonis are responsible for the formation of Garbha. Next. Breastfeeding. Every infant and child has the right to good nutrition according to the Convention on the Rights of Child exclusive breastfeeding. For 6 months has many benefits for infants and mother. Primary among these is immunity against gastrointestinal infection, which is observed not only in developing but also industrializing countries. According to Charak Samhita, Matrustanya, that is breast milk, is involving nourishing, nutrition-rich, congenital to human body, etc. But if due to the carelessness by the mother, the breast milk can get variated like chewing of betel nut, all types of kashay, rasatmak dravya, rukshat therapies, etc., which in turn can affect the health of the child. It is referred to as stanya drishti. This can lead to various types of disorder like excessive feces and urination, retention of urine and feces, burning sensation, excessive crying, etc. in children. Next. Lack of proper sleep pattern. Proper sleep pattern applies to both parents as well as children. It is because the children learn from their parents' daily routine and the same in their life as well. Without proper sleep, the to properly function on the next day. This cycle continues daily routine, affecting his or her health simultaneously. Some of the impacts seen are difficulty in concentrating, mood swings, behavior pattern, insomnia, learning problem, etc. Hence, proper sleep pattern should be taught to the child right from the childhood to prevent further degradation of health in the future. An average time duration of the sleep for an infant is 14 to 16 hours, toddler is 11 to 14 hours, school age is 9 to 12 hours, and teen is 8 hours. As per Ayurveda, Nidra is considered as one of the uh, three pillars of life. Nidra is a Adharniya way, therefore it shouldn't be avoided and one should take a proper sleep at a proper time. Next. Diet. Nutrition for children is based on the same principle as nutrition of adults. Everyone needs the same type of nutrition such as carbs, protein, fats, vitamins and minerals. Children, however, need different amounts of specific nutrients at different ages. Nutrition is equally important in child's life to reach their developmental milestone at the proper age, or else it can have various effects on their body leading to discuss like PEM, etc. Therefore, consumption of balanced diet is necessary step nowadays to prevent disease. Apart from this, avoidance of junk food should be taken into consideration or of potentially greatest concern. Our poor dietary behaviors are encoded in both our DNA and get microbes, and this the harmful immune modification are passed to our offspring during their most critical development window. Hence, improvement in diet can build a better immunity in their children as well. Next. Implementing Suvarna Prashana among children. Suvarna Prashana, being a very unique concept in Ayurveda, has become one of the popular procedure beneficial for young age group over the recent year. Kashyap Samhita, one among the oldest literature in Ayurveda in the subject of pediatrics, mentions about Suvarna Prashana. Clinical and pharmacological studies show immunomodulatory, nootropic as well as therapeutic effect of Suvarna Prashana therapy. Though electricity like this medicine is administered and immunity is developed. Next, Panchakarma procedure for children. In Ayurveda, Panchakarma procedure play a major role in purifying the body only in adults, but also in children. Among this procedure, one of newborn care protocol scientific of present era prove the scientific background protocols. Next, yoga or exercises. Nowadays, lot of cases seen regarding cancer, diabetes, stroke, or even heart disease. These major illnesses are mainly because due to the lack of physical activity. Research also
Hello,
shows that.
doctor.
Hello.
So your time is up. Please speed up.
Okay, ma'am. Research also shows that regular physical activity can boost our self-esteem. As per researchers, inactive children are like to become inactive adults, putting younger people at risk of developing life-threatening conditions. Yoga raises the autonomic changes and improvement. Rakshagna karma, prevention is better than cure. Ayurveda is always given a prime importance of prevention of disease. Measure of prevention include ahar, vihar, dincharya, ritucharya, etc. Dhupan is one of the part of it. According to Ayurveda, Dhupan is described especially as per Rakshagna karma. Acharya Kashyapa is dedicated one whole chapter for Dhupan. Socializing and ideal parenting. Socializing is tied to many other parts of children developing in their early years. It starts when the body is born and continues into adulthood, shaping each stage of development all the while. Every single interaction, like childhood, no matter how big or small, helps them learn language, skill, cope with emotions, and work within social norms. The next, by socializing outside the family world, the child learns conclusion. After discussing above mentioned point, it can be concluded that adopting treatment modalities like Dhupan, Swarna Prashan, exclusive breastfeeding, Dincharya, and Rutucharya, etc., can have a major impact on the child by uplifting its immunity mentally and physically both. Therapy, preventing and curing most of the disease with faster recovery. Ayurveda depicts different approaches for the prevention, diagnosis, and management of pediatric disease. Therefore, implementing preventive methods can help maintain disciplined lifestyle to retain healthy life. Sanskar is useful for child not only in modern day but also in intra life. Because of sanskar, child develops proper habits. He also learns to clarify things in life. It gives him unique identity and educated child. Madhya Rasayan improves memory, improper grasping, tolerance, increase circulation to the brain, sharpen concentration, etc. Thank you.
Thank you, doctor.
Thank
Now
you,
I
ma'am.
invite Dr. Jayashree Bakmare. I invite Dr. Jayashree.
Dr. Jayashree Tadaram Vakmare, are you there? Hello, Dr. Jayashree, are you there? Okay, next I invite Dr. Ankita Prabhakar Dahipale for the paper presentation. Dr. Ankita, are you there?
Yes, sir.
Okay, doctor.
I'm audible, sir.
Yeah, audible, doctor. Please share the screen, doctor.
Our screen is visible. Hello.
Your screen is sharing, doctor. But
Hello.
your screen is visible, doctor. Please
Okay.
open your PPT, doctor.
Okay. Good evening, everyone. I'm Dr. Ankita Prabhakar Devale from PG Scholar from the Department of Nidana, Sumitwai Shah, Ayurvedic Mahavidyalaya, Hadapsar, Pune. Today's my topic is clinical study of Ayurveda. This is hepatocellular jaundice with Ayurvedic management. Introduction. Jaundice is a clinical symptoms of underlying bilirubin metabolism problem, hepatocellular dysfunctions or biliary blockage. Positions only in the presence of serum hyperbilirubinemia and indicated either liver illness or the least frequency of hemolytic condition. Jaundice can be affected people of all ages and is usually by the underlying ailment. In the present scenario, industrialization is causing many changes in our lifestyle, especially in our food habits. Most people are using seasonal fast food, that is fried food and fast food. This lifestyle changes attack many diseases. In addition, the prevalence of hepatitis has increased due to the increase of populations living in congested area in sanitization. It is cause of mutations of pittas and signs and symptoms like the haridra, netra, and tvaka. Modern science has only a symptomatic treatment of hepatocellular jaundice, and Ayurveda text has mentioned the hepatocellular jaundice as a common. The main goal of the allopathic medicine system is to reduce the symptoms conventionally. Ayurveda is grounded is the theory of mind, body, and soul. Improvises nature's products with the minimal sides of effect. Its primary goals is to eradicate the underlying the causes of restoring equilibrium to the body's physiology. In the orders of initial illness, it is suggested dietary changes and lifestyle adjustment of neurology. Home readiness, we treated the kamla according to Ayurvedic suggestion. Ancient Acharya has also mentioned the Kamli to Virichan as such cases of this study shows that Ayurveda herbs gives effective results in the jaundice. Methods and materials. Through review of Ayurvedic texts and the modern literature of jaundice has done particular case presentation and discussion. Drug review, Avipattika Churna, Suvarna Shuchekar, Phalakrit Krishai, and Putaki. Case study, a 40-year male patient in OPD number 2 with following chief complaint, Udarshul, that is abdominal pain, Shuddhamanda, that is Shuddhamanda, that is appetitis, loss of appetitis, Mutra Pitta, yellowish discoloration of urination, generalized weakness, Malava constipation, above symptoms from 5 to 6 days. Patient has not taken any medication aid. He comes to our hospital for the further management. History and past illness, a known case of HTN on medication tablet amlodipine 5 mg OD. On examination, Nadi 101 per minute, Malavashtamba, Mutra, Pittavarnya, Jiva, Samta, Kushta Madhyam, Shabda Prakrut, Sparsha Prakrut, Akruti Madhyam, Bala Madhyam, BP 140/90, Druka Pittavar. Case study investigation that we done, that is SP 13.4, CRP that is positive before the treatment, and serum creatine 4.5, BSL routine 1:1, PTNR, LFT is done, total bilirubin is 10.5, direct bilirubin 3.6, SGOT is 782 unit per liter, and SGPT 1300.2. We treatment gives treatment line of treatment. First is variation karma, and second is the internal medications. In consideration, with the find of the clinical examination and investigation, treatment is given. As he also suffering from hypertension, amlodipine 5 mg was continued. Mild variation was done by Avipattika Churna, that is twice gram before food, and Kutki Churna 1 gram before food with the 1 week. During the period, the patient was advised avoided the pittas, dosha, vitamin diet such as a fried fatty food, and take old rice, wheat, carbohydrate rich diet, bread, rice, potato, yam, custard, pulses, and mugdha, leafy vegetables and fruit organizations, beetroot, carrot, grapes, etc. For 15 days during the course of the treatment, the patient was also given the oral medication. As a result, the patient's symptoms had significantly improved after the receiving the treatment for the 15 days. Follow was done twice in the interval of 7 days. Thus, after 15 days of treatment, the investigation including the complete blood count, liver function test, and urine examinations of the patient were done. The liver function test shows the improvement and the duration. After 1 month of follow, the patient is now steadily getting the better, and the symptoms has not returned. Consider the progress has in meeting in clinical analytical criteria. Clinically, icterus and yellowish discolorations of urine decrease. There was a relief in the symptoms such as loss of appetite, weakness, and a reduction of a bilirubin level, SGOT, SGPT, alkaline phosphate, and PTNR was the outcome in the laboratory. The trial does has been used in the management of Kamla in the Ayurvedic taste. Study has shown improved the appetitis and taste, Yakrut Uttejit properties. Therefore, combination of drugs are more significant than the individuals. The liver is the Mulasthana of Rakta. Rakta Pitta as Ashray and Ashray Bhav's Sambandha. Hence of elimination of vitiated pitta dosha separation is the best chikitsa. After the treatment, HB is 30.1, CRP is negative, total bilirubin is 10.61, total bilirubin 0.78, and the direct bilirubin 0.29. SGOT, SGPT, PTR are also decreases. Discussion. These drugs act as a rasayana, improvement dhatu formations, and the Tridoshagna, Vatashamak, Raktashodhak, Pittasarana, and therefore relieve the signs and symptoms of Kamla. The drugs hence improve the effective and the relevant cardinal features of Kamla. In Ayurveda, the ancient Acharya has mentioned the Agrimantya and Pitta dosha has the main individual factors of Kamla. The main ingredient of Vipatika Churna is Shinishotha, which is a mild percent. It increases the gastritis motility, enhance the gastritis and constipation. Most pitta dosha, which was found as the cause of liver disorder studies case. All the drugs of Vipatika Churna has deepened Pachan property, which can be improve the digestion and metabolisms and prevent the arm formation. Vipatika Churna contains sugar, which also pitta pacifying properties. Kutki Churna is the strong purgatives with liver stimulation and pittasara. It is helpful in liver problem, spleen disorder, and the fever. It also has the modular and anti-ulcerative colitis and antibacterial actions. Observation: reduction of symptoms like yellowish discoloration of skin, and is with you. I like and successfully managed by the space in the it was our is considered the especially the dosha. Want during the follow.
Hello, Dr. Ankita, can you hear me? Hello, Dr. Ankita, can you hear me? Okay, next I invite Dr. Rashmi Veer for the paper presentation. Hello, Dr. Rashmi Veer, are you there?
Yes, sir. Sir, can you share the PPT, please?
Just a moment, doctor. Doctor, please start the session, doctor.
Myself, Dr. Rashmi Veer, second year student from Department of Kaya Chikitsa, CSMSS Ayurveda Mahavidyalaya. Title of Sir, PPT is wrong. This is not mine. The title of my topic is efficacy of. It's a single case study of osteoarthritis.
Please continue, doctor.
Right. The title of my topic is Efficacy of Sthanik Snehan, Nadi Svedan, and Lep in Janusandhikatvat. Straight. Introduction. Sandhigat Vata is a common degenerative joint disorder, particularly seen in elderly population. Osteoarthritis is amongst the commonest rheumatological problems, and its prevalence is 22% to 39% in India. Methodology. A female patient of 57 years old had complaints of bilateral knee joint pain and mild swelling, difficulty in walking, and crepitus palpable, which worsened with movement and relieved by rest since last 1 year. Patient has been suffering from same complaints, mild to moderate intensity, since last 4 years. She had been under allopathic conservative treatment for 4 years, but symptoms aggravated rapidly since 1 year. There were degenerative osteopathic changes in X-ray. The management plan includes local abhyanga massage with Bala Ashwagandhadi tel and lep with some Shulahardravas, along with internal medicines like Yograj Gugu, Astiposhak Vati, Dashamulkwat for 30 days. Result: pain, swelling, difficulty in walking were significantly reduced after 30 days of treatment. The patient got adequate relief in clinical features. Discussion and conclusion. With local Snehan Lep and Shaman Chikitsa, Sandhigat Vata was treated effectively. Introduction. Next slide, please. Sandhigat Vata is the most common type of Vata Vyadhi mentioned in various Samhitas. Sandhigat Vata is a common degenerative joint disorder, particularly seen in elderly population. As age progresses, the dhatu undergo kshay, leading to disease. In this disease, the Vata prakop increases in joints, leading to dhatu kshay and the occurrence of symptoms. It is correlated with osteoarthritis, with prevalence is 22% to 39% in India. Degenerative changes in joints are the main symptom added by Acharya Shushrut along with the all other symptoms of Sandhigat Vata. Next slide, please, sir. Though Sandhigat Vata can be managed with analgesics and NSAIDs, it has become a major problem of mankind and received progressive attention from research works. However, the prolonged use of these drugs has its own drawback. Recent work on NSAIDs suggests these drugs do increase the risk of renal disease. Such studies strongly indicate that to find safer herbomineral drugs for arthritis is the need of era. Abhyanga is the therapeutic intervention of Panchakarma in which the body is treated with simple or medicated oil on particular body part according to need. Lep Chikitsa is described for the management of pain, stiffness, and other associated symptoms. Thus, these attempts has been made from the previous review of the disease and various treatment to find the effective management of Sandhigat Vata and contribution to the field of Ayurveda. Next. Methodology case report. A 57 years old female patient came with complaint of bilateral knee joint pain, swelling, difficulty in walking since 4 years. Symptoms are increased since 1 year. Patient had no relief after continuously consuming analgesics, and her symptoms were aggravated daily. So she came to OPD for Ayurvedic management. History was taken. Examination according to modern medicine and Ayurveda also done. Chief complaints: pain at both knee joint since 4 years, difficulty while walking 1 year, mild swelling at both knee joints since 1 year, general weakness since 1 year. Examination, inspection, mild swelling over the both knee joints, palpation, tenderness were present, crepitus felt on examination, reflexes intact, pulse 78 per minute, respiratory rate 18 per minute, respiratory system air entry bilaterally equal and clear. CVS S1 and S2 were normal. BP 130 by 80 mm of Hg. CNS conscious and well oriented. Diagnosis: Janusandhigat Vata, osteoarthritis of knee joint. Nidan Panchak Hetu Katuras Ati Sevan, Purvarup, little discomfort while walking in bilateral knee joints. Roop, severe pain at knee joints. Pain while walking. Samprapti, Vata Prakop occurred due to the above said causatives in all body channels. It causes dryness, loss of proper lubrication in joints, and unevenness in the margins of asthi, and weakens the joints. Dhatu Sadhya Sadhatva, that is prognosis, Krushya Sadhya. Investigations, X-ray of the both knee joints were done. Shaman Chikitsa, were taken 4 drugs: Yograj Guggur, Astiposhak Vatti, Dashmul Kwat, Erand Sneha. Yograj Guggur 500 mg BD after food, Koshnajal, and for 30 days. Astiposhak Vatti 500 mg BD taken after food with Koshnajal and for 30 days. Dashmul Kwat 20 ml BD taken after food with Koshnajal for 30 days. Erand Sneha 2 tablespoons at night with Koshnajal and for 30 days. Sthanik Chikitsa Karma, Sthanik Snehan with Bala Ashwagandhadi Tel done at the morning time and for 15 days. Nadi Svedan Dashmukwat done at the morning for 15 days. Lep, Devdaru, Rasna, Shunthi, Pippali, Ajmoda, Shigru, Dashmur, and Dashmur Churna. Next, assessment criteria. Parameters, pain. 0 score is for no pain. Then 1 for mild pain that can be ignored easily. Second, for moderate pain and not affect daily activities. Third, for severe pain which demands constant attention. Swelling, 0 for no swelling, 1 for slight swelling, 2 for moderate swelling, 3 for severe swelling. Crepitus, 0 for no crepitus, 1 for mild complaint by patient but not felt on examination. Second, for moderate, that is felt on examination. Third, for severe, felt on review. Walking difficulty, 0 for no difficulty, 1 for mild difficulty. Second, moderate, takes stops while walking. Third, for severe, unable to walk. Tenderness, 0 for no tender, 1 for tender. Third, for second for tender and wincing. Third, for tender, wincing, and withdrawal. Criteria: pain. Third is the score before treatment. 1 is after treatment. Swelling. Third is the score for before treatment, and 1 for 1 after treatment. Crepitus, second before treatment and second after treatment. Walking, score is second before treatment and 1 after treatment. Tenderness, score third before treatment and 1 after treatment. Total score before treatment is 13 and after treatment is 6. Next. Discussion. Sandhigat Vata is the most common Vatvedi according to modern science. Obesity, excess overload, age, sex, repetitive stress over joints, etc. are the important causative factors for Sandhigat Vata. The main treatment goal in this case was management of acute pain, curative treatment for symptoms, and breaking the pathology of the disease. Next. Drug name Yograj Guggu. The content of Yograj Guggu are Pippali, Pippali Mulyavani, Krishna, Jirak, Vidanga, Ajmoda, Jirak, Chavya, Ela, Sendhav, Kushtha, Rasna, Gokshur, Dhanyak, Trifala, Twak, Marich, Shuddha Guggu, Sarpi, Shunthi, Musta, Ushir, Patra. Karya of Yograj Guggu, Vatahar, Agni, Deepan, Sandhi and Majagat Vatahar. Astiposhak Vatti. Content of Astiposhak Vatti, Kukutandak, Twak Bhasma, Asthi Arjun, Shuddha Laksha, Amalaki, Ashwagandha, Guduchi, Shuddha Guggur, Bala, and Babulkwat. Karya of Astiposhak Vati, Vatahar, and Balle. Next. Dashmurkwat. Content of Dashmurkwat: Bilva, Agnimanta, Shonyaka, Patala, Gambhari, Brihati, Kantakari, Gokshur, Shaliparni, Prishniparni. Karya of Dashmurkwat: Vatahar, Balle, Agnivardha. Eranda Sneha. Content is Eranda. Karya is Vatahar, Adhobhag, Doshahar. Next. Bala Ashwagandha Tail. Contents are Bala Ashwagandha, Laksha Tail, Musta, Rasna, Chandan, Manjishta.
You are exceeding the time limit.
Okay. Sariva, Ushir, Jalad, Kushtha, Agru, etc. Karya is Vatahar, Pushtikar, and Balya. Lep, Shunti, Marich, Pippali, Ajmoda, Shigru, Sendhav. Karya is Vatahar. Conclusion. With Sthanik Snehan, Svedan, and Lep therapy, along with Shaman Chikitsa, acute pain in Sandhigat Vata was cured effectively. Thus, with Snehan, Svedan, and Lep and Shaman Chikitsa, Sandhigat Vata can be treated effectively according to different conditions. It can also help for further prevention of disease. Next. References. I have taken these all references from articles and granthas. Thank you.
Thank you, Doctor. So next I invite Dr. Atul Balu Kalel.
Yes, ma'am. Am I audible, ma'am?
Yes, Doctor, audible. Can you please share the screen, Doctor?
Yes.
Hello.
Yes, ma'am. Sir, here is some technical issue. Can you share my paper, sir? Hello, sir.
Sure, Doctor. Please start the session, Doctor.
Hello. Good evening, everyone. I am Dr. Atul, Department of Rog Nidan, final year PG student. My topic is investigation of lipid profile and its interpretation. Definition: measuring blood fat is an important tool in determining your risk of cardiovascular disease. A lipid profile is a series of tests used to determine the amount of fat in your blood. Component and parameter of lipid profile test. A lipid profile typically includes total cholesterol. This test measures all the cholesterol in all the lipoprotein particles. High density lipoprotein cholesterol measure the cholesterol in HDL particles. Often is called cholesterol because it remove excessive cholesterol and carry it to the liver for removal. Low density lipoprotein cholesterol. It's calculate the cholesterol in LDL particles, often called bad cholesterol, because it deposit excess cholesterol in wall of blood vessel, which can contribute to atherosclerosis. Usually, the amount of LDL cholesterol is calculated using the result of total cholesterol, HDLC, and triglyceride. Triglyceride, it is a measure all the triglyceride in all the lipoprotein particle. Most is in the very low density lipoprotein. Some other information may be reported as part of the lipid profile. These parameters are calculate result of the test of identify above. Very low density lipoprotein cholesterol calculate from the triglyceride divided by 5. This formula is based on the typically composition of VLDL particle. Null HDLC calculate from total cholesterol minus HDLC. A condition for carrying out lipid profile test. A particle undergoing lipid profile test must be in a 9 to 12 hour fasting state before his blood sample is drawn. During this time, the patient should not consume any kind of food or drink. However, she can consume plain water. On the day of testing, the patient should avoid smoking, carrying out rigorous exercise, again affect the result of the test. Benefits of lipid profile test. The lipid profile test have been shown to be a good indicator of whether someone is likely to have a heart attack or stroke caused by blocking of blood vessel. The result of lipid profile test is used to guide clinician to decide how a person at risk should be treated. The result of the lipid profile are considered along with other known risk factor of heart disease, such as high blood pressure or diabetes, to develop a plan of treatment. Normal value of lipid profile test parameter. The normal value of serum lipid depend on patient's age, sex, and races. The interpretation of lipid profile and test result. The cholesterol level, according to the guideline of National Cholesterol Education Program (NCEP), following interpretation can be made. A decibel value less than 200 mg per dl. Borderline high is 200 to 239 mg per dl, and high level is 240 mg per dl. This may put you at on risk of heart disease. Fasting triglyceride level. Its desirable range is less than 150 mg per dl. Borderline high is 150 to 199 mg per dl, and high range is 200 to 499 mg per dl, and very high range is greater than 500 mg per dl. High density lipoprotein cholesterol level. High density lipoprotein or HDL are considered to be a good cholesterol because of HDL role is in body to take cholesterol to degradation of or process. As a result, cholesterol level decreases in blood. According to the NCEP, an acceptable HDL range is in between 40 to 60 mg. Any HDL level above more than 60 mg per dl is considered a high HDL level, is considered very healthy, since it has a protective role in graduating against the heart disease. An undesirable level of HDL is any level below 40 mg per dl. Case low HDL level may help to contribute to heart disease. Low density lipoprotein level. Low density lipoprotein level, also known as HDLs, are considered to be the bad cholesterol. This type of lipoprotein circulate from the liver to other organ and tissue in the body, carrying cholesterol where is it needed. This type of cholesterol tends to linger and has been connected with the various type of heart disease, including atherosclerosis, heart attack, stroke, and coronary heart disease. The current guideline of LDL level are LDL level less than 100 mg per dl are considered optimal. LDL level between 100 to 129 mg per dl are considered near or above optimal. LDL level between 130 to 159 mg per dl are considered borderline high. LDL level in between 160 to 189 mg per dl are considered high. And LDL level at or above 190 mg per dl is considered as very high. Thank you, sir.
Thank you, doctor. So next I invite Dr. Ashwini Rajesh Singhu. Hello, Dr. Ashwini. I invite Dr. Ashwini.
Hello, Dr. Ashwini, are you there? Next, I invite Dr. Asavari Jain Ubadhyay for the paper presentation. Dr. Asavari Ubadhyay, are you there?
Hello, myself Ashwini Singhu. I am present.
Okay, Dr. Ashwini. We will call you next, Dr. Asavari Ubadhyay.
Okay.
Ashwini, please share the screen, doctor. Hello, Dr. Ashwini.
Yes.
Doctor, please share the screen, doctor.
Sorry.
Doctor, please share the screen, doctor.
Yes, sir.
Doctor, if you have any problem with screen sharing, doctor. Hello, Dr. Ashwini. Okay, doctor. Screen is visible, doctor. Please start the session.
Myself, Dr. Ashwini Rajesh Singh, MD Scholar, Department of Kaya Chikitsa, second year, CSMSS Ayurveda College, Chhatrapati Sambhajinagar. My title of my paper is Efficacy of Jati Faladi Lep in the Management of Mukhadushika. Abstract: Acne vulgaris is most common dermatological problem. Dermatological problems can result in psychosocial effects that seriously affect the patient's lives. More than cosmetic nuisance, skin disease can produce anxiety, depression, and other psychological problems that affect patient's life in ways comparable to arthritis or other disabling illness. Even though antibiotics play a key role in acne management, the increase in acne's resistance is a matter of concern. So we need to find some effective treatment for management of acne vulgaris. In Ayurveda, for treatment of Mukhadushika, two types of chikitsa are described, that is, Shodhan chikitsa and Shaman chikitsa. Shodhan chikitsa includes Vaman, Nasya, Shiroved, and Shaman chikitsa includes Lep and Pralep. Reference of Jati Paladi Lep taken from Yog Ratnakar and this study carried out on 15 diagnosed patients of Mukhadushika. Introduction. In modern science, it is known as acne vulgaris, which is chronic inflammatory condition of pilosebaceous units. Its commonest dilemma associated with complexion and smoothness of skin. It's characterized by blackheads, whiteheads, pimples, greasy skin, and scarring in some cases. This disease is seen mostly from the cosmetic point of view. Most commonly, it's seen in adolescent age in both male and female. As per modern treatments, failure and recurrence rate is more. Although for prevention of further infection, blackheads and other complications, various remedies like antibiotics, vitamins, hormones, and cosmetic lotions are in use. Due to all these facts, it can be said that course of Mukhadushika is chronic with frequent remissions and exacerbations. It has tendency to flare up during certain periods of life too. So it's need to search a better treatment from natural sources. Aims and objectives. Aims: to review the literature about causes, dosh dushti, and symptoms of Mukhadushika. Second, to evaluate the efficacy of Jati Faladi Lepa. Materials and methods. 15 patients of Mukhadushika randomly selected from OPD and IPD of Department of Kaya Chikitsa of our institute. Written informed consent taken from the patient. Drug review. Jati Faladi Lepa contains Jatifal, Marich, Chandan, churn of all these ingredients purchased from GMP authorized pharmacy and prepared lab. It is mentioned in Yog Ratnakar Chudra Rog. Dose 10 grams each time. Application externally on face. Duration 2 months. Follow-up day 1, day 15th, and day 30th. Inclusion and exclusion criteria. Inclusion criteria: individuals between age group 12 to 30 years, irrespective of sex, caste, occupation, and socioeconomic status. Individuals of acne vulgaris having Pitakas with Ruja, Sankhya, Akar, Dahavarnya on face, which are included in study. Exclusion criteria: individual below age 12 and above 30 years of age. Individual in whom Mukhurdvartana is contraindicated were not included. Individuals suffering from any other skin disorder. Subjective parameters. First, Ruja, that is pain level. 1, no pain. 2, mild pain. Third, moderate pain. 4, severe pain. Second, Sankhya, that is number. 1 is equals to 0 pitika, 2 is equals to 1 to 5 pitikas, 3 is equals to 6 to 10 pitikas, 4 more than 10 pitikas. Akar, that is size. 1, no pitika. Second, Sarshapakar pitika. Third, Mudgakar pitika. And fourth, Masurakar pitika. Daha, that is burning sensation. 1, no daha. Second, mild daha. Third, moderate daha. And fourth, severe daha. Then Vaivarnya, that is discoloration of skin. First, no Vaivarnya. Second, Araktata. Third, Shweta Vaivarnya. And fourth, Kupit Vaivarnya. Results and observation. This is clinical study carried out on 15th diagnosed patient of Mukhadushika. Patient collected randomly as per our inclusion and exclusion criteria. For statistical analysis, students paired t-test is used. Ruja found in all 15 patients were reduced up to 78%. Sankhya of Pitika reduced up to 93%. Akar of Pitika reduced up to 72%. Mukha Vaivarnya reduced up to 85%. Discussion. U1 Pitika is one of the such disease which affects the beauty of the skin. The site and the period of occurrence of the disease are phase and adolescent respectively. The age of occurrence of this problem is at such time when the person is more conscious about beauty and personality, and at the site of the disease is such that it can't be hidden and or covered all time. It can be observed that maximum patients prefer madhur rasa, lavan, and katuras in their diet. Excessive intake of madhur ras vitiate cough and arm, whereas lavan and katuras vitiate pitta and rakta, which in turn aggravate vata. Such aggravation held responsible for production of mukhadushika. Conclusion: the average age of 16 to 27 years are found to be more prone to mukhadushika. Diet having properties which may increase pitta and cough along with irregular dietary patterns plays an important role in development of mukhadushika. The excessive intake of oily substances, irritants, or tikshna food articles as well as priyata also aggravates the doshas, producing yuva and pitika. References were API textbook of medicine, Ashtang Hruday, Charak Sahita, and Cyton electrotherapy and theory and practice. Thank you.
Thank you, doctor. So next I welcome Dr. Asawari Jain Dupadhyay.
Hello.
Hello.
Hello, ma'am. Am I audible?
Yes, doctor.
Okay, I have shared the screen. Is it visible?
Yes, doctor.
Hello. Hello, everyone. My name is Dr. Asawari Jain Dupadhyay. I am from Sumati Vaishya Ayurveda Mahavidyalaya. My topic of presentation is literary review on diet and lifestyle in Medoroga. So, introduction. Obesity is one of the most serious public health problems in 21st century. The prevalence rate of obesity is around 40%, and in Ayurveda, obesity is correlated with the Thaulya Rog of Ayurveda, comes under the heading of Medo Rog, which is the dysfunction of the Meta Dhatvagni majorly. Aim and objective of the study to find out the factors involved in the obesity as per the Ayurvedic principles, to develop the concept of obesity along with the management strategies in the terms of Ayurveda. Material and method used. This study is based on a literature review of a relevant Ayurvedic text with commentaries, necessary and validated interpretation, analysis made by different scholars. So what was found in the literature that Thaulya Rog of Ayurveda comes under the heading of Medo Rog. And Ayurveda has explained the various causes of this Thaulya, that is a Kapha Pradhan predominantly caused due to the vitiated Kapha dosh. Meda Pradoshaja, Meta Dhatu, the tissue which is predominantly affected. Bahudosha Avastha, where many conditions are involved. And this is caused due to affected anabolism, that is overnutrition of the patient. It is characterized by Snigdha Guru, Thula Pichila, Mrudu, Sandra, Guna, Sneha, Sweda, compactness, Asti Pushti, that is nourishment of the bones. The main function of Medadhatu, composition of Guru, Shita, Snigdha, Madhuradi, Kapha Vardhaka drugs along with lack of exercise, sedentary lifestyle resulting in excessive nourishment of Med. Other bodily elements are deprived of nutrition, disproportionately increases, and hence the weight increases of the patient. So, after looking all these ahara and hetus, the pathya was designed. So, dravya which should be given in Medorogar, Sakra, Madhu, Ushnodaka Tela, Sarshapatela, Arishthasav, Ikshuka, Navnita, Grita, and Nadi. Sukadhanya, Yava, Kodrava, Godhum, Navanna, and Shallaki. Shamidhanya, Mudga, Rajamasha, Kulatha, Chanaka, Masur, and Tir. Shakavarga, Vibhaka, Patola, and Kanda. Infala, Kapitha, Jamun, Amlak, and Madhurfal. So what need to be avoided? Avoid an incompatible and tamastic combination of the food, that is milk with fish, meat, curd, bread containing yeast, yogurt with milk, sour fruits, hot drinks, fish with cheese, eggs with milk. and apatyahara and vihara, that is navin shali dhanya, godhum, chawal, udad, aloo, dugdha, malai, rabdi, that is all guru ahar, mansa, matsya varga, eggs, navneet, ghrita, so all are the snigdha padartha should be avoided. In viharas, if we see, so shram, sharirik and mansik shram is very important. Chinta, pralepa, langhana, dhup sevana, and various other which can create such a exertion like activities like walking, mountaining, bathing with the hot water. Some asanas which could be included, that is Trikona asana, Ardhakati Chakrasan, Ardha Chakrasan, Vajrasan, Gomukhasan, Ardha Matsyendrasan, Pavan Muktasan, Bhujangasan, Dhanurasan, Shavasana, and a pranayam which could be added are Kapalabharti, Bhastrika, Anulom Vilom, Surya Bhedana, and Brahmari. So at last, it can be concluded that obesity is the world's old metabolic disorder, and sedentary lifestyle and lack of exercise, faulty food habits, and urbanization has precipitated the disease. By adopting these simple Ayurvedic principles of healthy lifestyle and effective treatment modifications, we can definitely achieve the result. By adopting simple lifestyle and healthy food habits, anyone can enjoy life optimally without having a lifestyle diseases like an obesity. Ayurveda and yoga is a better, easy, and healthy way to fight obesity and other lifestyle disorders. And further exploration can be done with the modalities and validation through necessary research furthermore. Thank you.
Thank you, Doctor. Next, I invite Dr. Vikas Gautam.
Hello. Hello,
Yes,
ma'am.
Doctor, you are audible.
Good evening. Am I listening? Hello.
Yes, Doctor.
Can you share my slide?
Just a second.
Yes. Next. So title of my topic was randomized control type. So basically it's Triphala Khadir Kasha efficacy on diaper rash with the Stanley shoulder. Ratri Stanley shoulder. Next slide, please. So my name is Dr. Vikas Gautam Harkar and YSC, YM Kodoli, Kodoli College. HOD was Dr. Parvat Kumar Das. Introduction. So basically diaper rash, diaper dermatitis is the common skin disease in infant and neonate age group. So that will happen in most cases. So that's why I'm choosing the topic for my presentation. Next slide, please. So need of study, basically prevalence rate of the diaper rash in India is 7 to 35%. In the last 2 years, last 2 to 3 years, that will be increases. And as I'm studying in the YM Kodoli, so it's so basically presented in urban areas, so urban and rural areas. So basically there is most of the cases and most of the mothers cannot maintain that much hygiene. But for that purpose, I chosen this topic and the application for Ayurvedic purpose, I choose that. Next slide, please. Hello. So basically my age group for the application of the Triphala Khadir Kashaya Prakshana is 0 to 2 years for 3 times a day for 10 days, and after 10 days I am maintaining follow for that. So basically my hypothesis for null hypothesis and alternate hypothesis. Null hypothesis that Triphala Khadir Kashaya Prakshana with Dhatri Sandhishodan is not significantly effective in Ayurveda with special response to diaper rash. An alternate hypothesis that it's significantly effective. Next slide, please. Hello. Next slide, please. Next. Hello. Hello,
Just a
next
second,
slide, please.
doctor.
Okay, so basically this is the pathology of the diaper rash. So as fecal or urinary discharge, so if this enzyme causes inflammation and that skin eruption is happen and that perianal regions. So most of the organism that causing loose stool, that specifically causing the diaper rash. When the diaper rash is to be happen. So because diaper rash is not because they happen due to wearing of the diaper. Diaper rash name is because of that, because that area where that happens is in the area where we use the diaper. So basically addition of the factor that occlusion, friction and use of the diaper wipes and topical preparation. So erythema and scaling often with papulovesical and bubulous slashes, lesions features and erosion in a patchy and confident pattern. Next slide, please. There may be, so this is basically reference of the Ahiputna Lakshana in Sahitas happen that Malotpad. Okay. So this is basically reference of that Ahiputna happen in this and Chikitsa for that Ahiputna Chikitsa. So Ahiputna Chikitsa basically is my reference is from Yogaratnakar Shudra Rog Chikitsa, where it mentioned as Triphala Khadir Kashar with Dhatri Sannishodhan is useful for the treatment of the Ahiputna. So as next slide please. So drug review. The Triphala is to be that Patha Bibitaki Datriphala, Satripalaha, Phala Trikasha Triphala Vasara, Varacha Parikartika. And that Khadiri Kushtagna. So that will be the Agreya in Charak Sutrasthan. So and Krumi Kushtagna, that Dhanvantari Nigunta mentioned them Khadir as a Krumi Kushtagna. And where most of the times diaper rash is happened because of that some bacterial infection that or fungal infection. So for that reason, I used to Khadir as another drug and Triphala is a brand of the Karmavi as well. Next slide, please. So the primary objective of my study is to study the efficacy of the Triphala Khadir Kashaya Vipakshalan with Dhatri Sannishodhan in Ahiputana. And the secondary object is study the concept of Ahiputana according to the modern and Ayurvedic science also. And to know the effect of zinc oxide, as my zinc oxide was my control drug. So that enrollment of subject, inclusion criteria, exclusion criteria. In inclusion criteria, we group A with the Triphala Kadrikasha Prakshana with Dhatri Nishoda, and group B, zinc oxide, is used as a control drug. So I take the follow-up and 4, 7, and 10 days. And then after I statistical analysis was done. Next slide, please. So duration of treatment was 10 days, and that where I collect patient from the OPD of the Comorbidity department. So follow up on the 4th, 7th, and 10th day. So study will be carried out for 18 months. Next slide, please. So that's my sample size. I collect the sample size was 70 was sample size, and we divided into two groups, 35. Group A and Group B. Group A was my the control group, and Group B was my the trial group. So Group A, I use the zinc oxide. Group B for I use the Triphala Khadir Kashaya Prakshana. Next slide, please. So method for selection of study subject, the baseline assessment. This will be including in the detailed history, including family, personal habit. So selection criteria for my patient is inclusive criteria. The case of Ahiputana with presenting Kantu, Ruja, Strava, and Pidika. Subject age group was 0 to 2 years irrespective of gender, and the parent will give the consent for written consent to run my experiment. And in exclusive criteria is as high risk neonate, children who have generalized skin infection, which is other than Ahiputana with their complication. History of symptom of ahiputana more than 10 days, and exacerbation of more diffuse skin disease such as seborrheic dermatitis, atopic dermatitis, and hand-foot mouth disease. And withdrawal criteria is to be patient discontinued the treatment, patient unwilling to take a treatment during a study, patient show any type of adverse error will be managed as per need, and if any complication occur, it should be managed. Next slide, please. So basically, diaper rash is basically diaper area affecting the buttock and genitals and inner surface of the thigh. So it's known as a diaper rash. And so ahiputana, if it is a stagnated ficus, sweet, and around the anal region, and that are not cleaned well, then rakta and kapha get vitiated by the resulting into the local thin ulceration around the anus, and coppery color will be happen with the itching was there. And so we use the Kwat Kalpana for that preparation. And Kwat Kalpana preparation is done by the Bhav Prakash and Sharandar Vidunta. Next slide, please. So the sample source. The sample source is selected from the Komar Ruthe department only. And so drug sources, raw material collected from genuine sources, Trifala and Khadir will be prepared as in pharmacy as per standard reference given by Sharandar Sayyed. And so drug was Trifala and Khadir Kashaya. So Trifala, drugs in the Trifala Haritaki, that Haritaki ras is a Sarvaras Lavan Varjita, Virya was Ushna, Vipak Madhur, Ullabhur Uksha. Sorry.
Doctor, Doctor, you are exceeding the time limit.
Okay.
Speed up your presentation.
Okay. Next slide, please. So basically, Group A and Group B. So Group A divided. Group A is a trial group, which you use the Trifala Prakshala, and Group B is the control group. I use the zinc oxide. Next slide, please. Next slide, please, ma'am. Okay. So I divided the group into two categories. 10 days for duration of treatment, and Prakshalan local application, and the local application of zinc for the group control group. Next slide. And after treatment, I take a follow-up on the 15th day. First day, I generally particularly see the enrollment baseline assessment through the assessment criteria. 4th day, assessment through assessment criteria and continue the drug. 7th day, assessment through assessment criteria and withdrawal of the drug. And 10th day, assessment through the assessment criteria and drug authentication. Okay. And that was the method selection of the case and plan of study. So the as we know, the group A and group B. So trial and control group. As one in trial group, we use the Trifala Prakshalan, and trial control group, I use the zinc oxide as a local applications. So criteria for assessment is the Kandu, Patika, Strava, and irritability, as irritability present in the infants. Next slide, please. Yeah, so that was by the subjective criteria, Kandu, Raga. Next slide. Next slide, Matt. Hello, next slide. Irritability, and the objective criteria was the Pidika. Next slide. Yeah, so as a final assessment was given, there is significant status fulfilled, moderate improvement, it assessment criteria. So this is the plan of work phase. Pharmaceutical study was there. Next slide. So next slide is there. Okay, so observation and result was gone through. So plan of statistical analysis, I use the Wilcoxon ransom sign rank test will apply at the 5% level of significance, and the observation result and interference draw on the basis of the reading obtained before and after the treatment. And conclusion is that conclusion of the study will be drawn strictly on the result of the statistical analysis, and the conclusion should be unbiased and interference will be drawn. And the research study will be summarized in brief. Thank you, ma'am.
Thank you, doctor. And before going to the next presentation. Dear participant, you should follow the time limit because a lot of participants are still waiting there to present. So next I invite Dr. Ragini R. Kulkarni.
Yes, I'm here, ma'am. Am I audible?
Yes.
Yes. Can you please share my screen, ma'am? My PPT. Hello? Hello?
Hello. Doctor, just a second.
Okay, ma'am. Can I start, ma'am?
Please, doctor, please start the session, doctor.
Okay. Thank you, sir. Good evening, all. I'm Vidya Ramchandra Kulkarni, MD Scholar, Rachana Sharir Department, BSDT, Ayurveda Mahavidyalaya, Pune. Today I'm presenting a poster and my topic is review on the concept of Rajasvala Paricharya according to Brihatrayi. So priorly, let's see what Raja means. According to Sushrut Samhita, Sutrasthan, 14th Adhyay, it is stated that Rasadeva Striyam Raktam Raja Saudnyam Pravartate. And in Ashtangarudaya, Sharirsthan Adhyay 1, it is stated that Masi Raja Strinam Rasajam Sravati Triham. Both the shlokas means that Raja is formed from Rasadhatu only, and it comes out of the body every month, and it is called as Rajasrav. Acharyas also mentioned Rajasrav Kal of about 3 to 5 days. Moving to my topic, Acharyas also mentioned Rajasvala Paricharya, stating the rules to followed by female who is suffering from her menstrual period. Now moving to my topic, introduction. Menstruation is considered as mirror of reproductive health. In Samhitas, Acharyas mentions about different codes of conduct for Swasthya. These codes of conducts are Dinacharya, Rutucharya, Garbhini Paricharya, Sutika Paricharya, and Rajasvala Paricharya, amongst which Rajasvala Paricharya is the code of conduct for female on her menstruation period. This Rajasvala Paricharya, it explains about the regime the female should follow during her menstruation. This Rajasvala Paricharya helps her to cope up with physiological changes during menstruation period. Objective: the objective of study is to study the concept of Rajasvala Paricharya from Brihatrayi. Methodology: literature study was done from Brihatrayi, that is Charak Samhita, Sushrut Samhita, and Ashtanga. Data collection was done through reading of above mentioned books and arrange information into card catalog system and finalize information in reader friendly manner. Discussion: in all the Brihatrayis, Rajasvala Paricharya mentioned as follows. In Charak Samhita, it is said that ततः चतुर्थे अहन्ये नाम उत्साद्य सशिरस्कं स्नापयित्वा शुक्लानि वासांश्च आच्छादयेत् पुरुषं च ततः शुक्लवाससौ स्रग्विनौ सुमनसौ अन्योन्य अभिकामौ संसेवयाताम्. It means that Acharya Charak says that after 3 days of abstinence, the female should do udvartan. She should perform head to toe bath, should wear shukla vastra and wear garlands. In Ashtanga Hriday, it is stated that Mrujalankara Rahita Darva Samstara Shaini Kshaireyam Vyavakam Stokam Koshta Shodhana Karshanam Paraneshwarave Hasteva Bunjita Brahmacharini Chaturthi Anni Tata Snata Shukla Malyambara Shuchihi. It means that the female should not take bath during her menstruation. She should not wear ornaments. She should eat food prepared with milk and yava, which is mentioned as havishya. It also that food too taken in small quantity. She should eat in earthen pots only, and she should take bath on fourth day of her menstruation and should wear shukla vastra. In Sushrut Samhita, Sushritacharya states that Rutau Prathama Divasat Prabhuti Brahmachariणी Divaswapna Anjana Ashrupata Snana Anulepana Abhyanga Nakhachedha Chedana Pradhavana Hasana Kathana Atishabda Shravana Avalekana Anilayasat Pariharet. He also states that Darva Samstara Shainim Karatala Sharava Parnanim Tama Bhojinim Havisham Triham Cha Bhartum संरक्षेत ततः शुद्ध स्नाताम चतुर्थ्यान्या हतवासः समालंकृताम कृतमंगल स्वस्ति वाचनाम भर्तारम दर्शयेत. Acharya Sushrut also states about the activities that should be avoided during menstruation. They are like running, laughing loud, over talking, anjana, and ashrupata, etc. He also states about the ill effects on garbha if the female performs activities which are prohibited during menstruation. Collectively, we can summarize these do's and don'ts shortly in following form. So the do's during menstruation are as follows. Ahara. The female should eat meal made up of ghee, shali rice, and milk. We call it havishya, or meal made up of barley. She should eat food directly taking over palm or in clay utensil leaves. She should take food in less quantity. And in Vihara, do's are to observe celibacy, concentrate on auspicious things, sleep on darbha and kusha mattress. The things which should be avoided during menstruation are as follows, amongst which ahar which should be avoided is tikshna, katu, and vidahi ahar. The female should avoid guru and parishut ahar too. In Vihara, she should avoid day sleep, that is divaswab, use of collyrium, that is anjana. She should avoid weeping or crying. She should avoid bathing and anointment. She should avoid being miserable, that is she should not become dukhashila. The female should avoid abhyanga, that is oil massage. She should avoid nail paring, laughing, running, over talking, overhearing, and exertion. She should avoid using of ornaments and karmas like nasya and lepana. Result. This study is useful in suggesting behavioral and dietary rules to women suffering from symptoms like lower abdominal pain, back pain, heavy or scanty flow during her menstruation. Conclusion. The specific code of conduct mentioned by acharyas for menstruating women to cope up with physiological changes during menstruation period and thus maintaining better reproductive health. Hence, we can advise Rajasvala Paricharya to women for preconception and perinatal counseling as well as to maintain the healthy lifestyle. Here are the references. Thank you.
Thank you, Doctor. So next I invite Dr. Priyal Padiyar.
Yes, ma'am. Ma'am, can you please share my PPT?
Just a moment, Doctor. We will share for you. Please start the session, Doctor.
Yes. Good evening, everyone. Myself, Dr. Priyal Padiyar, first year PG scholar, D.Y. Patil College of Ayurveda. Today's topic is literary review of Asatma Indriyar Sanyog in present era with respect to social media use. Next, introduction. In today's world, many of us rely on social media platforms such as Facebook, Twitter, Snapchat, YouTube, and Instagram to find and connect with each other. While each has its benefits, it's important to remember that social media can never be replacement for real human world connection. Next. Main thing is asatmya indriyarth संयोग कालार्थ कर्मण योगो हीन मिथ्याति मात्रक सम्य योगश्च विज्ञेयो रोगारोगे कारणम. This is from Ashtanga. Rationale of study. Since it is relatively new technology and lesser impacts have known on person's mental health, but nowadays people spend large portion of their life on social media. So it is important to analyze its impact on person's well-being. Ayurveda, being a life science, indirectly explains its impact on subtle level in Ashtanga Hridaya Sutrasthan as improper union of sense organs with its object. Next, please. And the senses involved in using social media are eyes, ears, mind, and sometimes whole body. Next, please. Now, if we talk about eyes, Heen Yoga will be reduced observation of surroundings, nature, and reality, and reduced self-observation regarding time, place, etc. Next, please. Mithya Yoga will be viewing unrealistic and disturbing contents, that is sexually erotic, violent, horror, etc., and looking at disturbing and unusual shades such as red, orange, which leads to unnecessary strain to eyes. Next. Now, if we talk about ears, Heen Yoga will be being absorbed in virtual music and sound, leads to reduced listening of nature's own sounds, which are important for our well-being. Next. Mithya Yoga for ear will be sad music, depresses sad adolescents, that we know. And Ati Yoga, due to use of portable hearing devices, there has been increased incidences of temporary as well as permanent hearing loss. Next. And impacts on mind and body are isolation, loneliness, fear of missing out, addiction, abnormal sexual behaviors, self-absorption, insomnia, as well as lethargy. Next. Methodology was collection of references from Samhita regarding Indriyartha Sanyog, Sadvrit, etc. Collection of information from various online sources regarding social media and its impacts on mind and body. Analysis, comparison, interpretation, conclusion, as well as discussion. Next, please. Conclusion. Social media is an important tool for today's world. Meanwhile, in order to know its harmful impacts, one should be aware from initial stage regarding its harmful impacts on each mind as well as senses. Especially the impact to mind and other neuroendocrine system, although may not be seen harmful in initial phase, but it will cause many diseases in near future. And for their prevention, best way is to follow Sadvit, which are codes of moral conduct. Next, please. Discussion. There has been many solutions available as such as Sadhrit mentioned in Ayurveda, which will be relevant to present scenario, and further studies can be done on its implications. Also, studies can be carried out on the basis of impact of social media that it does on each sense organ as well as subtle elements like Dhi, Dhriti, Smriti, Sattva, Raj as well as Tam. Next. And these are the references and citations which I have carried out. Thank you so much.
Thank you, Dr. Priya.
Thank you, Dr. Priya. So next I invite Dr. Sayali Ramesh Sakpal.
Hello, Dr. Sayali.
Yes, ma'am. Yes, ma'am.
Doctor.
I'm audible.
Yes, Doctor, you're audible. Please share the screen.
Yes, ma'am.
Hello, Dr. Sayali, can you hear me? Hello, Dr. Sayali, can you hear me? Hello, Dr. Sayali, can you hear me? Hello, Dr. Sayali. Your voice is breaking, doctor.
Hello. Yes, sir. Yes, sir.
Doctor, your voice is breaking. Hello, Dr. Sayali.
Hello.
Hello, can you hear me, doctor?
Hello, sir.
Doctor, your voice is breaking, doctor. We will call you next, doctor. Okay.
Yes.
Next, I invite Dr. Harshavardhan for the paper presentation.
Hi, sir.
Hi, doctor.
Am I audible, sir?
Yes, doctor, you're audible, doctor. Please share the screen, doctor.
Sir, can you please share my screen?
Okay, doctor. Just a moment. Dr. Harshavardhan.
Yes, sir.
Please start the session, doctor.
Okay, sir. My title is Ayurvedic Management of Osteoarthritis, the Clinical Case Study. Sir, next, please. Introduction. Sandhigata vata is the type of pathogenesis involved in various disease conditions affecting the joints, that is osteoarthritis, rheumatoid arthritis, etc., and causing pain in affecting joints. Sir, next, please. Case definition. Painful condition of joints involving single or multiple joints, restricting movements without swelling and crepitus, that is sandhisputana. Next, please. Differential diagnosis. Amvata, Vatarakta, Katigraha, Grudrasi, Anashul, Kostuk Shirsh, ankylosing spondylisis. Sir, next, please. Treatment. Sir, previous slide. Sir. Medicine. Ashwagandha churna 3 to 5 gram twice daily, 2 to 3 months with milk. Shuddha Vishtik Tunda churna 2 to 50 grams twice a daily, 2 week with water. Pippali Mul churna 500 milligram twice a day, 1 month with water. Sir, next, please. Shunti Hariti ki churna 3 to 5 gram twice a daily, 1 month with water. Rasnadi Quath decoction 30 to 40 ml empty stomach twice a daily, 15 days to 1 month. Dashmul Quatha decoction empty stomach 15 days to 1 month with water. Rasna Erandadi Quath decoction 30 to 40 ml empty stomach twice a day, 15 days to 1 month. Yogaraj Gugul 1 to 2 vati thrice a days after meal, 15 days to 1 month. Next, please, sir. Abhyanga local on the affected joints with warm medicated oil like bala tel, sancharan tel, vishagarbadi tel, nirgundi tel, brihat sandivati tel, dhanvantari tel, kotam chukadi tel, swedan with hot water bag, nadi swed, baluka potolisid, nirgundi patra, pinda swed, parisek. Next, sir. Patya, diet and lifestyle, do's patya, ahara, puranshali, green gram, milk, grape, lukewarm water, drumstick, garlic, vihara, massage, warm water bath, posture, correlation, follow the dinacharya and rutucharya. Don'ts, ahara, dried vegetables, lentils, sprouts, raw vegetables and salads, refined foods such as white flour, excessive use of leafy green vegetables, mushrooms, peas, excessive intake of pungent food, cold drinks, beverages, chill food, and ice cream, continuously fasting or taking limited food for very long duration. Next, sir. Vihara. Inadequate sleep or frequent changes in sleep pattern, suppression of natural urge, especially of hunger, bowel and urine and emotion, excessive physical strain like swimming, climbing, walking, running, sport which involve straining of joints like in badminton, football, etc. All such occupation which involves excessive movement of joints resulting joint injuries. Next, sir. Local management. Upna with leaves of eranda, nirgundi, arc, chincha, etc. on affected joints. Lep with dashanga lep, lep gutti, etc. Janubasti, Grivabasti, Katibasti, Mahanarayan Taila, Abhyanga, Stanik, Mrudu, Snehana, medicated oil such as Mahanarayan Taila, Mahashitaila, Kshirbala Taila, Ashwagandha Taila, Balakshadi Tail, Sweden, medicated fermentation, Ekang, local fermentation, or Sarvang Swed, whole body fermentation with decoction of Nirgundi, Dashmul, Erand, and Balamul, etc. Patra Pind Swed, local fermentation by potally made from leaves of Nirgundi, Eranda, etc. Sir, next please. Thank you.
Thank you, doctor. Thank you for the presentation.
Okay, sir.
Next, I invite Dr. Sushil Rohidas Ranjane for the paper presentation. Dr. Sushil, are you there? Hello, Dr. Sushil, are you there? Hello, Dr. Sushil, are you there? Dr. Sushil Rohidas Ranjane, are you there? Next, I invite Dr. Gorli Jashmi for the poster presentation. Dr. Gorli Jashmi. Dr. Jashmi, are you there?
Yes, sir.
Okay, doctor.
Sir, can you please? Sir, is my screen visible?
Yes, doctor. Your screen is visible, doctor.
Okay,
Doctor,
thank you, sir. Good evening, everyone.
and doctor, can you please mute the another Zoom connected device, doctor?
Yes, sir. Yes, sir. Good evening, everyone. I'm Dr. Jashmi, finally PG scholar from Department of Prasuti Tantra and Sri Roga from Dr. NRS Government Ayurvedic College, Vijayawada. My topic of presentation is Pushpagni Jatahani under the valuable guidance of Dr. R. Vijay Shanta Kumari ma'am. Introduction. Jatahani are described by Acharya Kashyapa in Revati Kalpadhyaya of Kalpasthana in Kashyapa Samhita. The word Jatahani comprises of two words, that is Jata and Hani. Jata, which is one who is born, and Harini, which means which destroys. That is, Jatahani is the one which kills or affects the embryo, fetus, neonate, and the child till 16 years of age. Jatahani is a group of disease that affects the women during the different stages of life. It not only affects the women but also the fetus. Pushpagni Jatahani is one among them which affects the woman at the reproductive age. The one who had menstruation in time but is useless, that is without food, that which means that his anovulative cycles are going on. The one whose hair follicles are gross and loamy, that is called Pushpagni Jatahani. Coming to the aims and objectives, it is to understand the etiology and pathogenesis of PCOS as per Ayurvedic theories. PCOS is a lifestyle disorder of female reproductive system, female reproductive age group, and it is the most common form of chronic anovulation with androgen excess, excluding other causes like hypoandrogenism, like congenital adrenal hyperplasia, androgen secreting adrenal tumors, hypoprolactinemia, etc. Here, various acharyas mentioned that anatva, nastatman, artakshaya, and Pushpagni Jatahani, all these symptoms can be compared with that of the PCOS. Now going to the Nidana, that is, as you all know that Acharya Charaka has explained that Mithyacharana tasrinam pradushtena atvenacha jayante bija doshasya daivacha shunta pradat, which means that if we take Mithya Ahara and Vihar, it causes various Vyonivapat disorders. That is, if we take high GI gastrointestinal affecting food, that it leads to it causes increased blood sugar levels. If we take dairy products, it causes allergic reactions and the digestion problem. If we intake white sugar, it increases the sugar levels. And if we take caffeine, if we take caffeine, it causes estrogen levels, increases estrogen levels, and also affects in fertility. And gluten grains, it causes digestive problems. And then coming to the rupa, it is that Acharya Kashyapa has mentioned that Vutta Pushpam and Stula Lomasha Ganda, which means that menses occurs regularly at the usual time, and the women suffering from this type of infertility have obese cheeks covered with hairs. And also there is indication of hirsutism, which is again due to androgen excess. So it can be compared with Steele-Landau syndrome and Heran syndrome, where HA refers to hypoandrogenism, and IR is insulin resistance, and AN is acanthosis nigricans. So here for diagnosis, out of three criteria, at least two should be there. That is oligo-ovulation or anovulation, which manifests as menstrual abnormalities like amenorrhea or oligomenorrhea, and androgen excess, which can clinically be seen by hirsutism, acne, hair fall, and here the biologically the testosterone level will be greater than 2 nanograms per ml. And USG findings, we can see that more than 12 follicular cysts will be there, and its size of about 2 to 9 mm, and the necklace like appearance will be seen in USG findings. So by symptoms and signs of PCOS, we can correlate it as vata kapha predominant dosha arthrodysty, as vata is responsible for the division of cells, that is either granulosa cells or thicker cells, and also for the rupture of the follicle. Here pitta has pagakarma, so it is associated with conversion of androgen to estrogen and maturity of the follicle. And kapha has nutritive function, so along with vata, it helps in proliferation of ovarian follicles. Next, coming to Samprapti of Pushpagni Jatahani. So intake of Guru Ahara, or which causes Abhishanda, Madhura Ahara, Shita Ahara, spicy foods, junk foods, leads to Vata Prakopa and Kapha Dusti, which leads to Jatagni Dusti. If Jatagni gets affected, it affects the Rasadhatu also. When Rasadhatu gets affected, as Atma is Upadada of Rasadhatu, Atma Dusti occurs and it affects Atmaha Shota, which in turn leads to Anatma or Rajanasha, Vitta Pushpam or Nastatam. Nastatam in turn causes Vandya, that is Vandya Nastatam Vidyat. And if Dasadhatu undergoes Stana Samshaya to work, it causes obstruction of Loma Kopa, and that is leads to local inflammation, which results in acne formation, that is Mukhadoshika, and also causes Shyavarnatma of tongue. If Rasadhatu undergoes Stana Samshaya to Medas, it leads to excessive Medadhatu and internally causes Taulya. Next, coming to the treatment of Pushpagni Jatahani, that is, first we have to do is Nidana Parvarsha, which is the first step towards the management of PCOS, as Agnimandyam and Medavrutti Apanavayu plays a major role in the pathogenesis. So one have to follow the Patya Ahara and Vihara. And for Agnimandyam Amambachana, one can go with Trikatu Churna or Hingvasta Churna, which helps, which palliates Shota Avrodha and facilitates the Apanavata Anulomana. For Medavrutti, one can use Takka Arista and Lekana Dravyas, which were mentioned by Charka in Staulya Chikitsa. And to remove the Sangha of Atavadrusti, Uttarvasti with Dhanvantar Thailam can be done. And as it is Kapha Dusti occurs, Vamna Karma can be done as it elevates the Shota Avrodha by eliminating Visheta Kapha. As Kapha is Soumya in nature, it decreases Kapha consequently, and which in turn increases Atma, which is of Agneya nature. And Shatapushpa and Shatavari Churna can be used in females with deficiency or loss of Atma. And Kanchana Gugulu or Sukumara Guptam can be used for reducing the size of the formed ovarian cyst. And Narayana Thailam and Rasona Kalpa Pushpa Dhanvaras is also indicated in Ashtapushpa. And regular practice of yoga is indicated, that is Uttana Padasana, Sarvangasana, Halasana, Mayurasana, Surya Namaskaras are also indicated in amenorrhea conditions, while Sarvangasana, Shirshasana, Halashana are indicated in infertility conditions. And next, coming to the Patyahara, sali rice, barley, and cereals, regular walking and physical exercise is indicated for all PCOS women. And in Apatya, improperly cooked food and unprocessed food and sedentary lifestyle is to be avoided. Now, coming to discussion, as according to Ayurveda, disorder it is caused by Visheta, Vata, and Kapha doshas, and Rasa, Medadhatu, Mamsa, Raktadhatu, Dusti is there. So, in order to inflame the Jatragni and Datmagni with the use of Deepna Padnadravya and to correct the Agnimandyam, to reduce the size of the already formed ovarian cyst by Kanchana Gugulu and Sukumara Guptam, as Kanchana is helpful in treating extra growth of the tumors. Now, I'd like to conclude my topic. As PCOS has frustrating experience in women, it causes infertility, which is increasing day by day. So PCOS is a complex of symptoms like irregular periods, weight gain, excessive androgen, polycystic ovaries. So from an Ayurvedic perspective, it can be considered under Pushpagni Jatahani, in which the Nidana Lakshanas can be compared with that of the PCOS. So based on the Samprapti and the Dosha involvement and Roga Lakshanas, Samshodhana will be the line of management for this. condition. Thank you for giving me this opportunity. Thank you, sir.
Thank you, Dr. Jashmi. Thank you for the presentation. Next, I invite Dr. Sheetal Sambhaji Jadhav for the paper presentation. Dr. Sheetal, are you there?
Yes, sir. I am audible.
Okay. Doctor, please share the screen, doctor.
Please, can you share screen for me?
Okay, doctor, just a moment. Hello, Dr. Sheetal.
Yes, sir.
Please start the session, doctor.
Myself, Dr. Sheetal Jadhav. Next page. Today I will discuss with Down syndrome. Next page. Discuss with symptoms, complication, developmental milestones, self-help skill and prognosis. Down syndrome is most common serious chromosomal disorder which usually caused by extra copy of chromosome 21. It is most common genetic cause of moderate intellectual disability. Incidence is about 1 cases in 733 labor. Next, please. Advanced maternal age, only well-documented risk factor. Incidence of Down syndrome at various maternal age given year. In 15 to 29 years, there is 1 case in 1500 live birth. In 30 to 34 year, there is 1 case in 800 live birth. 35 to 39 year old female, there is 1 case in 217. In 40 to 44 year old female, there is 1 case in 100, and more than 45 year old female, 1 case in 50. Clinical features. Central nervous system include neuromuscular hypotonia, poor motor reflex, craniofacial feature, brachiocephaly with flat occiput, mild microcephaly, flat round face, 3 fontanelles, delayed closure of fontanelles. Congenital heart disease of Down syndrome include endocardial cushion defect, ventricular septal defect, atrial septal defect, patent ductus arteriosus, tetralogy of Fallot, pulmonary stenosis. Next. Musculoskeletal features include joint hyperflexibility, short neck, short extremities, short broad hand, short metacarpal and phalanges, fourth finger with clinodactyly, single transverse palmar crest, wide gap between first and second toes, also known as sandal gap, pelvic dysplasia. Gastrointestinal features. 5% cases of Down syndrome include duodenal atresia, disease. Hematological features include neonatal polycythemia, acute leukemia, congenital thrombocytopenia. Next please. Additional feature of Down syndrome that can be developed become symptomatic with time: neuroplastic, neuropsychiatric problem, developmental delayed universal features, delayed cognitive ability, motor development, language development, and social competence, epilepsy, infantile spasm common in infancy, tonic-clonic seizure common in older children. In general, cheerfulness, gentleness, patience, tolerance, characteristics of Down syndrome. Autism spectrum disease, 5 to 10% cases of patient of Down syndrome. Behavior disorder, depression. Next, please. Auditory manifestation include congenital, maybe acquired hearing loss, recurrent ear infection. Ophthalmic manifestation include refractive error, especially myopia, congenital and acquired cataract, blocked tear duct, glaucoma. Endocrine manifestation include congenital, maybe acquired hypothyroidism, diabetic mellitus, obesity, and infertility. Next. Down syndrome children. developmental milestone which are usually achieved Down syndrome children. I am given average month or range. Smiling usually achieved in at 2 months, rolling 6 months, sitting 9 months, crawling 11 months, standing at 10 months, walking 20 months, talking in word at 14 months, talking in sentence at 24 months. Next. Self-help skill which usually achieved Down syndrome children's eating, finger feeding at usually achieved at 12 months, using spoon fork at 20 months, toilet training, bladder controlled at 48 months, bowel control 42 months, dressing undressing at 40 months, putting clothes at 58 months. Next please. Prognosis: life expectancy for children with Down syndrome is reduced to approximately 50 to 55 years. Most frequent cause of death are respiratory infection and congenital heart defect. In additional, esophageal atresia with without tracheoesophageal fistula, Hirschsprung disease, duodenal atresia, acute leukemia contribute to mortality. Thank you.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. Sayali Misal for the paper presentation. Dr. Sayali, are you there?
Yes, sir.
Dr. Sayali, please mute the another Zoom connected device, doctor. And please start the session, Dr. Sayali. Hello, Dr. Sayali, can you hear me?
Yes.
Please start
Myself,
the
Dr.
session.
Sayali Misal. Today, I will talk about Shayya Mudrata, discuss with Samanya Parichaya Paribhasha, Vistrut Varnan, Nidan, Chikitsa, according to modern definition, types of neurosis, classification and treatment. Samanya Parichaya, introduction, Pratham Varnan, आहे आणि नंतर भावप्रकाशाने त्याचं विस्तृत वर्णन केलेलं आहे. डेफिनेशन मूत्र निर्गमन नियंत्रण प्राप्त होणाऱ्या वयामध्ये अंथरुणावर झोपले असताना नकळत आपोआप मूत्रप्रवृत्ती होणे याला शय्यामूत्रता असे म्हणतात. विस्तृत नेक्स्ट प्लीज. वर्षानंतर दिवसा व 5 वर्षानंतर रात्री अंथरुणात मूत्रत्याग करावयाचे थांबतो, परंतु 5 वर्षानंतर बालक अंथरुणात मूत्रत्याग करत असेल तर ती विकृती असते. ही विकृती मुलांमध्ये मुलींच्या तुलनेत अधिक आढळते. या व्याधीमध्ये मुख्यतः वातदोषाची प्रधानता असते. नेक्स्ट प्लीज. निदान 3 भागामध्ये विभाजन केलेले आहे. यामध्ये मानसिक कारण, त्रुटीपूर्ण पालन पोषण, शारीरिक कारण. मानसिक कारणामध्ये पारिवारिक तणाव, अत्याधिक नियंत्रण, अनाथावस्था असेल तर. त्रुटीपूर्ण पालन पोषण मध्ये बालकांचे पालन पोषण कसे करावेचे याविषयीचे ज्ञानाच्या अभावामुळे. शारीरिक कारणामध्ये मुख्यतः कृमी हे कारण आहे. नेक्स्ट प्लीज. औषधी चिकित्सा मूत्र व स्रोताला बल प्रदान करणारी औषधी कल्पे योजावीत. फॉर एक्झाम्पल वंगभस्म, त्रिवंग भस्म, बहुमूत्रांक रस, बृहत वरुण आदी कषाय.
अंत्रकृमी असेल तर कृमीनाशक चिकित्सा करावी. बालकाला रात्री झोपेत त्याग करावे. सायंकाळनंतर Next, please. In modern aspect definition, enuresis is defined as involuntary passage of urine by children beyond the age of 4 years for daytime and 6 years for nighttime. Achievement of bladder control 85% by 5 years and remaining 15% at a rate of 15 years per year. Only 0.51% no control at adolescent. Next, please. Types of enuresis. Primary enuresis, secondary enuresis. Primary enuresis, the child initially control bladder but again start after 3 to 6 months waiting bed at night. Other classification, diurnal, nocturnal, involuntary voiding occurs only daytime, and epidemiology, approximately 60% of children with nocturnal enuresis. Family history is also important and positive in 50% of cases. If one parent was enuretic, each child has a 44% risk of enuresis. Next, please. Treatment. No treatment is recommended in children below 6 years of age because of high spontaneous cure rate. Non-pharmacological treatment, motivational therapy, alarm therapy. Pharmacotherapy मध्ये impairment hydrochloride for 25 to 75 mg at bedtime for 6 to 8 weeks. Oxybutynin, anticholinergic drug, 5 mg nasal spray of desmopressin acetate. Next. Thank you.
Thank you, doctor.
Thank you, doctor.
Thank you for the presentation. Next, I invite Dr. Dhananjay Rajendra Burade for the poster presentation. Dr. Dhananjay, are you there?
Hello.
Hello.
Yes, sir.
Please share the screen, doctor.
Yes, sir. Sir, can you share?
Yes, doctor.
Just a moment, doctor. I will
Yes,
share
sir.
for you. Doctor, please start the session, doctor.
Yes, sir. Myself, Dr. Dhananjay Rajendra Borade, MD Second Year Guy Chikitsa Department. Today's my topic is Ahar and Vihara in management of Galaganda with special reference to hypothyroidism. Introduction. Hypothyroidism, a deficiency of a thyroid hormone, can disrupt such things such as the heart rate, body temperature, and all aspects of metabolism. Ayurveda Galaganda occurs when there is a mutation of vata and kapha doshas, predominantly kapha, which further result in disturbances of Meda and Majja dhatus, resulting in formation of Galaganda. Dushti of RasaDhatu plays a major role in pathogenesis. Many of Rasaj Vikaras, which have been mentioned in Charak Sanhita, are similar to the clinical features of hypothyroidism. Method and materials. Review of literature. Acharya Charak described Galaganda, Gandamala, etc. as a Ekashotiya, Ekadeshiya Shota in a Trishotiya Adhyay, and also elaborated the concept of Shota in Chikitsastana, but lacks of certainty of disorder caused by thyroid gland. Acharya Charak also include Galaganda in Nanatmach Kapaj Roga. Hetu. Aharaj Hetu, for example, Madhura, Guru, Shita, Atidrava, etc. Viharaj Hetu, Diva Swap, Avyayam, Sukhasan, etc. Mansik Hetu, such as stress. Samprapti. Hetu Sevanartha, Jatharagni Mandya, then Sama आहार रसा रस धातुअग्नि मांद्य सामरस निर्मिती and विकृत साम कफ निर्मिती. अस्तिक निस्न पिच्छलिता गुरु शीत गुना वृद्धि, मंद गुना वृद्धि, सर्वांग श्रोतो रोध, चयापचय क्रिया अतिमांद्य, विकृत धातु परिणमन प्रोसेस, विकृत रस कफ मेद अतिवृद्धी. And श्रोतरोधा cause शोथ भारवृद्धी, अचैतन्य, स्थौल्य, मंदबुद्धिता, निद्राधिक्य, वृक्षता, etc. Then result and पथ्य अपथ्य. अपथ्य स्निग्ध, शीत, लवण, सेवन and junk food, मैदा atoms, bakery product, etc. पथ्य उष्ण, तीक्ष्ण, कटु सेवन. Result and discussion. Although the thyroid disorder as such is not described in a classical Ayurvedic text, we have to come to understanding that it is a primarily imbalance of activity of Agni due to various hetus. There is a diminished Agni at the dhatu level. There is a shroto sanga. Consequently, the dhatu sarasara compromise leading to the both physical and mental symptoms. These pathogenetic factors have to be targeted with a special attention to strength of body, mind, and doshas. Conclusion. Time to time, it is proven that fundamental of Ayurveda are very strong, deep-rooted. Some topics like endocrinological disorder are overlooked and completely explained in the text. After making some efforts with correlated with Galganda and hypothyroidism, there is a future accept of treating such conditions. Thyroid function test, TSH normal range 0.3 to 4 milli-international unit per liter. Free T4 normal range 0.7 to 2.1 nanogram per dl. Free T3 normal range 1.4 to 4.4 pg per dl. Antithyroid antibodies TPO, AB, and TSI. Nuclear scintigraphy, FNAC of nodules. It is a test to be done for hypothyroidism. Thank you. गलस्य पार्श्वे गलगंड एक स्याद अंग गंडमाला बहुबिस्तु गंडे. Thank you, sir.
Thank you, Dr. Dhananjay. Next, I invite Dr. Anil Jadhav for the paper presentation. Dr. Anil, are you there? Hello, Dr. Anil Jadhav, are you there?
Hello.
Hello,
Yes,
doctor.
sir. Yes,
Okay,
sir.
okay, doctor.
Yes. May I audible, sir?
Yes, doctor, you're audible,
Yeah.
doctor.
Please, can you share my slide, sir?
Okay, okay, just a moment, doctor.
Yeah. Yeah.
Dr. Anil, please start the session, doctor.
Yeah. Yeah. Thank you, sir. My name is Anil Govindrav Jadhav, a final year PG scholar, Department of Dravya Guna, Sri Siva Yogeshwara Ayurvedic College, Hospital in Inchal, Belgavi, District Karnataka. My topic is pharmacognostic and phytochemical analysis of the Bhrungrajya and clinical version of the Taila in Khalitya. Yeah. Introduction. Lord Brahma has created all the creature of the universe, including human beings. While creating the creatures, Brahma has done an aesthetic job by giving the authentic touch to the being in this universe. Similarly, the painters paint the painting by giving the different color to it, so that the painting could look beautiful. In the same way, Brahma, while creating the human beings and giving the authentic touch to that, this creation could be look beautiful and attractive. Beautiful long hairs and attractive hairs of the scalp add the pulse factor in the personality, but the key to keep the healthy hairs and healthy status of the entire body due to the human, it is the duty of human beings in the same fast world that today, where the face of cosmetic changes in the lifestyle, more specifically westernized culture in dietary habits and made in their hairs and grow gray permanently in the fell down. The different type of oils, cosmetic shampoo, soap, and pharmaceutical like the Saundarya Sampradana all promote the growth to the hairs had made the condition worse. Next slide, please. Aims and objective of the studies. The main objective of the study is to compare the pharmacognostic and phytochemical analysis of the Bhrangraja and its clinical version in the Tela in Khalitya. Pharmacognostic study of the Bhrangraja and preliminary phytochemical analysis of the Bhrangraja Panchanga Churna to establish the standard of the Bhrangraja Tela as per the AFI standards. To evaluate the Kesha effect of the Bhringraj Panchanga Tela in Khalitya, we are studying two groups. Group first, Bhringraj Panchanga Tela for Sirobhanga and scalp applications, and Group B, Bhringraj Panchanga Tela for the Marsha Nasha. To evaluate the comparative efficacy of the Bhringraj Panchanga Tela, Abhanga Nasha, and different route of administrations. Please, next slide. Bhringraj plant have been mentioned in Bhratrais, Lagutrais, and Nigantuj. Like Charak Samhita, Bhringraj is mentioned in the treatment of Khalitya and Paritya, as also Shushruta also mentioned the Chikitsa and Skalpasthana. Bhringraj is used in the treatment of Khalitya and Palitya and played the important role in Kesha properties. Ashtang Sangraha also mentioned the Bhringraj mentioned in the treatment of Khalitya Paritya in the form of lepa or Shirojurgata Rogas and Ashtang Hridaya. It is also used in the treatment of Khalitya and Paritya as the form of Swarasa. Dhanvantari Nigantu also mentioned in the 8th chapter, 8 synonyms are available in the properties of also named in the Karaviradi Vargas. Next slide, please. Drug review. Bhringaraja, botanical name Eclipta alba, family Asteraceae family, habitat Indian Southern America, habitat erect or spreading annual herb, रस पंचकाज रस कटुतिक्त रस गुण लघु वृक्ष गुण वीर्य उष्ण विपाक कटु प्रयोगांग इज पचांग दोषकर्म इज वातहार and kafahara. Disease please next. Disease review. Khalite is defined as when the vata dosha get vitiated along with the pitta dosha and it goes into the room pupa and in the hair follicles and its result in falling the hairs. General etiology factor of zero roga can consider as the etiological factor of the Khalite such as Vriddha ahara, Pittavardhaka aharas, Viharas, Abhishandi aharas and sedentary lifestyle increases pitta and vata. Ayurvedic management of the Khalitya or Kalitya are Abhyanga, Shodhana, Lepana, Nasha, Rasayana therapies. Kalitya is compared to hair fall. That hair fall can manifested into the disease and independently disease as well as secondary other disorders can be present symptoms like many diseases. Chikitsa. Kalitya comes under the Urdhva Rogas and categorized under the Shudra Roga Nasha and this Sirobhanga are treatment mentioned in the Charaka Samhita and Ashtanga Hridaya. Next slide, please. Methodology. According to AFI standards, the three, sorry, Taylor was prepared as is Sneha Kalpana and Sharangdhara Samhita Madhyam Khanda as per AFI standard also. According to AFI standard, there are three essential components for the preparation of the Taila. Dravya, that Bhringraj Kashaya, Kalka is Bhringraj Kalka, and Sneha Dravyas like base Narikela Taila. So method of preparations, we are taking the 1 part of Kalka and 4 part of this Sneha along with 16 part of the Bhringraj Kashaya and making for Sneha Kalpa there are three types. It's Mrudu Paka Kalka, Madhyama Paka Kalka and Khara Paka. So for Marashanasha we are using the Mrudu Paka and for the Siro Abhyanga we are using the Khara Paka there. Method of administration. For Shiro Abhyanga, we are using the Kharapaka Tela. So we are taking the 10 ml of the oil for scalp application for 15 minutes. And for Maharshanasha, we are taking 16 bindu
Hello,
drops of
doctor.
the hello.
Doctor,
For
please
Nasha.
speed up.
Hello.
Doctor, please speed up.
Okay. We are studying for two groups. Patient 15 with the select was Shiro Abhyanga and 15 group B we are selected 15 patient for the Maharshanasha. Next slide, please. As we mentioned in the group, we have selected the group A 15 patient for Zero Abhyanga, doses like sufficient quantity, and Kala is evening Kala, that is Vata Kala, duration for 15 days. And for B group is for Nasha, that is Marcha Nasha, 16 drop for morning time period for 7 days. We are selected like that. And as per discussion, we see the man Whitney test, we get a good result in Maharsha Nasha. Next slide. Yeah, that much only. Thank you.
Thank you, Doctor. Thank you, Dr. Anil Jadhav, for the presentation from the emergency condition.
Thank you, sir.
Next, I invite Dr. Meenakshi Rajan Bhagwat for the poster presentation.
Yes, sir.
Doctor, please share the screen, Doctor.
Yes, sir. Okay, sir.
Yes, Doctor. Screen is visible, Doctor. Please start the session.
So, good evening. My name is Dr. Meenakshi Bhagwat from Sri Saptashringi Ayurveda Mahavidyalaya, second year, Kai Chikitsa. Topic for today is management of stolya according to Acharya Charak with special reference to obesity and its complication. According to WHO, obesity and overweight is defined as the abnormal or excessive fat accumulation that presents a risk to health. Obesity often results by taking in more calories than you require. Priorly, obesity was usually determined by the eyeball test. That is, if you see a person is fat, he is fat. But later on, with the advances, various ratios such as BMI or the Quetelet index, waist to hip ratios, waist circumference were developed for the determination of obesity. Now, BMI over 23 is considered as overweight and about 25 is considered as obese in India. This is because gradually over the world, when you see BMI over 30 is considered as obese. But for an Indian, there is always more body fat for a given BMI. Hence, BMI is 25 for an Indian people. According to the global burden of disease, over 4 million people are dying each year as a result of being obese and overweight. In the Ayurveda, in the beginning of Yojana Chatushka in Sutrasthan, Adhyay 21, Ashtonindatiya Adhyay, Acharya has explained the causes, pathology, dosha responsible, symptoms, and management of stolya. The Ayurvedic definition of stolya is Maunsamedati Vruddha Tvacha Chalasvika Gudastanaha Ayatopachaya Utsaha Naro Atisthula Uchate. Here also Acharya has explained Chalasvika Guda. Now we compared with the Ayurvedic modern definitions. We also compare the waist to hip ratios. Now Samprapti according to the Ayurveda is due to the Medovardak Ahar, the Meda Dhatu increases and blocks the Strotas. So this causes Strota Vrod. Then the Vata dosha gets trapped in the Koshtam. As Koshta is a place of Jataragni, this Vayu causes an Agni Sandukshan and the Agni becomes Tikshnagni. So then whatever the Agni is offered, whatever food is eaten, this Agni rapidly digests it. Hence, these people are constantly hungry and whatever they eat gets transferred into Meda Dhatu. If they do not eat food on time, this creates some upadravas. This situation has been described by Acharya as Eto hi dahanaha sthulam vanadavo vanam yata. Just as a forest fire destroys the complete forest, the same occurs in an obese person. Now, in modern perspective, the causes of obesity can be primary, as we discussed earlier. There is an imbalance in the energy uptake and the expenditure. But the other causes are genetic alterations, endocrine diseases, drugs, and certain neurological conditions. When we talk about the complications, in Ayurveda it is described as Vikaran Darunan Krutva Nashe Tashu Jivitam. That is, Charkacharya has correctly said that stolya person will get some Darun Vikar, will develop some severe disease, and then he will die. Acharya never said that he will die of stolya. He will die of some Darun Vikar. That is, there will be some complication of stolya. That will be a life threat. Now, according to the modern perspective, complication can be divided according to the type of obesity. As we know, there are two types, android obesity and gynoid obesity. Android obesity is the central obesity or the abdominal obesity, and it develops some metabolic complications such as coronary heart disease, diabetes mellitus, hypertension, hyperlipidemia. And the gynoid obesity is the fat when collected in hips and buttocks. This causes mechanical disorders such as varicose vein, disorders of joints, osteoarthritis, etc. Now, when we talk about the management, Acharya has correctly said, Guru cha patarpanam cheshtha sthulanam karshanam prati. That is, we use Guru Dravyas that are not easily digested. As we know, the Agni is Tikshnagni. And against and Guru Dravyas are against the Laghu Gun of Vayu, and Apatarpan that reduces the Meda Dhatu and the Kapha dosha. The main goals of the Chikitsa is to use Vatagna Annapanani Shleshma Medo Harani cha. Acharya has also said the use of Ruksha Ushna Tikshna Basnis, various churnas such as Guruchi, Bhadra Musta, Trifada, Vidanga, Nagar, Kshar, etc. has been described. But the Shrestha one, Acharya has said, Yava Amlaka Churnam cha Prayogaha Shrestha Uchyate. This is the Shrestha one. So when we talk about Yava, that is barley, it is a cereal grain known as Hordeum vulgare. It mainly contains beta-glucan. Beta-glucan is a soluble fiber that is present mainly in oats and barley, but the most of higher percentage, that is about 11.3%, is present in barley. This beta-glucan lowers the blood lipids level about 15% in hypercholesteremia men and women. It is also said when you provide a supplement a high carbohydrate diet breakfast to a patient and along with the barley, it reduces the postprandial sugar after the meal. According to the dietary guideline for Indians and National Institute of Nutrition, the glycemic index of barley is 28. That is, it has low glycemic index compared to wheat roti, that is 62, and rice, that is 78. Whenever the glycemic index is less than 55, it is always preferred in diabetes patients because it does not causes blood sugar level spikes. Barley also contains antioxidants that increases the immunity to provide protection against the free radical damage. This promotes the cardiovascular health and reduces the risk of colon. When we talk about the calorific value, when barley is compared to rice, barley contains twice the calcium and fiber, equivalent proteins, and 30% fewer calories to rice. Now, whenever we talk about the weight reduction management, according to the modern perspective, the first goal is to create the calories deficit. So, it is always advisable to create a 500 to 1000 kilocalories deficit in the diet of a person aiming for weight reduction. So, Yava fits correctly in the modern as well as the ancient management of stolya. The second Acharya has talked about is Amalaki, that is the Indian gooseberry. About Amalaki, we know Amalaki is Vayasthapanana, Mehe Shudhatri Nisha, Ayusham Vayasthapani Param. Acharya has also described it as Amrut Kalpam in the Rasayan Adhyay, Charak Chikitsa 1. But according to the modern perspective, if we talk about Amlaki, it is rich in polyphenols and vitamin C, that is ascorbic acid. Polyphenols are micronutrients that are antioxidants, such as phenolic acids, flavonoids, tannins. They offer protection against the development of certain cancers, cardiovascular diseases, diabetes, and neurodegenerative diseases. These antioxidants are so rich that it has the capacity to scavenge free radicals such as 1,1-DPPH. It reduces the lipid peroxidation and reactive oxygen species levels. In an animal study that was done on rats, it also limits the fibrosis formation in cardiovascular tissue that was subjected to ischemia and then reperfusion. The hydroalcoholic amla extract reduces the arterial mean BP. Amla is an anti-hyperglycemic, anti-inflammatory, anti-hyperlipidemic, and antioxidant. Acharya has also advised the use of basti, as we saw, Ruksha Tikshna Basti, for the management of vata and kapha dosh. These especially for the complications of obesity, of the gynoid obesity. As we the vata dosha and asthidhara has ashra-ashray sambandha, and this basti benefits in the management of osteoarthritis or the sandhigata vata or the mechanical stress created due to obesity. Now, when we talk about the conclusion, whatever the management is given by Acharya Charak, we have taken only the best part of it because Yava Amlaka Churnam cha Prayoga Sheshta Ucha. This is the best part of it. When we discuss it with the modern perspective, it makes us realize that the food or the drugs mentioned here already acts as a preventive measure for the complications of obesity. They are anti-hyperglycemic, anti-hypertensive, cardioprotective, reduces the cholesterol levels. So the major complications that are present due to the obesity are already included in this treatment. So the future disease is prevented. So when Acharya said the swasthasya swasthya rakshanam, aturasya vikara prashamanam is the main goal of Ayurveda, the treatment also follows it. The Ayurveda believes in Swasthya Rakshan, so the management of Sthaulya describes in Samhita not only treats obesity but also prevents its future complications. So Ayurveda is definitely a preventive and a curative science, both. Thank you.
Thank you, doctor. Thank you for the presentation. Next, I invite Dr. K.S. Vigneswaran for the paper presentation. Dr. Vigneswaran, are you there? Dr. K.S. Vigneswaran, are you there? Dr. Vigneswaran, are you there? Next, I invite Dr. Sayali Shivaji Jadhav for the paper presentation.
Good evening, everyone. So can you please share my screen or slide?
Okay, doctor. Just a moment.
Yes.
Please start the session, doctor.
Yeah. So good evening, everyone. Myself, Dr. Sayali Jadhav, PG Scholar Final Year, Rachana Sharir Department from BSDG's Ayurveda Mahavidyalaya, Wagholi, Pune. So today I am going to present the topic on ancient Ayurvedic and modern method of preservation of dead body. So Acharya Sushruta was an ancient physician who authored the Sushruta Samhita. So Sushruta believes that dissecting a body is very important to become a great physician or surgeon. So preserving this dead body with a good method is essential for this dissection. So Ayurveda considers Sushruta the father of surgery. A brief description of dissection and preservation by Sushruta Samhita. A teacher's theoretical knowledge and the practical knowledge observed in class should complement each other. The literature in the Ayurvedic science is collected in order to understand how the body is collected, where it will be preserved, and how it will be preserved. So, next slide, sir. So, dissection and preservation are described in detail by Sushruta. Sushruta Samhita emphasizes the surgical matters, including the instruments and types of the operations. He also believed that students aspiring to be surgeons should acquire a good understanding of human body through both inspection of the body's surface and also the dissection. Considering the obstacles that prevented the study of anatomy during the ancient Indian medical history and the advancement of surgery. Human bodies are sacred in Hindu text. Under Hindu law, no body may be violated with a knife, and those under 2 years of age must be cremated. He achieved his remarkable knowledge of human anatomy by using a brush type broom that scraped off the skin and flesh without actually touching the warps. So, next. According to modern preservation method of the dead body is like the cadavers play an important role in body science, and medical students often study anatomy on cadavers before moving on to the living patients. Students are taught with surgical models and technology in many schools. Hands-on learning still needs the cadaver. The removal of the appendix is performed 28,000 times a year in a United States using cadavers instead of technology stimulations. Medical school students have the opportunity to study the gross anatomy, which studies the visual structures of the body. Over the past 200 years, cadavers have been preserved differently. Due to lack of adequate methods to prevent the body from decaying quickly, cadavers had to be used immediately. Although it leaves yellow stain in the tissue, glutaraldehyde was the first chemical used in embalming and preserving body. But nowadays, formaldehyde is the main chemical used in embalming. Next, aim and objective of my study is to explore the knowledge of preservation of the dead body and also to know the difference between the modern and Ayurvedic method of preservation. Next, examples of preservation of dead body in the Vedic period. There is a reference regarding the preservation of dead body of Raja Dashrath in Tailadrona, and also a very well known example, the pyramids of Egypt are also known for the preservation of dead body. Next, review of literature. In order to become a physician or surgeon, preservation of dead body for a longer time without affecting the body is important. So in Sushruta Samhita 5th chapter, shlok number 61, describes the dead body preservation, which is also known as Mruta Shodhan Paddhati. Ayurvedic preservation is totally different from the modern one. Purpose of preservation according to modern is to save the body for the longer time and for easy see any structure or organs. Next, points important to preserve a body. According to Ayurveda, dead body have to have all the body parts. Death is not due to any disease. Death is not due to poison, or dead body have
Doctor,
age. Sorry.
please speed up.
Oh yeah, sure. So this is the table which describes Ayurvedic and the modern. Then the next the preservation materials used according to Ayurvedic and according to modern are been put in the table here. Next, so in our Samhita, methods of preservation in Ayurvedic was first all the antragat mala is removed and the banding is done. Then it is kept in cage and put in the cold slow river for 7 days. So in modern, it is different. It is in femoral artery, which is present in the femoral sheath. The cannula is fixed in there, and the preservation material has been put in the body. Next, old text provides evidence about the preservation and dissection of the dead bodies. So Sushruta recommended preserving dead bodies in slow moving river. Uh, uh, According to Sushruta, we should preserve dead bodies that contain all parts, and the chronic disease should not be there, since it may change the body internally or externally. Then also the decomposition may occur due to the poison in the dead body. It should be due to natural death. Then next, conclusion. Next, so dead bodies must be preserved and are important for dissection. Ayurveda and modern science explained it differently, as we saw. Ayurveda preserves it naturally, more in a more natural way, whereas many chemical agents are being used in modern methods. Hence, Ayurveda method of preservation is natural and safe and simple to use, and we can preserve a body at a minimum cost. Thank you.
Thank you, doctor. Thank you for the presentation.
Thank you, sir.
Next, I invite Dr. C.T. Rishi Underwade for the paper presentation. Dr. C.T. Rishi, are you there? Dr. C.T. Rishi, are you there? Okay, we are come up to the end of the session. Dr. Sonali Bausavik Shalage, are you there? Dr. Sonali Bausavik Shalage, are you there? Dr. Jayashree Totaram Vakmare, are you there? Dr. Jayashree Totaram Vakmare, are you there? Dr. Sushil Rohidas Ranjane, are you there? Dr. Sushil Rohidas Ranjane, are you there? Dr. K.S. Vignesharan, are you there? Dr. K.S. Vignesharan, are you there? Dr. C.T. Rishi Andravade, are you there? Dr. C.T. Rishi Andravade, are you there? Okay, we are come up to the end. The third day of Sampuraka National Seminar has been concluded at this moment. I would like to invite our paper presentation coordinator, Dr. Aiyesha, to conclude the session.
Thank you, Dr. Sabin. So, dear all, as we draw the curtains on this seminar, I extend my sincere gratitude to our esteemed faculties and participants. Your active involvement and contribution have been instrumental in making this event a success. So, as we part ways today, let the connections we have forged and the knowledge we have gained serve as a catalyst for our future endeavors. So, on behalf of Team Ayurapta, once again I express our heartfelt appreciation to each one of you for making this seminar a truly memorable and impactful event. So thank you all, and we hope to see you all again. We'll meet you soon. Bye.